Guy, could you make that motion? To authorize Dr. Warner to
I'd like to make a motion to authorize Dr. Warner to participate electronically.
Do we have a second?
Second.
Okay, we have a motion and second. All in favor, say aye.
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 All opposed? Okay, that motion carried unanimously. Could you poll the board, please?
Yes, ma'am. Dr.
Poll the
Chase?
board, roll call.
Dr. Chase? Oh, not here. Ms. Guy?
Here.
Ms. Halstead?
Here.
Ms. Healy?
Here.
Ms. Randall? Ms. Siegmund? Here. And Dr. Warner?
Yes.
All right. Madam Chair, you have a quorum.
Okay, do we have a motion to approve the agenda? Please?
I move to approve the agenda.
Okay, motion by Ms. Sigmund. Do we have a second?
I second.
Second by Ms. Halsted. Any discussion? All in favor, please say aye.
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 Opposed? Motion carries unanimously. That was an aye, right, Dr. Warner?
Yes.
Okay, thank you. All right, that brings us to discussion of COVID-19 mitigation strategies.
Thank you, Madam Chair. I'd like to ask Dr. George Hummer to come forward. He has a presentation to share with the board. We've received some new information since this was last presented as an information item to the board. And Dr. Hummer, if you'd like to come forward and share your presentation, and we'll certainly share the guidance that we've received, as well as take any questions that the board may have at this time.
All right, thank you, Dr. Taylor, appreciate that. Good late afternoon, I should say. Typically we say evening, so good late afternoon, Madam Chair, School Board, Dr. Taylor. As Dr. Taylor mentioned, we have some updated guidance that we wanted to present to you for action tonight, as well as we will discuss the potential mask optional process if you all move forward with rescinding the mask policy this Thursday. So our current priority, as we've been discussing over the last 3 years, is continuing to keep our staff and students safe, as well as continuing with in-person learning. So what I'll be presenting to you today is we are going to discuss our current mitigation strategies, as well as the updates as we've received on 1/21, 1/26, as well as February 1st. So since the new guidance has come out, there's been updates, there was a frequently asked questions document that came out, and we are continuously meeting with the health department weekly. So I want to make sure that we share all that information with you today, and it's going to go into our proposal for you for consideration for action. Then we're going to talk about the pros and cons of the Test to Stay program, as well as we'll review implications and other items to consider with learning as we continue to navigate this pandemic. And then, as Dr. Taylor mentioned, we will discuss the potential process for the mask optional. So why the change? We are continuously transitioning from a pandemic to an endemic. So with new information coming out over the last 2.5 years, there is new data as well as research that has come out for us to continue to move forward with updates in these mitigation strategies. There are new variations to this virus that is coming out, so we want to make sure that these new strategies match the new virus, as well as the contagious period and the transmission rates. So our rates still continue to be high, as well as our transmission rates. However, most of the cases that have been reported are either asymptomatic and they are less severe. The contagious period is also been reduced, and the Omicron variant has a lower incubation period, as reported by the Virginia Department of Health. So let's go into our current mitigation strategies. We still continue to recommend and propose the universal masking mandate because it falls in line with a lot of our other strategies, one of them being our social distancing. So we were able to open school up with all of our students because we were permitted to reduce down to the 3 foot with masks, so we will be able to continue to do that with the universal masking. If that goes away, that will pose some difficulties with making sure that our students stay safe when they're only socially distancing 3 foot apart. So that's one thing to keep in mind. We are also contact tracing every case that comes into our buildings. So from primary contact to staff and students, as well as positive cases, and we are reporting all of those cases to the health department as well as through our dashboard. And then if you were determined to test positive, you are required to do a 10-day isolation. And then if you are considered a primary exposure, you can quarantine for 7 days with a negative test or 10 days without. And some families are still choosing to do the 14 days. And of course, regardless of what you choose, 7, 10, or 14, it is recommended that you continue to monitor for symptoms in case that you do develop symptoms later on during your quarantine time. For the rest of these align with all of the strategies that are outlined in that new guidance that I mentioned to you all, the thorough cleaning, the upgraded ventilation system, good hand hygiene, that still continues to be an effective strategy. And then of course the virtual option for students, which I'll get into in a little bit. Here are our numbers as of 1/31. Now, of course, we've had new numbers that have come in, so I want to make sure that I draw that to your attention. And two other numbers I want to draw to your attention as well. The first one is our numbers, as I said, continue to be high. However, on a positive note, our in-school transmission numbers continue to be small. And we attest that to many different variables, from our current mitigation strategies to our increase in vaccination rates in our buildings, as well as everything else that we are doing to navigate this pandemic. So that number continues to be small, and we want to make sure that that number continues. So the VDH guidance, as I mentioned, does talk about a lot of different strategies that we're going to continue to do, but there are going to be some updates to strategies that we are going to be proposing to you tonight. Reduction in quarantine and isolation days, we're going to be discussing that again. Reduce the number of staff and students that are required to quarantine. Only contact tracing high-risk cases, which I'll get into in a second, as well as we no longer have to report every single case to the VDH. We only have to report outbreaks. And that is 3 or more. It was 2 prior to January 1st, and now it's 3 or more that are epidemiologists, that's a word, mouthful there, epidemiologists connected, or if there is a connection between 3 people. So that is considered an outbreak. Okay, so for prioritizing contact tracing high-risk scenarios, that is going to be for essential workers, teachers, students that have comorbid or immunocompromised staff or students, high transmission areas such as PE, chorus, athletic events, not lunch, that is not considered a high transmission area, so we won't have to contact trace that situation, or if we have an outbreak, we will have to contact trace those cases. Next is reducing isolation requirement from 10 days to 5. However, when you return on day 6, if you don't have symptoms any longer and you're fever-free, you are required to wear a mask for 6 to 10 days. That is separate from the universal masking mandate. For quarantine, we're going to go from a requirement to a recommendation. So quarantine will no longer be required, and it will reduce down from 7, 10 to 14 down to 5. However, the same requirement, if you return on day 6, you'll have to wear a mask from day 6 to 10. If you're not an exempted, or whatever your accommodation is, you would have to follow that for that 6 to 10 days. We will still provide notification to families and staff, and we are going to continue to track our cases locally to determine if there are any impacts to our classrooms, to staffing, to our buildings, and if we need to make a decision to go back to our original mitigation strategies to prevent the spread of this virus that impacts our staff and our students. One other piece that I would like to mention with this is we will continue to collaborate with the health department to determine if any outbreaks are impacting our staff, if we have to close a classroom, if we have to close a building, or if we have to increase our mitigation strategies. And then, of course, Cabinet and you all will be notified if we have to close any classrooms or any buildings. So I want to make sure that you are aware of that. So the Test to Stay program is very similar to the VISTA program that I presented to you all a couple months ago. We are not recommending that we move forward with this, but I just wanted to present this to you to let you know that this is an available option for any school division. As you can see, there are some potential additional layers that would add to our mitigation strategies with determining students that are primary exposures and test positive, so we'll be able to track those students. It does add an additional layer. However, part of this program is we're only required, if we move forward with it, to test students that are primary contacts, staff or students, and they're unvaccinated. So that is a piece of this particular program. This is a program from the VDH and the VDOE, so we don't establish that criteria. And then the cons, of course, is the practicability. It is going to be an additional burden on our staff because we will be responsible for the testing. We will be responsible for tracking down consent forms. We will be responsible for everything that goes along with this process, and we do not want to add an additional burden onto our staff, especially for our nurses who have been working so hard with this contact tracing and keeping up with everything. Just want to put that little plug in there for them. They've been doing a really, really good job, and I thank them very much for their hard work and what they've done for us this year and years past. And then, like I said, it is similar to the VISTA program. However, the VISTA program was once a week. The Test to Stay program is daily. So again, it would be a lot of additional work for us. And if we do move forward with these proposed mitigation strategy changes, this would be another reason why we wouldn't have to move forward with the Test to Stay program. And then again, if we have any questions at the end, I'll be more than happy to answer those. The implications on learning, we are going to continue with the virtual option for our students for the remainder of this year. And that is for students that are quarantine or isolation or choose to go full virtual for the remainder of this year. With that being said, if they are requesting that, it should go to their principal. And there is still an expectation that they need to complete their work and they need to attend. So they are still considered our students, so we need to continue to track those students. To talk a little bit more about next year, however, we are not considering this as an option for next year because we realize the additional burden this puts on our staff and our students and our families. So this is not going to be something we're going to be looking into next year. However, we are going to be looking into other options and exploring those options for virtual for our students and expanding what we were doing pre-COVID. Because we've always had a virtual option for students. We're just looking at expanding of what that looks like. So more to come on that. I just wanted to mention that because I know the board has had a lot of questions in regards to concurrent and virtual learning. Wanted to give you an update since, I want to say January 24th, whenever we move forward with that the extension of the mask exemption process because of Executive Order 2. These are the total number of mask exemption requests as well as approvals. I do have one note to mention in regards to middle schools. I know you see that 0. However, this was reported on 131, and if I'm not mistaken, I think we've had 1 or 2 requests come in after 131. So middle school does have at least 1, maybe 2, and then it's for the other levels as well. And this has always been a process even prior to the January 25th date with exemptions as well as honoring accommodations for students in regards to wearing a mask. Okay, so in summary, our recommendations are to reduce isolation days to 5, still making that a requirement if you test positive, reducing our quarantine days to 5 and reducing that to a recommendation. So no longer a requirement, it will be a recommendation just for those cases that were in a high-risk scenario, the cases that I listed earlier. And then staff and families will continue to be notified of positive cases. So these are the strategies that we're proposing for you to consider for action tonight. And now I'm going to jump into the review of the potential process for mask optional.
Actually, Dr. Hummer, if you want to take a pause at this time and see if there are any board questions or anything about the recommendations, and then we can close out with the rest.
Yes, sir.
Thank you.
Can you pull the recommendations back up? So
Absolutely.
We can have those
Uh-huh.
when we're discussing. Any questions for Dr. Hummer or comments? Ms. Sigmund?
Yes, Ms. Sigmund.
I think you lost me on the contact tracing for high-risk situations.
Yes.
I understand for like PE chorus, like when you have that big group. But when you're talking about these individual health circumstances, are those self-identified people or?
Correct. So if we're
My child had a health concern, I would say I would like you to always notify me, for example.
Correct.
And that would just happen versus us having to figure out who is and who isn't.
Correct.
Okay.
Yeah, because the classroom, if the child was in the classroom, they will still be notified that there was a case in that classroom, and then if the parent reached out and said, hey, my child has some sort of condition, we would like to quarantine them, they would have that conversation with that staff to talk through that. And that happens right now.
Sure.
So
Sure.
that is something that we talk through with
just-
our families.
The way you explained it before, it all of a sudden seemed like a lot of ifs, and I wanted to make sure it was going to be simple, as you said, for the staff who would be doing the tracing.
Yes, ma'am, and it is a complicated process, as you can imagine, and we will definitely work with our nurses on that, and like I said, they've been doing a really good job, and they're providing a lot of feedback to us, so if there are any issues with that, we'll definitely collaborate with them to make sure we get this process more fine-tuned.
Sure,
Thank you.
great.
Madam Chair.
Oh, you know, you're in the space here. Usually we
I
have.
know, I'm in this,
Sorry.
I'm in the other space.
Dr. Warner.
Yes, just one quick question. Is there a significant lag time? What is the lag time between when we know there's been some positive case in school and the ability to reach out to parents? Is that pretty rapid, or what is that like?
I will say it's case by case, Dr. Warner. In some instances, we find out right away. In other instances, if a child goes home not feeling well, then a couple days later they get the test results, we might be notified 3 to 5 days later, and then we have to notify the families. And sometimes families, which rightfully so, they get upset because they're contacted on Monday, but they were exposed on Wednesday. They're like, wait a minute, why did it take so long? It's not because we're dragging our feet, it's because we didn't get that positive result until Sunday. And then, of course, we notify them on that Monday. So I don't have hard data on that, Dr. Warner, but what I'll share with you is that it ranges, and most of the time we do get reports right away, but other times it could range.
Yeah, it's just given that this has a shorter incubation period, that notification seems a little more critical. So I was just curious.
Yes,
And
ma'am.
I realize the logistic problems with trying to do this,
Mhm.
especially with the testing lag. Thank you.
Yeah, thank you.
Ms. Sigmund had a follow-up.
Can I just build on Dr. Warder's question?
Sure.
But that means that once we have the information, our families are notified same day, basically?
Pretty, I wouldn't say every time,
I don't know
for the
how
most
long that
part.
process takes to identify and then notify,
We
but
try to contact the families the day of, but sometimes for our nurses and our contact tracers, when we have 150 cases, sometimes it might be the next day, but we try to contact the families within a 24-hour period when we're notified. Yeah.
Ms. Halsted?
I have just a couple questions. So the first one is, going back to can you explain again what you said about the unvaccinated people? There was something you said about the unvaccinated people, and I don't know, was that under current mitigation strategies, or was that?
It was probably,
It was in the test, okay, it
Mrs.
was
Halsted,
in
yeah,
the
it was here,
test.
yeah.
Test to stay program.
So the Test to Stay program, which is established by the VDH and the VDOE.
Okay.
They have stated that if we move forward with this program, they would only test students that were primary exposures and were unvaccinated. And I think the reasoning they go by that, now again, I don't know, but it's because if you are vaccinated, you aren't required to quarantine. So they're saying if you're unvaccinated, you're asked to quarantine, so that's why they're testing you.
Okay, but that's
Yeah.
only under this program, right?
Yes, ma'am.
Okay, yeah, no, I'm not for that anyway, but I wanted to make sure that I wasn't misunderstanding where that was. So that being clarified for me, if we could go to the next question, which is, so prioritize contact tracing. Are they redeveloping their algorithm for how they're doing the contact tracing? I mean, I don't know how deep they're going into the tracing, but we're saying like, oh, student A was in band class with this kid, right? Are we going out to, hey, where'd they go? Did they go to church that week? Did they go to the supermarket that week? Or are they keeping it, are we focusing strictly now on schools?
We are specifically focusing on schools.
Okay, so we're not asking our staff to go any further than this level?
Correct.
Okay, and then the recommendation from that is 5 days if you're sick, stay home. Okay, and then the recommended quarantine is,
5 days.
we're not asking healthy kids, we're asking, who are we asking?
So we are
Or
asking
recommending?
any staff or student that was in any of those categories that I mentioned. So if you are an essential worker, a teacher, a immunocompromised or comorbid condition,
Okay.
high transmission, and an outbreak. So in each of those areas, we will contact trace, and when we notify those families, and you are recommended to quarantine, it is up to them to decide if they want to quarantine their child. And the staff member has a right to say, well, I'm feeling fine, I'm going to continue to monitor my symptoms, and then they can come into work.
Okay, so it's now their choice
Correct.
about whether.
Correct.
Okay. And my last question, the virtual option that the state of Virginia has, I can't think of the program name, I want to say What, is it
Well, there's
Virtual Virginia? Don't they call it?
2 versions.
There's two, okay, so
K-12 Stride is elementary.
Okay.
And then Virtual Virginia is middle and high. Please, chiefs, chime in if I'm.
I was going to say, and I don't want to put any other burden on it, but so is that something that we have the power to expand?
Their enrollments are full.
That's easy enough. All right, that clarifies it. Thank you.
You're welcome, Ms. Halsted. Thank
Ms.
you.
Guy?
I just want to make sure I understand, because I
Sure.
got slightly confused, but maybe I'm understanding it wrong. So under the new updated mitigation strategies, it's just everyone's choice to quarantine or not?
Correct.
Okay.
Yep. That's simple terms, yep. Mhm. Yeah.
Dr. Chase, did you have any questions? No? Ms. Randall?
And my question is, in all of these, when they're contacted, either for isolation or for potential quarantine, are vaccination statuses required or asked?
They're still asked, because if, again, we didn't establish that if you are vaccinated or not, if you have to quarantine. That was established by the health department.
Right. But-
So we would ask if you're vaccinated or not. And if they say no, then we would say then you are required to quarantine, but it's your choice if you choose to quarantine or not. Now, they could say, I don't want to share that information with you, and then we would recommend a quarantine for them. But they
Okay.
still have the choice to say, I want to quarantine or not.
Okay, and so just out of curiosity, what are we doing when we get that information that if a nurse is asking a parent about a child's vaccination? I mean, it's different, I think, for staff, they can speak for themselves, but what are we doing with the child's vaccination information? Who's getting it, where's it going, and how is it being recorded?
Yes, so we have a secure, confidential spreadsheet that we have all of our cases on to determine who was a primary contact, who wasn't, vaccinated or not, and then what days you have to quarantine or not. So we have a spreadsheet that we document that information. And it's a lot of work, because it's our nurses, our central office staff, we all have to track all that information, and we keep it in a secure location.
So is this reduction in, I'm going to assume, since VDH isn't interested in knowing our cases per se, is it contact tracing going to be a lot easier for our staff this way?
Absolutely.
Okay, thank you.
Absolutely. Significantly.
I have a everybody's been through. I have a question.
Sure.
So if the vaccination status doesn't make a difference in our recommendation, why are we even asking for it?
Because it's still part of the quarantine guidance. You have to quarantine if you're a primary exposure and you're not vaccinated. So that is part of the criteria to determine if you have to quarantine or not.
But I thought we're saying we're recommending it.
We're recommending,
So are we
excuse me,
requiring it?
recommending.
Okay, so if we're not requiring it,
But it's a requirement to determine if you have to quarantine, and then we would recommend the quarantine. So it's a two-step process.
okay, let's get back to the beginning. You said it's a requirement
To
for-
determine quarantine,
to determine,
if you had to quarantine, then that's the. for
but
you-
that's where my question is. So if we're not going to require it either way, we're going to recommend it in all cases. Why do we have to determine if you have to quarantine?
Because the determination if you are going to quarantine is contingent. One contingency is if you're vaccinated. So if I call a particular parent and say, your child was a primary exposure, and they say, well, my child is vaccinated, you say, thank you, please monitor symptoms, let me know if you have any questions. But if the parent says, no, my child is not vaccinated, we would recommend quarantine, and then the parent would say, you know what, I don't want to do that, I'm going to continue to monitor symptoms, and we say, okay. So that's part of the quarantine.
Madam Chair, can I just interject? So I spoke with Dr. Obasanjo pretty in-depth the other day, and I think one of the reasons why is there's still sort of this perception, although from what I gathered from him, they're working to sort of work to educate folks on it, that if you're unvaccinated, you're more at risk for severe illness. So with that not being qualified yet, I think that's why they're still asking. But I'm not sure that it's an appropriate question to ask someone. Him and I spoke for a little bit on HIPAA and privacy laws, and if it gets into that range. But I think as they move forward, they're going to look to strip that question away. And that's just the impression that I got
Right,
from him.
and as
I
Ms.
think
Halstead's
as long
saying,
as the
it's
choice is
evolving.
there.
Right.
And the child can deny can say, I'm not comfortable answering that. You
Absolutely.
said that, right? Okay.
Absolutely, absolutely.
But I'm still going back to the question. If it's not going to be a determinant factor in what we recommend, because we're going to recommend it in all cases, is that correct? Do I understand that correct?
Correct.
Okay, so we're going to recommend in all cases. I don't understand why we're requiring people to provide this information, because we could in effect say, well, the health department recommends or that you quarantine if you haven't been vaccinated. We don't need to know if they have or not to give that advice out. Would that not affect the same result, that the recommendation would be there if they were in fact not vaccinated?
I mean, I don't have the authority to change the criteria for what quarantine is. If that's something that the board would like to change how we ask those questions, we'll abide by what you're asking us to do. I'm just reporting out on what the quarantine states. And in order to determine if you have to quarantine or not, it's saying you have to be vaccinated.
That's where my problem is. You're saying in order to determine if you have to quarantine, but we're saying you don't have to quarantine. So I'm trying to get these two statements to match. So you either have to quarantine or you don't have to quarantine. If you have to quarantine, there's going to be certain criteria that requires you to. But my understanding is in this instance, we are not going to require quarantine. We're going to recommend it. So if we're going to recommend it, then we shouldn't need to know that information. I mean, when you say we have to quarantine, what is that based on? Because that's not what I
So
see here,
the
and that's not what I've
the basis of
understood.
quarantining is contingent on a couple variables. It's contingent on how close you were to the person who tested positive, how long you were exposed to that person, if you were wearing a mask or not, and if you were vaccinated. And the quarantine guidelines have been established by CDC and VDH, and that is what we are following. So those 4 questions will be asked to a parent or to a staff member, and based on what they answer, that's when that particular staff member made the call will say, based on this information, we are recommending that you quarantine. And that staff member or parent can say, I don't want to quarantine, and we say, okay, continue to monitor symptoms and let us know if you do get those symptoms. So we can't eliminate one of those pieces, because that's a piece to determine the quarantine. I get what you're saying and acknowledging that, but that's part of the quarantine guidelines to determine if you have to quarantine, not requiring
Again,
it.
you're saying if you have to quarantine.
Madam Chair.
That's what's confusing me.
And it's not have to. It's
Right.
whether or not we're recommending.
Correct.
But we're
So-
recommending to everyone.
Right. And so I think to Dr. Hummer's point is, in the protocol of questioning, if you answer in the affirmative, there is not even the proposition of recommending a quarantine. But if you answer in the negative to any of the questions, they're at least doing the due diligence to recommend a quarantine.
Because I thought he said we're recommending it in every single case. Is that,
Not if you're masked, vaccinated, and
So-
all the other affirmative
Correct. So-
questions that he asks.
okay, then I misunderstood, because I thought you said we are going to recommend it in all cases, and it will be the person's choice whether to quarantine or not. But that's not what was said. Okay. All right, but I'm still going back, and I understand, that the recommendation is if these are certain factors. But another way to approach that would be to say, if you have been A, B, C, or D, then we recommend quarantine, without saying answer A, answer B, answer C, answer D. So then we're providing the information, but we're not taking that information and keeping records of it.
Sure. Yes,
So
ma'am.
would that be a way to approach it?
Absolutely, yeah,
Okay.
absolutely.
Madam Chair, if I may, actually, that's a wonderful middle road solution.
Yeah.
And actually takes us out of the data stewardship department that I think is a challenge for us, because it is one more thing to manage, and creating the disclosure that you're talking about instead of asking the questions is a good solution.
I like that, yeah.
Dr. Chase?
So in that line, can we stop taking vaccination information at all from students? So no longer require, when students start kindergarten, that they provide proof of any vaccinations?
Madam
That's
Chair?
Code of Virginia.
That would
Well,
certainly
one is
reduce our data.
no.
That would certainly reduce the data that we need to keep track of,
Well,
right?
This discussion is with the COVID-19, and if that's a discussion we want to have, we can address that, but I think that may be a matter of what we are required to do. It sounds
Yes.
like this is an option. So if you want to have that discussion at a later point, we can certainly, bring that up. But right now, I don't want to muddy these waters any more than they're
Right,
already
right.
muddy. And I apologize. I'm just trying to understand.
Sure.
What it is. And I think I got it now.
I apologize if I was confusing or,
Well, no, it was just to say we have to do it, but we're not. We're recommending it. But my preference would be not to require the answers to those questions, when all we're simply going to do is say, if these are the facts, then we recommend it, which would attain the same result. And if it
Correct.
helps staff in not having to collect data, that's even
Better.
another benefit.
Madam Chair, just to also interject, I think, and again, I had a long conversation with Dr. O, so we did talk about some of that, and I do think that's probably their layered strategy moving forward as well. But just to speak to certain things, yes, kids have always been vaccinated or not. Parents have always had the option, and we never turned a child away for not being vaccinated from all the other things that are out there. So to speak to Dr. Chase's issue or comment, in terms of vaccination, we've never turned a child away for not getting a polio vaccine or a measles vaccine because that was a parent choice. So I feel like we're finally working our way back around to that with this one. And I think it's a great way for us to start moving forward to make the recommendation, like she's saying, instead of a lot of people, this is a tense situation, so a lot of people, when they're asked that question, are very upset about it. So I think to Madam Chair's point, it's a good way to diffuse an already upsetting situation on both sides, I would hope, at this point in the game. But I do think VDH does have some strong stuff coming out. And a lot of it does speak to that. And I've asked Dr. Obasanjo if I could keep in contact with him if he minded that. And he also he gave me a cell phone so I could call him and ask him, other questions. So I can appreciate that we've taken this effort to do this. I just want to say one thing, though. If we want to move past the pandemic, I think we stop calling it pandemic. At this point, pandemic, from a public health perspective, is the geographical dispersion of an illness or disease which requires certain actions to take place. Epidemiology gets activated, all of this stuff, special provisions go in place. So it might help us to bring it back down to COVID. I don't know what you want to call it, but the word pandemic now is, I like COVID endemic, if you want to change it to that, or if we're going to just start focusing locally and not just globally, we can call it our COVID epidemic. But at some point, we have to start taking that fear out, and I think we do that by stop using fear-based words, and pandemic is one of them. And that's just a suggestion, because I don't know how much documentation we'll be putting out moving forward for mitigation strategies, right? So if we are writing up information for mitigation strategies, maybe we refer to it as COVID-19 or SARS-CoV-2 or whatever it is, and maybe just play around with the words a little bit. Just a suggestion.
So you don't have to respond to that, we'll put that in Dr. Taylor's basket. I did want to say, we may need to get some more information about the vaccines, because to my recollection was that there is a certain vaccine going from, in middle school, that is absolutely required for students to be in class. So if we could, just get some information, I may not be
There is.
correct.
We can,
but I
per the
think
code, there
I
is
remember that.
vaccines that
Yeah,
students
by
are required,
law.
yes.
But that was like a middle school. And that was a long time ago that I had, personal experience with that. But, it's something that it would be helpful, not immediately to have that information, but.
We can get that to
we
you,
could-
yes.
And we may want to have another work session if, it's at some point in the future, but now we're dealing with the, not next week, yes.
Can I
Ms.
ask
Sigmund?
one quick tech question?
Of course.
When you say that this is kept in a secure document, are we talking HIPAA, FERPA compliant, or just locked locally? Like a secured locally Excel sheet?
So if And Colette, please help me with this. When we first moved forward with the securing our information, the document that we're securing in is HIPAA compliant.
Okay,
We did look into that with our technology department.
yes.
Yes, correct.
Let's check in with Dr. Warner. Do you have any questions or comments, Dr. Warner?
No, I had emailed Dr. Hummer earlier and gotten some additional information that I was looking for. Thank you.
Okay, so any other questions on this proposal? Is there any objection to the board? We're obviously not taking action here because it's a work session, but when this comes back to change the, and I'll just call it the communication, to, rather than ask those specific questions in a Q&A, to make a statement, if any of these factors apply.
We recommend.
Yeah, well, you can just say, I mean, I don't know, we're recommending in all cases. Is that, I know I've asked this before, but we are recommending in all cases. Is that correct?
We're recommending quarantine in all
Yes.
cases? No.
No.
We're recommending quarantine for the 5 high-risk
Okay,
areas.
all right, so then we can list the 5 high-risk, we list the factors and say, if any of these apply to you or your child, then we recommend quarantine.
Correct.
Rather than getting 5 answers, having to put that somewhere, track it, and do what with it? I don't know. If we're not required to keep it, I don't know why we would want to put ourselves in the position of gathering that data. And in some cases, people, would see it as, a.
Well, we would have to track our local numbers of positive cases to
Well,
determine outbreak.
But I'm
and-
talking about the answers to those
Gotcha,
questions.
gotcha. I just want to be clear on that.
That's correct.
yeah.
Oh, yeah, that's not an issue. But we are not required to get the answers from anybody on those questions. But we could say, if any of these apply, we recommend the quarantine.
Perfect.
Is there any objection to the board with that change being made when it comes, because this is going to come to us this evening for action? Okay, is there any questions or any concerns about any of these recommendations that will be coming to us for action this evening? Because now is the chance to have this discussion. We're good, Ms. Randall?
I'm better with us asking, or saying if any of these apply to you versus asking and collecting, unless it is something that you need to collect to give to VDH or to have for yourselves. If Colette's nodding yes, you do need
Well,
that?
If it becomes an outbreak, we're gonna need that data for the VDA. So as we get cases, if they're epidemiologically linked, which would be somebody who is exposed to a positive case, becoming positive from that exposure.
Well, could you come up to the microphone, because poor Dr. Warner's out here in cyberspace, and I'm not sure she can hear from the
So
audience.
when we're looking at our cases, when we do the contact tracing, we ask those questions because later on in 3 days, when the 3rd person down on the list becomes positive, and then 2 days later, the 4th person down on the list becomes positive, that's now an outbreak. That information then gets sent to the Virginia Department of Health because it's an outbreak. So when there's 3 epidemiologically linked cases, the questions that the VDH wants are they vaccinated or not? And their contact information and their symptomatology and their date of symptom onset.
Okay, you said the VDH wants.
That's what they're- that's-
Is it a requirement?
That is
or
what they're
a
requesting
request?
us to gather for them to give them for an outbreak.
Madam Chair, I'm going to have to interject. So it's my understanding that the VDH is no longer contact tracing or doing any of that tracking at the moment because the Omicron is moving so quickly and it's symptomatically, the incubation period is so short that it's almost impossible to link epidemiologically the cases by exposure. So it's not something they're going to continue to pursue. And again, as I understand it, it's because they're completely short on staff, and their staff has been pulled strictly to COVID, and now they're being pulled off to other initiatives which are COVID recovery focused. So that is something that I did not get it all from VDH in my discussion with them the other day. I can understand if we have an outbreak where there's severe cases of illness, but given Omicron and the fact that I was literally told Omicron has become the blessing in disguise for COVID cases, as it found a way to survive and it's happy. So it doesn't need to kill anybody. It doesn't need, and these are not my words. I'm using the words of Dr. Obasanjo, and the reason why I'm telling you that is because those are the words he used to express to me a way to bring the urgency a little bit down. It's got to go to preventative, focused, proactive education, which we could easily do in the schools with health teachers, with science teachers talking about things. I'm sure there has to be access to that. So I'd like to verify that that's
First
actually
of all,
true.
what,
Excuse me, Dr. Warner, are you finished, Ms.?
Yes, that's fine.
All right, Dr. Warner.
well, it's just, I'd like to correct something. Viruses are not sentient. They aren't considering whether or not they're going to become endemic. They are viruses, and they mutate, and mutations are random. And mutations can be lethal, and they have no impact because it just kills the virus off. They can be increased transmissibility, they can increase pathogenicity, they can do both. But viruses aren't setting out to become endemic or to become more warm and cozy viruses. They don't care. They don't care if the host lives, they don't care if the host dies. They aren't even alive. They require a host to multiply, they require a host to survive, and they aren't planning some sort of long-term strategy for survival. So I take exception to Ms. Halstead's characterization. I do, however, understand that because VDH is chronically and woefully understaffed, they do not have the resources to do contact tracing. And I also understand we don't have the resources to do contact tracing. So those are things that have to be weighed into any decision that we make.
All right, so
I'm not going to argue with Dr. Warner. I spent enough time in virology, and I had a very long conversation with Dr. Obasanjo, and I know what we talked about and how we talked about it and the way he phrased it, not the way I made the words up here at this table. So that being said, you all received my notes on the conversation. I have his cell phone number. I'm happy to call him and verify that those are the exact words he uses, if that will make Dr. Warner feel better. But for now, I think the obvious need that we have is to move forward. And what you're proposing is perfect for that need. It heals the soul of so many of these people, and it puts our kids back on the forefront of feeling normal. And that's the bottom line. That's what we need.
okay, so can I retreat back to my,
Absolutely.
is it required?
So
Is it required? And I understand that,
So per VDH, whenever
Let's-
there is an outbreak, specifically with COVID-19, there is certain information that they are requiring that we give them.
requiring or
Correct, to the-
requesting? I thought Ms.
Now, but if
Colette said
the answer is we don't have that,
requesting.
if we don't have that information, then we move forward with the information that we have. So if your wishes are to no longer request if they have a vaccine or not, we would just have to report. We have 4 cases that are linked. This is the information we have. These are the days. These are the times. Unfortunately, we don't have vaccine information, and that's what we'll give them. I mean, that's
How many of those cases have we had in the past year and a half? I
for
mean,
this year. We just counted it up yesterday. Outbreaks, was it 50? Between 50 and 70. I can get you the exact number, Miss Healy. I didn't know you were
that's
going to be
more
asking
than
that.
three
Well,
links.
it was 2 in the beginning of the year, and now it's more than 3. 3 or more, since January 1st.
Okay, all right, but again, I just trying to be clear here, because there's required, there's requested, there's recommended, all that. What exactly are, and I know you've answered this, but I just want to put this on the record so we're all hearing it at one time. What are we required to maintain per those specific questions, vaccination status and the criteria? What are we required to maintain by the health department?
So currently, we are required to provide them for information pertaining to cases that are linked 3 or more. And
Right, but,
part,
I
and
mean, let me
part of
just-
those questions.
Let me just stop you. I'm going back to my question. And I'll say, what data are we required to maintain? Now, you said earlier, if we don't have it, we don't report it.
Correct.
So are we required to maintain that data?
We are not required to
Okay,
maintain that
that's-
data, no.
Okay. Thank you.
You're welcome.
Any other questions? This is not personal, and I really appreciate what you're doing to present this
Absolutely.
information.
Oh, no, not at all.
And
Ask as many questions as you need,
I
yeah.
very much appreciate this option from the last one that was not approved by the board, because I think this one is much more clear and, flexible in the approach. So thank you very much.
Absolutely.
For that.
Thank you for the questions.
And I'm
Yeah.
I just want to make sure that when this comes back to the board, we know exactly what it is that is being put before us for approval. And so our families understand as well.
Absolutely, yeah.
Yes, Dr. Chase.
So, what potentially happens if we have a really big outbreak at our school?
It depends. Again, as our numbers, if the number of particular individuals in an outbreak continues to rise, we would take a look at impacts to that particular classroom or building. So if staff was impacted, if the number of absences were impacted, so we might have to transition the whole classroom to virtual, or we might have to transition a whole grade level to virtual. So we would have to have those conversations, and it's going to be based on the availability of staff and how quickly the virus is spreading. And then we always do that in collaboration. It's not just Colette and I sitting down saying, oh, we got to close this classroom. We collaborate with cabinet. We would definitely notify you if we have to close anything larger than a school, of course, but anything smaller, we would also notify you as well. So it's going to be contingent on the number in the outbreak.
Okay, Ms. Randall has another question.
I have a question about the concurrent teaching model, and you say, we're told last year that it was likely we wouldn't have to do concurrent teaching this year, and now we're saying it again for next year, and I'm going to keep all my fingers, toes, and hairs crossed that we can keep that. But how is, I'm hearing that there isn't great response for those kids that are virtual participating. So how are we monitoring attendance, true attendance, for the concurrent kids?
I can address the attendance because we actually oversee attendance. So we have
Okay.
attendance social workers that work very closely with each building. So they are monitoring those numbers in regards to students participating or not. And then there are mentors at each building that if they do get below a certain number of absences, that they come together and discuss what additional steps need to be taken. And then we still continue to follow our attendance plans with each of these cases if the student was in the building. So we do have monitoring pieces in place. I don't have any data unless one of the chiefs does in regards to each specific level into what you're referencing.
Yeah.
All I know is what the process is in place.
Okay, I'm very much interested in not having concurrent teaching, and I'll just say that because I just feel like the burden on the teachers is a lot, but the attendance and the cooperation and the participation of students isn't always, up to what the teacher needs it to be. So it becomes quite a battle for them to go and search kids in assignments. So I'm very much in favor of concurrent not being here.
I just want to clarify. Ms. Rindle, do you mean for next year?
Yes.
For next year.
Yes,
So,
yes.
so the plan is to keep the concurrent for the rest of this year, but for
Correct.
next year, it's recommended against it. Ms.
Correct.
Guy?
Just a quick clarification when you spoke about maybe transitioning a class or a grade or anyone to virtual.
Yes, ma'am.
You said it would be in collaboration. Is that with the health department as well? Or
Absolutely.
Okay.
Yes.
All right.
Yes. Thank you, Mrs. Guy.
The board's current practice is that the superintendent and the health department director would collaborate on any type of closure. And that would be largely informed by the team that is here right now.
Yes. Thank you, Mrs. Guy.
Any other questions? Dr. Warner, do you have anything before we wrap up this portion of the work?
No, I'm comfortable with the new quarantine strategies.
Okay, so we're good? All right.
Almost, Madam Chair. We've got one last slide in this slide deck, and this is your 2-for-1 deal. The board had directed me to assemble a process for what it would look like if the board rescinded its universal mask policy and or made a change to its universal mask policy and what that would look like. And I'll let Dr. Hummer go through this list in a second, but I do want to make a couple of additions that I think are really important to share with the board that are not necessarily process related, but are important to share with our community. The first one is that since the time of the publication of this document, we're in a position where we would be prepared to also provide KN95 masks or an upgraded masking option to students should they need that. And we are also want to make sure that the board understands that we would still follow CDC guidelines, which does recommend masking if that is still something that somebody wants to do. We certainly wouldn't dissuade anybody from that, and it's also very important that the board know that students, regardless of their mask preference or their family's mask preference, that they wouldn't experience any different learning environment as a result of that. So whether a student wore a mask or whether a student didn't wear a mask, their learning environment would not be impacted. That doesn't really speak to the process, which is what the board asked me to provide them, but it's important that our families know and have that understanding. And as we look forward to a day without masks, that we know with great transparency the steps that we would take as a school division to go to a more open practice with mask optional. And so that's what Dr. Hummer is going to present now.
Okay. So really quickly, if we did move forward with mask optional, the process would be we would notify families of when the date would go into effect. This would be a preference solely by the family. We would not track this as a school division. It would be way too complicated to track that, so it would be up to the family to decide what they would want for their child. Keep in mind that the federal mandate did not change for riding of buses or the Head Start program, so students and staff will have to continue to wear masks in each of those settings. Also, when students return from a quarantine or isolation from 6 to 10, they are required to wear a well-fitted mask. That is part of that requirement of reducing each of the quarantine and isolation times. We also, as Dr. Taylor mentioned, will be offering additional PPE, including masks, to our staff if they request it. Physical distancing, as I mentioned, will be impacted because we will have students that are 3 feet apart and they will not be wearing masks. So it could potentially increase the risk of transmission and others potentially getting sick. So we want to make sure we are full disclosure with that. And then, as we mentioned, contact tracing would be impacted, but with the proposal today, we are asking to reduce that, so that would take care of itself. So if we didn't move forward with that recommendation, that would be impacted because it would make it very, very complicated for our staff to continue to contact trace as we're doing that now. So that would be the process if we did move forward with the rescinding of the universal mask mandate. And just reiterating our priority. So any other questions, comments?
Ms. Guy?
Just, you mentioned a few times the 3-foot distancing, but that's not the case in many places in Stafford County. Like, my kid sits with her desk next to another person. It's not 3 feet.
Not in every, but in a lot, in order to have our students in the same classroom.
Okay, I've visited some schools and I just don't see it as much as I thought I would see it,
Okay.
I guess I'll say.
Sure.
Like, it's not happening. And my kids come home and tell me it's not happening. So I just wonder, I just wonder how things will flush out, that's all.
Okay, thank you, Mrs. Guy. Dr. Chase.
So it says that parents will be responsible for setting masking expectations for their child, and that Stafford County Public Schools will not track masking preferences. So if a student returns from quarantine and is expected to wear a mask for 5 days, we aren't going to pay any attention? If they do, great. If they don't, we don't care.
Keep in mind, it's 2 separate processes, because the requirement to wear the mask when you return is not part of the universal masking mandate. It's 2 separate things.
Okay.
So we would have to track that to make sure that that student is re-wearing the mask from day 6 to 10.
So we might add that in here to make it clear
Sure.
that for somebody who, and then my other question is, so if we have an outbreak in a class, because now students are closer, and that class has to be closed, does it matter whether a student was wearing a mask or not?
The class is,
So let's say there's an outbreak.
right.
And so there are enough sick students or positive COVID students that the VDH and Dr. Taylor make a determination that this class or this grade level has to be shut down. Will it make any difference for the students who are wearing masks versus not wearing masks?
I think it depends. I think it depends if those students were considered primary contacts, because that is part of determining if you have to quarantine per se, And then, so if we have a majority of the class that has to isolate, but then the rest were just recommended to quarantine, but the teacher is out, you have 20 students out, and we have 5 students remaining, we would have to work collaboratively with that building to say, all right, we have to repurpose these 5 kids to come into school. Maybe they'll participate in another class for those however many days the rest of the staff is out.
So children who are wearing masks might be able to stay in school versus students who were not wearing masks?
No.
No?
No.
Okay, then I'm not so I'm not getting my question answered. So.
Sorry.
If there's a classroom, and let's say 4 kids are wearing masks and 16 kids are not, and it's determined that there's an outbreak in that class, and you decide to close that class.
Okay.
Okay? All the children home, or the children who are wearing masks can stay in school?
It's going to be contingent on if they were determined they were a primary contact or if they tested positive. It would be contingent on those 2 things. So if I'm student A and student B is the one who tested positive and he's 15 feet across the classroom, I'm not a primary contact. If I never came within those 15 minutes, less than 6 feet without a mask, and I chose not to wear a mask that day, then I wouldn't be recommended to quarantine or isolate, and then I would be a student without a mask, and I would have to go to another classroom. You can have a student wearing a mask if they were less than that 3 feet, and they were exposed to that student for more than 15 minutes. We would recommend that student would also have to potentially quarantine, or hopefully they didn't test positive, and then they would have to isolate. So it's not going to be solely contingent on the mask. And keep in mind, mask is just one layer to our mitigation strategy. So,
but what you are saying to me is there will be a difference in what's considered primary contact if you're masked or if you're not. That if I am closer than 3 feet and I'm wearing a mask, then I'm not a primary contact. If I'm not masked, I am.
That's why I said the contact tracing will be impacted if you all don't vote on that tonight and approve that, because there's no way that we're going to be able to determine that with masks, not masks. It's going to make it very complicated. Yeah, that is part of the recommendation for quarantine, but again, it will be a recommendation.
So the question you just answered was based on current quarantine rules, assuming we're not passing what we've just discussed before. Because right now my head is wrapped around what we've just been presented, which are different rules than we're actually following today. And
Correct.
Your answer to Dr. Chase was based on our rules today or the rules you're recommending? Just so
It would be based on.
I'm very confused. So, I think.
I'm sorry, Dr. Chase, I tried to answer your question. I thought I understood it.
I have a follow-up question. Okay, I have a follow-up question. We can add this 3 strikes and we're done, I guess. But what is the definition of a closed class? I thought if we closed the class, then all the students are virtual. So Dr. Chase is saying if you close a class and some students were masked, then are they still going to be in school? I mean, that's contrary to my understanding of a closed class, and we've only closed, less than a handful of classes since we started, right?
Correct.
Well, when we closed those classes, was everyone in the classroom relegated to virtual?
In the situations that we have had this school year, not every student would have to go virtual based on the options that the school had. In some instances, those students were placed in another room in the school and they were able to access virtual. In another instance, we were able to take those students and place them into another class until the staff was able to return.
Okay, so maybe it would help if you could give me a definition of, and if you don't have it right now, a definition of a closed class, because I certainly understood it to be the class is closed, everybody's working from home. On the Chromebooks, there is no class. I mean, technically, I guess there is no class if the teacher isn't there and the students are spread out, but
we just have to remember that there's some students.
I wasn't aware that we had situations like this.
Right, we have
But
to
you don't have
remember.
to do this now. I mean, I think we're getting more confused.
Well, we are, but I'm confused because when I read some of these emails about what this level of segregation is doing to our children, and the fact that we keep, in a sense, almost pitting them against each other, masked versus unmasked, right? Like, I don't know if y'all read the one about from the mom. I printed out a few to read tonight, but, kids are being hugely bullied, and not just by their peers, but by teachers and principals about the masks and wearing the masks. And, you know, when I started this, I said, having been in public health for so long, I'd like to help kind of heal and move that forward. Well, we can't do that if we're going to continue to separate out our children and point out vaccinated versus unvaccinated, masked versus unmasked, sick versus well. We are either all children of Stafford County Public Schools with distinctly different situations and lives and parents and whatever, and we start educating based on real facts of how this is going to go, or we continue to label our children by the way their parents have or the way they've chosen to take on COVID-19. And I think we are doing a gross injustice to our children by continuing to allow the discussion to be masked versus unmasked, unvaccinated versus vaccinated. By all stretches of the imagination, we are creating a future generation of individuals who are separate, singular souls, always judging themselves against what another person does. And that's a personal opinion, but if we don't look at what you've given us, which, by the way, to join in with everyone, you have taken a substantial amount of both abuse and questions and,
Oh, this is great. Thank you.
rigorous whatever. So thank you for that. But I feel like we're finally looking at a proposal for all of this that we can get on board with and move forward and help our kids. But if we're going to start adding quid pro quos to every single solitary thing we do, then we're back to ground zero and we're not moving forward at all. So I'm just saying, I've been told over and over and over again to be careful. Oh, you know, you gotta be more sensitive about that. I'm trying to be sensitive to the fact that I've got a woman here who tells me her son can't even play in her home without forcing that, making sure he has his mask on and having all the people in the house clean themselves because he's afraid of being sick and getting sick and dying in his home. That's a 6-year-old child, and we've done that. And that's unacceptable. It's just unacceptable to me, and it should be unacceptable to this whole board, because I know it's unacceptable to the residents of Stafford County. Dr. Taylor, this is so well thought out, and I really appreciate how quickly you put this all together. So thank you very much for that, because I think without it, we don't have the hard talk. We don't have the hard discussion. We all just sit here looking at each other like, how do we move forward? But you've given us a way to move forward. What we need is an effective date on how to do that. I don't think any of us are on this board. I'm not, clearly, did not get on this board to just make the easy, happy decisions, although it would be nice to have one on the agenda if you got them. But sometimes we got to make the tough ones, and this is a tough one. There's never an easy answer for this question. But we're either going to decide that Dr. Taylor is going to be tasked to make a school for the masked and a school for the unmasked, or we're going to get on with our lives and figure out how to get this going. And you've done that already. So adding any more to it seems like jumping out of a plane without a parachute.
Okay, Ms. Guy's next, and then we'll go to.
Right, this won't take long.
Chase.
On number 4, students will need to wear a mask upon returning from isolation or quarantine on days 6 through 10. Is that, do they have to? You know, I'm just trying to understand, are we going to say,
Correct.
Johnny, you must wear this mask for the
Or
next
you can,
4
or you
days?
just go to the 10-day for isolation, or you go to the 7 or 10 for quarantine.
Okay.
Correct.
Another part, and maybe I'm missing something because I kind of feel silly asking it, but if we're recommending isolation or quarantine,
Recommending quarantine, requiring isolation. Isolation is when you test positive, quarantine when
Okay.
you're primary
Thank
exposure.
you.
Yes, ma'am. Thank you, Mrs. Guy.
Dr. Chase.
So two questions.
Sure.
I hear that N95s will be available for students, and do we have some that will fit very small students? Okay, so I just want to check on that. And then another question then. So I'm hearing a lot of concerns about privacy. So if a student is returning from isolation or quarantine and now they're required to wear a mask, then that kind of announces to the entire school that they were quarantined or they were isolated. And so it's an invasion of their privacy. So what would you do in that case?
Well, two things. The first one is, regardless of which direction we move forward in on Thursday, we're still, you're going to wear a mask if you choose to wear a mask. So there are going to be other students that wear a mask. If a student is feeling ostracized or bullying, that is zero tolerance, and we need to make sure that we handle that situation properly, and we need to make sure that students aren't singling those students out. We're not going to be sharing that information. Since the pandemic hit, all of our nurses, Colette and I, we have emphasized confidentiality. You don't say, oh, such and such is tested positive, so he's out today. And we experience this with our concurrent learning as well. So that's one of the things that we have to be very careful of. If you just have one student learning concurrently, you don't share information as to why that student is learning concurrently. Now we have a wide range of reasons as to why a student is learning concurrently, so we want to make sure that we emphasize that. If a student feels bullied or is feeling different or is treated differently, we need to know that so we can act appropriately. So that's a really good concern. We want to make sure we get ahead of that.
Ms. Sigmund has something, then we're going to round back to Dr. Warner, and then if it's, we can wrap this up and move on to the budget, because that's part of this work session as well. Ms. Sigmund?
So we hear a lot about what may or may not happen on Thursday, or what may or may not happen in August when the school year ends or we're starting the new year. So I want to talk about people who choose to wear masks, and I want to ensure that they will, I guess we will, this is not going to sound right, but we're going to continue to tolerate masks as long as people feel like they need to wear masks. Is that?
As long as the CDC recommends it, yeah.
You know, even going into future school years.
If it's right now,
If
we're
it continues to be a
required to follow
recommendation
recommendations.
from the CDC, yes.
And then after the CDC changes its rules as far as recommended masking, then.
We would
Because
not.
I want people to be comfortable in school. And again, for people who might have longer lasting concerns than others as far as wearing masks, I want to make sure that they are able to wear a mask as long as they're comfortable. That, this was kind of my pet peeve last year, is that our student code of conduct forbids them. So when we readdress our mask policy for now and for future, if we can qualify that masks are forbidden, comma, except in cases where, except for health reasons or something like that.
Sure.
So, Madam Chair, if I could address a couple of Mrs. Sigmund's concerns, and they're really very important concerns, particularly with our students and managing potential future illness as well. You know, we're still looking for that silver lining where we can take some of the learnings from this past couple of years and apply it to a better solution set moving forward. With that, we intend to keep a mask, if this is the direction that the board chooses to go, to allow students to wear masks as long as it's a CDC recommendation for the spread of this illness or other illnesses. But I will say this, we do have a concern, and it is a social emotional development concern, that eventually we need to get to the place where this is not a crutch for our kids either. And so we have that concern moving forward, and it is our hope that, and our current dress code definitely reflects this, and of course it's implied costume masks, not necessarily surgical or face masks or coverings to prevent the spread of illness. And certainly we would look at our dress code and amending that to have more of a health connotation to differentiate between the two. But we do want to see our kids' faces, and we do want to have that interaction that comes from seeing our children smile and knowing when they're upset and helping them with their development of speech. And those things are really important to us, and the quicker that we can get to that, the better off we're going to be in the long run. But as long as it is a recommendation, we're going to continue to follow that recommendation.
Okay, Dr. Warner, do you have any final questions or comments before we wrap up this
Thank
portion
you.
of the work session?
Thank you, Madam Chair. I appreciate it. Dr. Hummer, Dr. Taylor, I appreciate all the effort that's gone into this. I think that clearly it is time for us to resolve the mask issue. I think that we started this with very little information, and in the beginning it was supposed to be a temporary solution, but it's lingered far too long because it's become the primary mitigation strategy that we've used. But I want to ensure that all children and teachers feel safe, whether they decide to mask or not mask, that we have protocols in place that ensure their safety, and that we're using the proper masks, and that there is no bullying associated with it either way. I am concerned that we are not using any parameters. We're just picking an arbitrary date. It doesn't necessarily reflect what's going on locally in our community and what our local hospital status is as far as ICU beds. But I appreciate that the impact, especially on some of our young learners, raises serious questions about the practicability of the mask mandate. When we started masks, it was supposed to be until we got a vaccine, and then it was supposed to be, until we had vaccines for kids. And now what we're finding is that this temporary solution has become somewhat of a permanent fixture in our lives. And I think there is a safe way to do this. I just wish it was linked to parameters instead of just an arbitrary date on a calendar. I am concerned that with the recommendations of quarantine, that teachers may feel uncomfortable, not knowing if students in their class had a major exposure, a primary exposure, and are still coming to class. I am concerned that, so are teachers notified of which students were recommended for quarantine, or is that confidential information that's not shared with them?
I'm sorry, Dr. Warner, can you ask that question again?
Yeah, I'm wondering if there's an exposure in a classroom, and is the teacher notified of which students were recommended for quarantine, or is that confidential information? I'm just concerned that teachers may feel unsafe, not knowing which students are at risk. Maybe if they're aware, they're more vigilant. Given that the quarantine recommendations are a recommendation.
Yeah, the teacher and the administrator are notified because they have to know if the student needs to access virtual or remote materials at home, or if they need to tap in concurrently. So it's confidential outside of those stakeholders to make sure that the students are getting what they need while they have to quarantine or isolate. So they don't share it with other students.
I'm asking if a student is recommended to quarantine, but they have no symptoms and they choose not to quarantine, is the teacher advised that student has had a close exposure, but has opted not to quarantine so that they can be more aware of the student's health status?
No. There's no reason to share that information, no.
Okay, sounds
I
like
have
we're.
no other questions.
Dr. Warner, are you finished?
Yes.
Okay, well then let's wrap up this portion of the discussion and move to item 3.02, discussion of the school board's potential changes to the superintendent's proposed FY23 operating budget. Dr. Taylor.
Thank you, Madam Chair. I'd like to thank the board for providing some feedback on my proposed operating budget. You've certainly given the team a lot to think about. And I also want to thank the board for our opportunities to visit with the community writ large, where we've had the chance to have a handful of our budget town halls. We have a couple still yet to come, and we're thrilled to go to the Falmouth district tomorrow for our next budget town hall, and certainly hope folks will join us for these engagements if you haven't made it to one yet. Mr. Fulmer has a short presentation encapsulating some of the suggestions that the board has made, and he'll introduce some information that the board had requested, and then we'll take any questions and some direction from the board as to where to go from here. Thank you.
Good evening, board members. As Dr. Taylor mentioned, just a few slides to kind of guide us through our discussion this evening. First, I just wanted to let you know that we do have a couple items attached to the agenda, which were items that at the Saturday work session you requested to have a copy of. One is the school site budget enhancement, which is not currently funded in the budget, but is one of the top enhancements that Dr. Taylor wants to pursue, whether that is this year or in the following years. Also, as we were showing some information on the teacher scale, there was information about how many teachers were on each of the levels by year of experience, and so I shared that I would share that with you today as well. So both of those are attached for your reference. I'll let you know that I'll be coming back with an adjustment proposed for our school nutrition workers. So in addition to the short-term impact that we're proposing in the actual regular meeting tonight to try to hire some hiring incentives and the attendance incentive, we're also looking at doing an adjustment to our school nutrition workers for next year in the budget. The school nutrition fund is self-funded, and as I explained on Saturday, a couple Saturdays ago, it is doing very well and can afford the increase in the nutrition workers. So currently proposing to increase our nutrition workers from the U10 scale up to the U40 scale, which is about a 19% increase in the minimum scale, and that will help us obviously attract and retain our nutrition workers. Because that starts to create compression with our assistant nutrition managers and our lead managers at each level. We're also suggesting a slight bump for them as well. So they would move from, basically each one would move up one tier on our grades, with the exception of our elementary school managers. Honestly, the space between an elementary and a middle school manager, at this point, our elementary schools are approaching the same size as many of our middle schools, so there's really no difference to have too much of a separation there. So we had 2 grades different before. We want to close that down to 1. Also provides a little bit more gap between our nutrition workers and the assistant nutrition managers at the elementary school level. And so that would be a 13% increase and an 8% for the others. I want to point out that last year, these nutrition workers were part of the service scale adjustment we did when we gave credit for years of experience that relieved the compression at the bottom of the scale. I don't want to just recreate those compression issues again, so I'm proposing that when we do this adjustment, we go back and recalculate what those adjustments were for somebody with 10 years of experience. We get that same adjustment they did last year. It would just now be based on the new minimum of the scale as we bumped it up. So treating it as if we had bumped up the scale last year. And that will still create that separation between each individual on the scale, and that would be with all of these scales impacted. And as I mentioned, this is funded by the School Nutrition Fund. Also, you requested that we look at our fleet technicians. At the Saturday work session, HR did a preliminary assessment, and right now shows that our pay scales for the fleet technicians is in line with the BLS. However, we need to do a deeper dive into that, and so right now we're requesting that we need to include them in the full study that we're going to start this spring to look at our compensation. That's our full service scale. So recommend that we can continue to look at them, but right now not make any immediate adjustments in this budget and include them in that compensation study. I just wanted to include that our fleet technicians were included with the same adjustments we did last year for our service scale, so they did receive the same years of experience adjustments as the rest of our service scale. Some of the requests that our board members sent in, Dr. Chase asked about adding 8 additional FTEs at the middle school, and that would have a cost of about $575K. Starting our major maintenance would be about $1 million, was a suggestion by Dr. Chase. And also, already noted in the handouts from superintendent's presentation, is if we wanted to do the school-based funding allocation enhancement, that's about $1.35 million. So I put it on there as a reference as we guide the discussion tonight to get some guidance from you. And speaking of, so just looking at this point for guidance on, as we move towards Dr. Taylor's budget to the school board's approved budget, if you want any additions or adjustments to the operating budget as it was presented to you.
Okay, who wants to start? Dr. Chase, you made some of these suggestions?
Yeah, so I suggested the request for the additional FTEs for middle school. I think Dr. Taylor had put in 15 FTEs as an eventual enhancement to get the class size down by 1. The reason I asked about this was last meeting when we had a discussion about adopting the middle school curriculum. What I heard many board members say was they were really concerned about that curriculum because we weren't able to actually offer many of those classes. And so it suggested to me that that may be a more urgent need that we want to look at taking care of after that conversation. Then major maintenance, I just know that we had to closed both Brook Point and Hartwood for a couple days this past fall because of maintenance issues. And so the idea that we know that we need to deal with maintenance, why are we delaying a year to ask for that money, right? And then the third, school-based funding allocation enhancement. You know, with inflation and all of that, to be asking families to be buying toilet paper, I guess we don't do that. Kleenex, Ziploc bags, all of that kind of thing is a bit of a challenge. So that's the reason I asked for those 3 items. Thank you.
Okay. Dr. Warner, do you have any comments, questions?
Thank you, Madam Chair. Thank you for remembering me out here in the ethersphere. I appreciate it.
I know, usually your picture would be up there and we would be looking at you, but.
Well, the cat's poked in too. She's very fascinated by Zoom meetings. I actually agreed with Dr. Chase on a number of these things. I think that, you know, our 3R projects have been woefully underfunded for a long time. And the sooner we start implementing some of these pay-goes from major maintenance and start building that fund up, the better. So I actually endorse the $1 million to that. One of the things that I also had suggested to Dr. Taylor is, you know, if we focused, instead of funding all the enhancements in the school-based enhancements now, if we could focus specifically on critical needs like ESL and some of the other sections and funding it partially this year and maybe completing it next year, it might be easier to maintain or easier to acquire. Especially with the learning loss that many of our students have suffered, I think it might be a good investment. The other thing is, it's really a challenge for Head Start to have different personnel at 2 different locations. And based on the preliminary schedule that we received today for next year's bell schedule, I'm concerned that might pose a problem for Head Start having personnel maybe at North Star or Rising Star and needing them in 2 different locations with 2 different distinct bell schedules. So I'm concerned that especially the behavior specialists, one of the things I see those as really important positions for Head Start that I think would provide a benefit, especially long-term, because kids with behavior issues have a harder time learning and they often distract other students in the class. So I think that would be a worthy investment. I also think that because of the middle school curriculum and our concerns about it, I also would support adding more FTEs to that level. I think that middle school needs some additional boost, even if it isn't necessarily targeted to reducing class sizes. Thank you.
Thank you. Any other comments, board? No, Ms. Guy.
I am really happy that we're raising the rates for nutrition and that we're focused on that, because I did get quite a few people talking about, you know, it's really hard to live off of it, and they were considering leaving. I was happy to be able to say, can you just wait, you know, a month before you make that decision and look at what's coming. So I'm really glad that we can do that. I truly wish it could be more for everybody. And I do agree completely about the maintenance, the extra 1 million. And, you know, is that enough? I don't know enough to know if that's enough, but I do think we need to do something about at least having those funds there or budgeted or something, because it does seem kind of crazy to have to close schools for things that we know are an issue.
Could I have a follow-up question for that? When we closed those schools, weren't they emergency type situations that we had not been aware, you know, were an issue?
Yeah. Correct. I believe Hartwood is the only one we had to close due to an emergency situation with water.
Okay, well, what was the Brook Point? Were we not working on that?
Yeah.
Yeah. We were running on very limited capacity for heat until we could get them up and running. But yeah, we did not close the school for that.
Okay, I just want to make sure, because certainly if there's anything that we know of that needs maintenance that is going to affect the operation of our schools, I expect that Dr. Taylor will bring that to us in advance so we can take action. So I have a comment, if anybody minds. I usually goes last, but I don't have any problem with asking for money for maintenance, but I would like to ask for specific money for a specific project. Just to say, I want $1 million so I can do maintenance, to me, does not identify the need or where it's going to be applied. So that's something that I would suggest the board, consider. Sure. And then we'll get back.
So I thought we were trying to get to this pay-go thing where we're slowly increasing in the budget actual money so that eventually we don't have a 3R list, right? So that, currently, finding $1 million of maintenance that needs to happen should not be any challenge at all, from what I've seen of the 3R list. So does that,
Well,
but I absolutely agree with you that perhaps going across the street to get this started, we can explain this particular $1 million is for this particular
And that may
project.
be something that we want to discuss as a board with the, when we have our board-on-board meeting or the Joint Schools Working Committee. But before we're in a position to really advance all of the information, I think it would be beneficial to not just say, we want to start this fund so we have money for maintenance, but have a plan and have it thought out and be ready to move forward. That's just my personal feeling, because if we need money for maintenance, we'll have to find it. We'll have to find it from somewhere. And I like the pay-as-you-go, but that's something that was just presented to us as a board, and we've had no discussion with the county about it, or, how it goes, and it's going to have to build up. What was the ultimate amount, Dr. Taylor, that you said we would need?
Yeah,
in
our
there?
target, and both of you are spot on, Dr. Chase and Ms. Healy. Our target should really be to have a major maintenance fund equivalent to between 2 to 2.5% of the value of all of our assets. So should we add another school building or we take on another asset, that would change that figure a lot. For us, that's between $15 and $20 million annually that we should be targeting for major maintenance expense. When the board looks back at its capital improvement plan, you identify on a pretty regular basis around $15 million worth of major maintenance projects, and that lines up pretty consistently with what we would be targeting. Right now, the big question is how well are we financing those projects? And how are we identifying what the priority is for those projects? So to your point, Mrs. Healy, we would want to tag specific dollars to specific projects, but we would want to build that fund up over time and have a strategy about how we would build up to that over time so that we would have a reliable and consistent revenue stream for us to attack that issue.
So speaking for me, I'd like to pursue that, but my preference would be to pursue it in next year's budget, because that would give Dr. Taylor more time to identify the original needs that we want to propose, and also come up with your 5-year plan. That's one point that he's made in every town hall, is that this is the last time he expects to present a 1-year budget, that the next budget will be for 5 years. And if we can see what the plan is and how it's going to be used, then I think it would be an easier project to gain support for. So, any other?
So I just, so, two things. One, clearly the raises for the teacher is a huge coup. Like, I feel like we should just clap that one out right now, because that makes me so happy to see, because I know no one's happy when we can love our jobs, but certainly we're not volunteering to do them, right? Like, we want to feed our families. So that's amazing to me. And then as I was looking, I definitely agree that the middle school teachers they felt like a very big priority to me as well, just based on the fact that I did truly like the program that was presented to us, but the concerns with staffing and attrition and all that made me feel like I just don't think right now we want to set anything up for failures or whatever. So I think coupled with an increase in pay, I definitely think that it's a great idea to start to look at the middle school teachers as a starting point anyway, to add from this wish list. My question is, with us being so far behind, and you mentioned our ESL students and whatnot last night, from this list, should we be looking more towards our special needs folks and what they're going to need? And I don't know if it's people or things, but I feel like we need, some due consideration should be given to that as a priority for this year's budget as well.
Do you have any sort of specific suggestions?
A few. Well, so no, I mean, and again, there's a few moms I know we have, and I was explaining one mom, she can explain it better, but this BCBA coordinator, we only have 2 for the entire county. And that feels very overwhelming, given I know how special, like how different that is. So one, I mean, this is just for one, so it seems almost like a small request. And then some of these folks, like the paraprofessionals, and what is the training need for our special needs paraprofessionals? Do they have to come with the required training? Do we give it to them?
We can provide it. Yeah.
Okay, and so is it day one you start and you get that training, or do you get that training before you start?
Before you start, day 1 and ongoing.
Oh, right, so it's an evolutionary thing. And those are internal to SBCS, right? Like, we have programs, we're not spending extra money to send them out places or do whatever. Well, it's money, but right, it's in-house money, okay. So I think also just looking at the paraprofessionals inside those special need classes, to help eliminate some of the stress and pressure and I mean, how many of our 600 students that we're looking at getting are going to have those special needs as well? I mean, what's the target projection for that?
About 13%.
Is it 13? Okay, so yeah. So, I mean, that's big in terms of having the capability to manage that. So I just ask that we look at our special needs kids and what we can do to get the parents the support they need, particularly in this upcoming year when we're going to be building all these bridges and trying to fill in some of these gaps. It's just my thought.
We've got about 20 minutes left, so I'm going to go through everyone who has not had a chance to speak or make comments to see if there's anything.
My concerns were addressed.
Okay. Ms. Guy? You're good? Okay. Ms. Randall?
I would just like to give a compliment here because the board was very clear with our directions, and it was long before we had Dr. Taylor on board, but Chris has worked with us immensely on this as well. And we had 3 budget priorities, and I just feel like you guys have done a fantastic job of hitting all of our targets that we wanted with salaries, with cyclic replacements of our technologies, addressing our population growth and growing our staff to address our population growth, and scheduling, which we'll all see here shortly, again, to address our population growth. And then also, at the very least, to increase our per pupil expenditure with support. So I just really, I know that's one we'll always have to work, all of these are ones that we always have to work on, but I just really appreciate the fact that every little thing that we, as a board, said that we find necessary for our schools, you have found ways in this budget to highlight it and nail it. And so I just really appreciate that. Thank you.
Thank you. Dr. Warner?
No, I'm good. Thank you, Madam Chair.
All right, so we've all had a chance. Is there anything else? If nothing, then we can close the work session and take a break before we start. But is anyone else have anything else they want to add? Now, we do need to, I think, give some direction for Dr. Taylor. Do we want, and we can't take action here, but this is the straw poll, is there an interest in adding, any of these specific requests? And could you put that back up, Chris, the specific request to the budget? Now, this is going to be the school board's budget. We have the superintendent's proposed budget. Now, it's coming to us, and what we approve versus adopt, what we approve as the budget will be our budget. So let's go on the first one, the additional 8 teachers for middle school, $575,000. Dr. Warner, you can't see, but we're seeing some heads nodding. Please say agreed.
Yeah, I agree with the investments in middle school.
Okay, I don't see any nays here, so that will you know, it looks like that may go in, we're not taking any action, but we're getting the straw poll. The major maintenance, the $1 million.
I think that we're 10 years behind in building a fund for major maintenance, especially given the scope and size of our 3R projects. I agree with this item.
And I will be able to support that if we have an explanation of this is part of a plan that our superintendent is proposing. You know, it will be explained more fully later. It's not just a fund to just have this money there, that the board will identify projects. Is that any objection to that? You know, adding that in there? Okay. I'm famous for my footnotes on these things. And then the third is the school-based funding allocation enhancement for $1.35 million.
You know, that addresses the special needs students, the ESL students, and several other student vulnerable populations. I think that I certainly agree with the addition of that item as well.
Okay, I'm not hearing any objection. So, you know, this, when it comes back for the school board's proposed budget, it looks like we're going to want to see those in there. We are still continuing the town halls. There's a few more, so there may be some more ideas coming up from that, as well as this evening, we have a public budget hearing within our meeting that we may get some more ideas. So, Dr.
Can we
Chase.
take a straw poll of the item that Ms. Halsted requested and the item that Dr. Warner requested? So I think Dr. Warner was asking about a behavioral specialist for the Head
Right.
Start. And I think Ms. Halsted was asking for additional paraprofessionals at the,
Actually, it was a BCBA coordinator, so I actually have two requests in addition that were discussed. Behavioral specialist for the early childhood program and the BCBA coordinator.
I just have one question about the early childhood. Is that going to be the only position that is funded by Stafford County Public Schools? Because
No.
the Head Start is 100% funded.
Yes, we
correct?
have a local
Local
share
funds.
of the Virginia Preschool Initiative positions and some other local positions that we support with local money.
Okay, I just want to make sure we're
the
jumping
terminology
in where
is
the
right.
federal
Gotcha.
government is already funding. Okay, all right, so I don't have
These
any
would
objections
be
to those two?
partially
Can I
funded,
ask
I
a
believe.
clarifying question? I'm sorry, was Dr. Warner saying something?
I just wanted to say there were two positions, and I think these would be partially supported by Stafford County Public Schools because there is additional funding through EPI and Head Start.
So this is what we're going to ask for. Doesn't necessarily mean we're going to receive it.
At the Garrisonville budget meeting, there were some parents and attendees that had raised questions about additional staffing requests, and your concern, Dr. Taylor, was that we didn't want to ask for things when we couldn't fund the ones we have. Are any of the positions we're talking about falling into that category?
I really appreciate you bringing that up, Ms. Sigmund, because I would tiptoe carefully with staffing in general. And I know that that this is certainly an area that concerns my team and my staff and our principals, but we definitely want to staff our buildings in an appropriate way that's consistent across the division, and that we're accounting for our staff in the right way by creating some sort of staffing model that can be consistently applied. So far, the items that have been discussed, that this all makes good sense for us to bring this to the next layer of discussion. The board does have another opportunity before it adopts its budget to land on these topics and to finalize its budget. It's a little bit different when you can see it all on a piece of paper and then start making some final decisions before you adopt. I absolutely agree that we need to take a hard look at how we compensate and how we support our paraprofessionals. But at this time, I'm not sure that I would recommend adding any additional positions en masse until we've kind of landed the plane on what that staffing model should look like. So it really comes from a place of the fact that this is week number 9 for me and not really anything else. But I definitely want to tread lightly as we move forward to make sure that we do this right and that we're not adding things in the wrong places.
Okay. All right, so it looks like at this point, for purposes of discussion, you know, we would include all these in what's coming back to the board. You know, ultimately, we we, in the past, have had to make some trimming when it comes down to, what is actually allocated to us. But it's certainly, if these are items that are important to the board, that they should be included. So right now, if there's no further discussion, we will adjourn the work session and be back in 17 minutes, or if you want to come early, make it 15. Thank you. Electronically for Dr. Chase? I'm sorry. Dr.
permission-
Chase, do you have a motion for, I'm looking at you to make a motion, sorry.
Motion to allow Dr. Warner to participate electronically.
Okay, we have a motion. Do you have a second?
I'll second.
Motion by Dr. Chase, second by Ms. Guy. All in favor, please say aye. Aye.
Aye.
All opposed? Motion carries unanimously. Dr. Warner, are you with us?
I'm here, thank you.
All right, so do we have a motion for approval of the agenda?
Motion to approve the agenda?
Second.
Okay, motion by Dr. Chase, second by Ms. Randall. All in favor, please say aye.
Aye.
All opposed?
Aye.
Motion carries unanimously. That brings us to the presentation of the national colors and Pledge of Allegiance.
Do we need to do the roll call?
Oh, roll call. I see everybody's here, but I guess Ms. Hall needs to confirm it.
Okay, Dr. Chase,
Here.
Ms. Guy,
Here.
Ms. Halsted, Ms. Healy,
Here.
Ms. Randall, Ms. Siegman, and Dr. Warner.
Here.
Madam Chair, you have a quorum.
All right, so now would you please stand for the national colors and Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Order. Color. We'd like to thank the members of tonight's Color Guard, Stafford High School's Navy JROTC, Grace Mice, Brandon Smith, Alex Baker, who are all cadets, and Senior Chief Bennett Baldwin, and CMC Lewis Wilson. We have some sad news to share. Frances Tullis, a longtime bookkeeper at Falmouth Elementary School, passed away last week. Please keep Ms. Tullis and the staff at Falmouth Elementary in your thoughts and prayers, and please join us for a moment of silence. Thank you. That brings us to school board proclamations. Oh, wait a minute. I thought we didn't. I thought we did approve the agenda. We did, okay. It's been a long night already. No, that's okay. Good. I'm glad you asked, though. Thank you for raising that question. Ms. Osborne.
Well, good evening, school board members, Ms. Healy, Dr. Taylor. Proclamation to recognize March 6th through 12th, 2022 as World Languages Week. Whereas in an increasingly connected world, it is more important than ever to be able to communicate effectively with people from different nations and cultures. And whereas world language education provides students with a deeper awareness of, understanding of, and sensitivity for cultural values and beliefs. And whereas the benefits of learning a world language are immeasurable, and Stafford County Public Schools supports opportunities for students to become bilingual, multilingual, and multicultural with opportunities to study languages in all middle and high schools. And whereas Stafford County Public Schools participates in the Virginia Seal of Biliteracy, which recognizes high school graduates who demonstrate proficiency in one or more languages other than English, and whereas World Language Classroom is where language and culture intersect and where students gain new levels of appreciation and enhanced perspective of our diverse and global society. And whereas Stafford County Public Schools recognizes the value and importance of linguistic studies and commends teachers and students of world languages who bridge cultural boundaries by learning to speak, read, write, and understand in other languages, now therefore be it proclaimed that the Stafford County School Board hereby designates March 6th through 12th, 2022 as World Languages Week throughout the school division. The school board encourages all citizens to take an interest in and give full support to the unique contributions that qualify world language education programs provide for the children. Adopted by the Stafford County School Board this 8th day of February, 2022.
Thank you, Ms. Osborne. Do we have any world language teachers with us this evening? No, well, Dr. Taylor, if you could please express our thanks to them. All right.
A proclamation to recognize February 2022 as Career and Technical Education Month. Whereas each February has been nationally recognized as National Career and Technical Education Month since 2008, and whereas economic and technological changes in our society are rapidly reflected in our structure and nation of today's workplace, placing new and additional responsibilities on our educational system. And whereas career and technical education are part of the foundation of a strong, well-educated modern workforce that fosters productivity in business and industry and contributes to Virginia's leadership in the international marketplace. And whereas through career and technical education, students gain meaningful experience in practical applications of basic skills such as reading, writing, and mathematics. And whereas adults can improve their lives with career and technical education by learning new skills that will provide them with more career choices, expanded earning potential, and greater job satisfaction. And whereas the cooperative and ever-increasing efforts between career and technical educators, administrators, and representative of business and industry stimulate the growth and vitality of the new Virginia economy by preparing citizens for careers in high demand, high wage, technologically skilled areas in a global economy. Now therefore be it proclaimed that the School Board of Stafford County hereby proclaims February 2022 as Career and Technical Education Month throughout the school division. Adopted by the Stafford County School Board this 8th day of February 2022.
Thank you, Ms. Osborne. That brings us to awards and recognition. Our first award and recognition. Oh, yes. Is any of our CTE teachers here, staff?
I see Dinah.
Oh, where? Hiding?
Dinah, stand up.
Thank you.
Dinah is in charge of our CTE program for Stafford County. I know this because I work on committee advisory with her. She does a phenomenal job of trying to find a multitude of ways of getting CTE into the hands of as many of our students as possible. And so I appreciate all the work you do, Dinah. Thank you.
All right, that brings us to our awards and recognitions. The first is recognition of Detective Nick Ridings, Sergeant Barris Demirci, and K-9 Officer Titan. And also, Ms. Crystal Vanush, our supervisor, had messaged me that she was planning on coming tonight to help us recognize these fine representatives in the sheriff's office. So thank you, Ms. Fanouche, for coming. She is the chairman of the Board of Supervisors, but she's also the Rock Hill representative. Come on down. Where's the dog?
He's
I know.
sleeping.
Off duty, right?
I'm gonna stay here because he's the real star.
Bring the dog next time.
I know.
Thank you so much.
Good evening, Madam Chair, school board members, and Dr. Taylor. The superintendent would like to recognize individuals each month who have contributed significantly to the goodwill and advancement of positive culture among their school, department, and our community. Tonight, we recognize 3 members of our community whose bravery and selflessness reflected greatly upon themselves, their organization, and their partnership with the school division. On January 29th, an attempted abduction of one of our students occurred in Embry Mill. Thankfully, the young woman was brave and quick thinking, exiting the car and running to safety. Tonight, we honor Detective Nick Ridings, K-9 Officer Sergeant Barris DeMercy, and K-9 Titan, who were instrumental in finding and arresting the abductor. We, along with the Stafford County community, remain grateful for our partnership with the Stafford County Sheriff's Office and for the bravery and commitment demonstrated by each and every officer in the department. Thank you, gentlemen, for keeping our community safe.
Ms. Halstead's she's in a true dog.
That's great.
Thank you. Thank you.
Good? Yeah, good. Thanks, guys.
Annually, the Virginia School Board Association Board of Directors designates the 3rd week in February, this year, February 14th through the 18th, as VSBA School Board Clerk Appreciation Week. This year, we honor our dedicated clerks, Ms. Missy Hall and Ms. Angie Murgo, for their work ethic and dedication to the school board. It is especially important this year to take a moment to thank our school board clerks who have remained attentive and ready to help throughout the barrage of changes. While we appreciate Ms. Hall and Ms. Murgo year-round, we are grateful to recognize them officially during the designated VSBA School Board Clerk Appreciation Week. Thank you, ladies, for your continued and appreciated service. Annually, February is declared Virginia School Board Association School Board Appreciation Month. Often, this is a thankless position, but one that requires a significant commitment of time and dedication to our most important resource, our students. We're grateful for the long-standing service of many of our board members and for the ideas of our new board members. Thank you to our current members and to all those who have served in this capacity. We appreciate you. Ladies, if you look, you'll see some flowers, and we left you a bag. Thank you so much for everything that you are doing.
Thank you so much.
Oh. Ms. Randall.
Come down, yeah, picture taken. Don't get too comfortable.
Ms. Halsted.
I know, I can't. Thank you.
Ms. Guy. Ms. Sigmund. Dr. Warner, we are appreciating you digitally. And Dr. Chase.
So we just want to add that the staff has provided some flower arrangements and a gift bag for you that you had at your seat when you arrived. Happy School Board Appreciation Month.
Thank you. Thank you.
I love my flowers.
All right, that brings us to our presentation from the Ad Hoc School Transportation Committee on their report. And this committee has been working diligently for months, meeting literally every week to work on a request from the school board and the presentations tonight. So thank you very much, Mr. Valls, for your work on this and the committee. Is there anyone from the committee here this evening we can recognize? I know
Brandy.
Ms. Brown. Anybody else here?
Laura.
Laura Brewer in the back.
Stand up.
Stand up.
Well, thank you all for all that time. I mean, I sat in on a couple of those meetings, and they were
Painful.
very intense.
Well, good evening, Madam Chair, board members, Dr. Taylor. Tonight we present the findings of the Ad Hoc Committee that has been meeting since October. And so Mr. Favre and the board members have prepared the findings, and we'll present them to you tonight. Mr. Favre.
All right. Thank you, Mr. Baldwin. I'm going to take this off. Madam Chair, members of the board, Dr. Taylor, I think I saw Dr. Jones. I know he was instrumental. Thank you. Mr. Fulmer, and I'm sure everyone else came out to specifically for this presentation, so thank you to everyone. I mean, this is important. I mean, I feel, as chair, I feel the weight of this presentation just because of what it represents, because of what the county went through in August, September, the recommendations that we're going to make that deal with getting children to school on time. It affects parents. We're talking compensation. We're just talking safety, a whole bunch of things. So my goal here is to present our findings as clearly and as straightforward as possible. I just feel the importance of this. The school board adopted a resolution back in September 14th, 2021 to set up this committee to establish this. In that resolution, the committee was to report back by February 15th, so thus that's why we're here today on the 8th. The committee, in the resolution, unless everyone changes their mind, we're concluding at the end of this month. So our first meeting was on October 14th. So generally, we have been meeting every week and working hard. The committee purpose was really, in the resolution, were 5 things to really look at, specific topics. Walking and biking zones, car rider procedures, bus drop-off and pick-up, travel program, and transportation support facilities. And then really after a disastrous first meeting, of which I chaired, Mr. Baldwin graciously pulled me aside and said, we have the 2020 report. There were 5 things that we've been working on. Let's talk about those. Let's talk about these 5 things. It really was a game changer and I think a lifesaver. And, we've come away with some things that are really, I think, actionable for you. Here are the members, just so people know who was there.
of generally 19, so I would say for the most part, except for a couple of weeks, we had a quorum, so thank you. Again, thank you to everyone who's come out. I mean, I can't really say enough about the membership. I, as a citizen, learned so much about transportation and Stafford County Public School transportation and what goes on. So, you know, if you really want to learn the ins and outs of something, volunteer to be on a committee. It's really educational. So thank you. I mean, I can't really say enough about the people that were on the committee and the ideas brought forward and the information. So honestly, none of these ideas that are presented tonight were mine. So we're going to talk about the recommendations. We presented, you know, sent a read ahead, so I'm not going to go into every jot and tittle and every little bit of information on here. These are recommendations, so just like if you went to the doctor and they said you had high cholesterol and they recommended not going to Five Guys and eating burgers and fries every week, you know, you can take these recommendations or you can ignore them. So if you ignore them, you know, just you cross your fingers, hope things just continue on as they are. We think the recommendations are actually actionable, things that will change and make transportation work better throughout the county. So I'll just highlight these. We're going to dive into these in a little bit more, but you know, first one is update the transportation policies, specifically 7201. That's been sitting out there really since 2014, since the last time it's been reviewed. That was also called out in the 2020 transportation study. Conducting a bell time study, magically that's already going on, so thank you that that's already going on. And we'll talk about compensation. That's been, you know, definitely a factor in a few areas. We'll discuss that. Ongoing training and communication, always a priority. How do we communicate? How do we communicate what we're doing with transportation? How can we implement, how can transportation implement training as they bring on new bus drivers that really haven't had that training on dealing with disciplinary issues? How do they mentor? Those type of things in the training communication. Travel program, you know, we're going to build High School 6. You know, as we all know, Stafford County, a lot of roads, there's a lot more traffic, there's more stop signs. High School 6 is probably in the west end of the county. So, you know, how will you get kids from that high school up to Brook Point or up to North Stafford efficiently? Should they be traveling there? So we'll talk a little bit about that. And then the fleet management shop. So again, that's, you know, we can have all the buses, we can have all the bus drivers, but if we have a bottleneck at maintaining them, if we can't get buses turned around quickly, if there's safety issues and we can't build that, you know, you can have all the buses, but if they're sitting in the shop waiting to be maintained, it's just going to impact transportation. And it'd be great if we had some water, but. So we talked about the 2020 transportation study. I mean, how that happened, there were a lot of things that were recommended in there, a lot of things, and COVID hit. A lot of that was put on pause, but, you know, Mr. Baldwin said, you know, we're doing things, we're pushing forward on that. So, you know, again, the 5 things that came out of that: update your transportation policies. So we have a transportation policy from 2014. Now's the time to update that, to really enable transportation to really be proactive, to update their regulations, make their SOP changes. It's really important. I think they can do a lot of things. They can implement a lot. Highly recommend that the school board take a look, prioritize, reviewing the draft that exists today, you know, commenting on the changes, voting that through and begin to implement that. And then allow transportation to come up with their regulations and their SOPs that they can then in place. So, you know, that allows them to do things like these mentoring programs, you know, standard policies that they're just not able to do right now. So I think that would be an easy, quick fix. Second one was conduct bell time study. Found out this week that that's already going on, and honestly, it would have been nice to get a courtesy email or call that you guys had tasked Dr. Taylor to do that. It'd be kind of awkward if we came up and said, don't do that, and he's already done that, but fortunately that's happened. I will say that, you know, it's great that you're doing it now. In the original study, it said to be done by January for impact in August, so, you know, fortunately you're only a month behind, but, you know, you're right on, so kudos to doing that. Third one was implement a technology plan. Let me just check my notes. And really, it's just, you know, how do you integrate? There's a lot of technology in transportation that's going on, whether it's the cameras, the routing, GPS. You should implement that. Maybe this is something that the Technology Advisory Committee can take on, but that's something that should be developed because there is a lot of technology. You've seen the presentations from Mr. Fulmer and the prototypes of the digital maps, but there's a lot of information in that. It just makes sense to go ahead and implement that technology plan. Last two were just continue as is from that original 2020 study, the organizational changes and the bus operator contract changes. So the committee didn't have any new things on that. So we shifted into things that the school board specifically asked. In the walking zones, you know, Mr. Martin did a great presentation to us. There's only 4.8% of students using walking zones. So again, we just continue to ongoing review. You know, there's really no sidewalks aren't falling from the sky. We're not paving in new sidewalks to make it easier. So again, just continue to do that. We asked that Ferry Farm would be bumped up in that ongoing review. So I think just continue to do what you're doing in safety. Some of the issues were, you know, we talked about the bikes, we talked about different things, but just the safety. I mean, as I drive down 610, you know, I see kids trying to walk to North Stafford where there are no sidewalks, and I can't imagine like trying to bike there. So our ultimate recommendation is just the ongoing review. And then to review pay for uniformity among traffic control positions and crossing guards. So there was some apparent discrepancies there. So again, asking for that review. Car riders drop off and pick up. So two recommendations there, and I think some observations. And I know, you know, I think if we could solve this problem, you know, probably all win Nobel Prizes for this because it is hard. One of the things would be just standard drop-off times across all the schools. So, you know, if school A is 7:30, you know, school B is 7:45. It'd be nice just to, here's standard drop-off times for 30 minutes before bell time or 20 minutes or whatever. Just standardize it. I mean, then plan ahead when building new schools. So, you know, think ahead. How are we going to get buses in? How are we going to get car riders in? I mean, you have the Stafford Middle one way in, you know, try and work it out. You're not going to change that. So really plan ahead. When you build high school 6, how do we get that figured out? When you're building an elementary school, how do we figure out how to get just better traffic flow? And, you know, the Stafford County sheriffs have been helpful, and they're always out there at the beginning of the year working. I will say that it was observed, and we don't have any empirical evidence, but it seems that, you know, having high school last just created more bottlenecks because, you know, if you're trying to get your kid to soccer or to music practice or athletic practice, you're going to be there at 2:30 and try and jump the front of the line because they're not going to ride the bus. It'll be too late, or they need to get to their job. So we don't have any empirical evidence to say that, but, you know, observing Colonial Forge, Mountain View, traffic is just backed up. It's backed up into public streets, and, you know, just something to observe. No real solutions, but just plan ahead. And I know you guys can't help, but, you know, do we really have to build houses along the entrance to Stafford Middle and Stafford Elementary? Sorry, I digress. Travel programs. So we had a really good presentation on that from Dr. Nichols. There are a lot of details in the more detailed presentation. But really a comprehensive travel program review prior to high school 6, just because of the distance, you know, how do we move children back and forth, kids back and forth? And we talked about, do you want to offer every class or every course? You know, we understand that if you're doing auto mechanics or cosmetology, that, you know, they have to be at a certain place. But, you know, if it's, you know, something IT or something where you can have it at each school, you know, is that an option? So I think this is more of a longer term recommendation, but, you know, you definitely do need to do a comprehensive travel program. Are we going to really haul children and students from high school 6 all the way up to, you know, Brook Point at 7 a.m. when traffic gets post-COVID back normal in 95? I mean, that's really what we're asking, you know, do that. Evaluate the courses offered, you know, that's beyond the committee. just because of all the regulations and hours. And then we talked about, a lot of students, are leaving early, skipping the last 10 minutes. So one of our parents asked, could we put in some kind of period in the middle of lunch hour, where it's an hour-long block where they can go catch up on work, talk to students, or talk to their teachers, get information. So kind of ties back to your bell time study and how that might fit throughout the day, but that was a recommendation that could we do that? Because, how do we address that learning loss if they're leaving 10 minutes? How do they make up that 10-minute loss of education? Transportation support facilities. So again, I see this is on the new CIP. So again, thank you. Thank you. The committee thanks you. And I know Mr. Jeter was here, he would thank you. But prioritizing that. It's just built in 1980. It's 40 years old. It was built for Stafford County in 1980. There's only so much throughput you can get in there. If the buses, if the buses are held up in there, they're not going to get out to Mr. Baldwin. He can't drive buses that are sitting in the bay. If you got police cars that are taken up, you're robbing Peter to pay Paul. So again, I know it's just started on the CIP, but this is really important. Safety issues, if you get a chance, go down and check it out. I mean, it was eye-opening to get a tour of it and just see what the conditions they're working on. Bus replacement program, just an ongoing, how do we continue to rotate through buses on a regular basis, develop that, so every year, we're offloading them. I mean, there were some buses in there last night when I saw that were probably from when I was riding the school bus, but, after some point, after 15 years, you have to rotate them off. So how can we have a regular program to do that? And then compensation. I know you guys, I saw it earlier tonight, but again, I know if Mr. Jeter was presenting, it's hard. I mean, they're paying, a talented fleet service person with all the certificates. He says they can go up to Jiffy Lube and get the same pay. So, if we lose those people, buses are going to be longer. You're just going to run into the issues of, I have buses that I need to do routine maintenance, taking longer. They're off the road. Now I can't, doing double runs, you get the picture, you've lived through it. So again, reviewing the fleet service staff compensation to make sure that you're maintaining, recruiting, and Mr. Jeter's even talked about how do we develop an apprentice program? Can we bring in some, apprentice, some high school seniors start to develop that have an interest? Can we build that in? So, everyone's favorite, money. We always have to talk about money. So again, evaluating other related positions. So again, I'm from the outside, so there's a lot of budget things that I totally don't quite get. But a lot of making sure that you evaluate other positions in fleets management that may have not gotten through the standard 5% raise. So just going back through those pay scales, it's people and in the support type staff positions. So just making sure that they're fairly compensated and covered in those, because those people are just as valuable as all the other staff. We talked about the fleet service. Again, we want to continue that. And then bus attendants. So, bus attendants are huge, valuable. Starting bus attendant pay was $14.56 an hour. So, which is less than, less $17,500 a year for a starting bus attendant. So, please take a look at that. And, if we want bus attendants are so valuable. Please review that compensation and let's, fairly compensate them. The last thing we want them going is to some other county. So please do an evaluation of their compensation. So other things that came up, those were the primary things. So again, we talked about student conduct, discipline. One of the things that Principal Olchenko out of Stafford Middle said, what impacts him is, if there's an incident on a mainstream bus that comes into Stafford Middle, he has to get out, go on the bus. If that's 10 minutes that he's investigating, pulling tape, talking about it, that bus is sitting there for 10 minutes. That bus sits there for 10 minutes, the next bus is backed up, well, let's go talk to that guy. It's just backing up buses. They're 10 minutes out, getting out on their route, it's just an impact. So he asked, could we set up a pilot program to put bus attendant on a mainstream bus that the principal has identified as having, some issues or concerns to do some preventive correction, some education, some training. So I believe, and I think when I talked to Mr. Baldwin earlier, that pilot programming is being developed and will be rolled out this month. So, with the idea that there will be some measurable outcomes on that, but it's something that's definitely going to help. If we can minimize these incidents to get your principals not focused on holding up the bus, actually doing what principals are supposed to do, it's going to be a win for Stafford County Public Schools. And then training. So right around COVID 2020, there was a new expectation for positive behavior. The acronym was BUS, and I can't remember for the life of me what that is. But again, going back, how do we train students to actually, be good bus citizens? Could we do training? Could we build a training mentoring program for, the more experienced bus drivers, as new bus drivers come in, set up a mentoring program that says, here's how I handle disciplinary situations, here's how I handle X, Y, Z. And it goes back to how do we set up standard operating procedures for at the transportation to handle that. So tied back to your policy, which was number 1. We're getting close. Route planning, and I know this first bullet, is, if I recall from a previous board meeting, has some connotations, but recommendation was somehow, to opt in, at least have a starting point, so as they develop routes, and whether it's 25,000 students, 30,000, whatever that number is, that they can start and plan those routes. Students, it doesn't mean they won't be able to get a bus. They can do that within 24 to 48 hours of working through their school. So if they don't make the bus route at the beginning, it's not the end of their bus riding career. So that was our recommendation. And then communication. If you're changing, bus times and route times, now is the time to communicate it. You have new students coming in. How can we get, instead of just the last second back to school night where everybody's got 38 forms thrown at them and they're trying to figure out lunch for their kid and whatever else, how can we push this earlier in the year? How do we communicate out what they need to do to ride the bus, expectations? So just, push this down at the principals, the people that understand it. How do we communicate that and get those communication out? So can't really emphasize, I know, I think it was Kim Baldwin that said communication, please emphasize communication because it's so important. And, each school has their own different way of doing it. I don't think we had a standard recommendation, but, the earlier that you can communicate, here's how bus works, here's how the bus app works, here's how you sign up, here's how you request bus transportation. The earlier you can do it, the more successful you will be. The rest is just summary. So, at this point, hopefully, we'll just summarize that. Thank you. I'll take questions. You could ask Mr. Baldwin. I do want to say Missy has been phenomenal. She helped us out phenomenal with, just everything. So I know it's that, you were rewarded, but thank you so much. I really appreciate that.
I have one. So first of all, this is so well done, and I appreciate the time, effort, and energy that you guys put into this. You should be exceptionally proud. This actually takes me back to my emergency management days where we did after-action reports and could actually give people items to focus on and do. So this is so well done, and the public has access to all of it, right? I suggest really taking a look at the work that you guys have done because it's fantastic. Did you guys talk about timelines or prioritization, like a scheme for prioritizations or timelines for almost like a deliverable-based kind of concept, or did that not come up yet?
It hasn't really come up. I mean, I think the first slide's kind of those ideas, but again, these are recommendations. You can kind of throw them all out if you want, or, I mean, if you want us to do that, we could probably come up with.
I just wonder if
I
it would
really
help.
think, setting the policy, because the policy is going to drive, Mr. Baldwin's ability to set up standard, here's my procedures that I want to follow and implement, and then here's my standard operating procedures, and really enable him to more efficiently and effectively really manage his department. So, I think that's, we have a 8-year-old policy that's, out there, so, and I think the rest will kind of fall into, and I think we tried to make these actionable. If I would have said, let's go buy flying buses because we can just bypass traffic, it's not really reasonable, but you have actionable things that you can actually implement and decide, yes, we can do these, and some we've already done. I mean, the fact that they're starting this pilot programs, kudos. I mean, that's input that we're also getting. None of these are really, I just put this together and kind of kept all the balls in the air, but a lot of this is from Mr. Jeter, it's Mr. Baldwin, it's a bus driver's expertise or attendant's expertise. It's, the principles that say this works for me, but this doesn't work, and, this would help me actually, in Mr. Olchenko's, he's like, this public probably doesn't want their principal being, bus disciplinary for 4 hours a day. Is that really what you guys are paying a principal to do? Is that what you want him managing a middle school? So. Sorry that probably went far beyond what you were asking for.
Thank you guys again so much for meeting, because I know from being on advisories that only meet once a month, to do this once a week for this many months is quite an undertaking, and I really, really appreciate all of our volunteers that, we asked from our different districts to help support this, and as well as staff to participate in this. So I also want to and more this for the board, but there are some things in here that when we were giving straw polls for budget considerations, I think in light of this that we might want to look at some of maybe the recommendations to consider for our budget as well. So I just wanted to add that because I really appreciate the things that you put forth to us with your time.
So piggybacking on Ms. Randall's question, so is there an item that you all as a group thought would be the highest priority in terms of something that the school board could do?
I think, what'd you guys say?
I didn't say nothing.
Somebody said compensation. I think, the people that you have, if you, bus attendants, I mean, I'm kind of embarrassed when I heard 14 something an hour. I mean, I'm like, really? That's, and they're the people that are, they're helping the bus drivers out. They're doing above and beyond. And also thinking like fleet management. If you lose those people up to, to Jiffy Lube or Prince William County, I know talking to Mr. Jeter, he's like, I can't even, when I tell him the salary, it's like, thanks, but, no thanks. So we're already, how do we get people in? So I think that.
So I would just like to ask if the board agrees to ask, for some feedback back to us about what would it cost to do an initial attempt to look at bus monitor salaries and fleet service salaries. I don't know whether we can for this year or not, but it'd be good to sort of see what the number is, and we could certainly ask across the street. I know that they were very interested and concerned about transportation all throughout the fall, so thank you.
Correct, Dr. Taylor, that's some information that you can provide for the board. We do have another budget work session coming up at our next, before our next meeting, so it's something that we can bring forward. Dr. Warner.
Thank you, Madam Chair. I had a couple quick questions that weren't quite clear from the presentation, but first of all, I want to absolutely thank everyone on the Transportation Committee. I know there's a tremendous amount of work. It's very difficult to meet once a week And I know that with the new constraints on the meeting process, I know that reaching a quorum and getting all those things done was probably a real challenge. And I just want to say how much I appreciate everything everybody did. I'm curious, and I don't know if you know the answer to this, do we pay our fleet services for a 12-month calendar, or are they on a 9-month calendar in the same way our bus drivers are? Would the summer be an effective time for us to maintain those payrolls so that we can keep our buses more operational? And is that something that we could look at for a budgetary consideration?
Good evening. Fleet services do operate on a 12-month contract. They're a little different from bus drivers, but they do work year-round.
Okay. Ms. Sigmund?
I too want to thank you for your work. You know that I am a huge proponent of advisory committees, and you guys have worked your tails off. So on a really important conversation that our county needs to have in kind of like an ongoing manner. So thank you for getting us off to such a strong start. I do like the pilot program for bus attendants. In my head, I'm envisioning, is this like an ad hoc group of people you could call and basically be like, you're on bus 2 today? Because we might have an issue there, and these people just kind of they sit in a pool on call, or are they?
Well, right now, it's a pilot, and
Right,
it's
the
a
idea
focused
of-
target, and we want to see how the program works in building with the behavior management in addition with the bus. We just don't want to stick a person on the bus, and all they're still doing is writing referrals, much like the bus driver's writing. So we are trying to combine some evidence-based behavior management techniques, in addition with providing extra eyes with a focus on redirecting and acknowledging positive behavior on the bus. So we're going to start with a small target group at Stafford Middle, being able to monitor and collect the observations and measures and be able to report back out if this is something successful, it works, and then we want to try to duplicate it where needed.
That's awesome. I love the idea of kind of having floating monitors to be used as needed, discipline or not, just when you feel like a route might need some extra hands.
Absolutely. And we want to set that stage.
Yeah.
So.
Thank you. Ms. Guy?
Like everyone else, I want to thank you guys for meeting once a week. I can't even meet with my husband once a week, and I live with him. So the dedication to do that for all these months when you have families and other things to do and jobs. Like when I met Dr. Taylor, he asked, what's the best thing about Stafford? And it's the people who would do something like that for that long. So I really thank you. I think this is a great presentation. The information was great. I feel like I agree with everything that you guys did. You said develop a bus replacement program, and maybe, I just thought we had one, just from how we talked about fleet services before, but I don't know, maybe I don't understand. But if we don't have one, I really hope we get one, because I think that'll make you guys' jobs a little bit easier. And I just want to thank you. I thought this was great information.
Well, thank you. Thank you.
All right, I'm going to be the echo here. I went to just a few of your meetings, and I know how hard everyone worked, and there were actually about 19 people on that committee. So that's quite an undertaking. But what the committee did was look at some really challenging issues. And for the first time, we've got some review and recommendations. And this is, it's not a reflection on our staff. This is from an outside source with community members, and of course, a lot of staff members were there, and provided, very important input, because you need to have that mix in order to be able to identify the issues and then address, potential solutions. So I'm very appreciative that not only have you identified the issues, but you've given us some solid recommendations and, a starting place to go forward from. So thank you and your committee for all the hard work. And I'd suggest that as a school board, we perhaps in maybe a month from now, once we get through the budget and some of the other issues that are facing us, that we have a work session devoted specifically to this report, the recommendations, and where we want to go. And Dr. Taylor, if you could provide some, additional information about the cost and, how we might be able to achieve these enhancements in the system. So we've come a long way since September. And, well, this is when
Yeah,
we
I
were
think-
commissioned in September.
Yeah.
Yeah,
I mean,
so, thank
you have to
you.
give this gentleman credit for, 50, hiring 50 new bus drivers. I mean, that's a huge thing. I mean, when he tells me that he's got more bus drivers than buses, okay, we need to fix the second part right now, but, you guys have come a long way, and hopefully this helps us, make next August, September a lot less painful
And
for you all.
it's a benefit to the entire community. When we can get our kids to school on time, get them home, have that communication system working, there's really not words for me, because, where I was last summer, and I feel like there is a light at the end of the tunnel here, and we're able to proceed. So thank you again, and thank you to the committee. Now, remember, you're not finished until the end of the month. So if we think of anything else, that
still be here.
wasn't that the end of, we said February, and
Yes.
it's only 28 days this year, so you don't get that extra,
Resign.
that extra day, but
Thank you.
but thank you.
Thank you for listening and for the time.
We appreciate it.
Thank you, nice job.
So I think we should give them applause. All right, our next item is the mid-year financial report, FY '22. Dr. Taylor.
Thank you, Madam Chair. We have a paper report for the board's consideration, and our Assistant Superintendent, Chris Fulmer, will take any questions that the board may have, but it is just a paper report
Okay.
for the board's consumption.
All right, thank you. Does anyone have any questions now for Mr. Fulmer? If not, you can always present them to Dr. Taylor, and he get the response and share it with all the board members. So any questions? Dr. Warner, do you have any questions for Mr. Fulmer?
No, Mr. Fulmer presented this at the last FAB meeting, and I will review it.
I think that was a no, Mr. Fulmer. You don't need to come down. I think he's
No, I'm
smiling
good, thank
underneath
you.
that mask. I'm sorry, Dr. Warner. Oh, you said no. Okay, all right. Well, if there's no questions, that'll bring us to our public hearing on the budget. And I'm going to read our instructions about comments. But before we do that, I want to read another informational statement for the audience and members of the public. And this is a statement regarding digital public comments. At the school board's retreat last month, the school board directed the superintendent to expand our ability to take public comment by creating a digital portal for community members to share their thoughts. Since not everyone can attend school board meetings in person or stay for the whole meeting, the board wanted to provide an opportunity for those individuals to give comments. Digital public comments will be recorded as an official part of the record of each school board meeting. There is a 2,500 character maximum on digital public comments, the equivalent to approximately 3 minutes of speaking time. Each individual is limited to one digital public comment submission before each board meeting. Digital public comments will be collected through 2 p.m. on the day of each board meeting. All collected comments will be distributed to the board members prior to the start of the meeting and will be posted to the meeting agenda on board docs and made publicly available as an addendum to the meeting minutes. Language that is abusive or profane will be redacted from the recorded documents. Digital public comment will be temporarily suspended for 24 hours beginning at 2 p.m. on the day of the board meeting until 2 p.m. the day after the meeting, at which time comments will reopen and be collected for the next board meeting. And there is a link to the new digital public comment available on our website at www.staffordschools.net/public comment. And that's effective for this meeting tonight and every meeting in the future. All right, we have a public hearing this evening on the FY23 operating budget. 3 minutes are allotted to each speaker or group. Speakers are encouraged to provide a copy of the comments to the board clerk. Speakers shall identify themselves by name and organizational affiliation if the spokesperson represents an organization. Speakers shall limit their comments to the subject of the FY23 operating budget. The chairperson reserves the right to restrict the total citizen comments to a predetermined maximum number of minutes with the approval of the board. Citizen comment which is profane, abusive, or which threatens imminent physical harm shall be ruled out of order by the chairperson. Although the board provides the opportunity for citizen comment, individuals desiring to register complaints against division employees or division programs, services, or activities may also utilize the procedures outlined in Stafford County Public Schools Policy 1113, Public Complaints. I have 7 persons who signed up to speak at the public hearing on the proposed FY23 budget. When this hearing is closed, then we'll come to the general citizen comment section. So I'm going to call these 7 names, and if there's anyone who wishes to speak on the FY23 budget, they can come forward after we hear from the 7 persons who signed up. The first speaker will be Alan Watkins. The second speaker is Stephanie Johnson. The third is David Fouth. Fourth, Michelle Wickman. Fifth, Clifford Heinzer. 6, Brandy Quirk. And 7, John Lowe. So Mr. Watkins, we'll have you start us off. And I will ask, because we have a significant number of speakers that have signed up for the public comments general portion, that you wrap this up at the time that red light goes off. It'll start showing you 3 minutes, the yellow will come on when you have 1 minute left, and then when the buzzer goes off, we'll have to have you done. Thank you.
Good evening, members of the board and Dr. Taylor. Even though I do have several different documents in front of me, which some of you might be familiar with, I'm not going to be discussing them tonight. My name is Alan Watkins, and I live in the Hartwood district of our county. Regarding the proposed budget, as a former teacher of 46 years and one who formerly was pretty involved in advocating for improved compensation for all educators, I have 2 main points. Number 1, the proposed budget includes the greatest increase in pay that I have ever seen. I applaud that. For teachers, the scale is a dramatic improvement. The second point, I hope that the increase in pay is not too little, too late. On one hand, it's wonderful that some teachers' pay will increase by over 15%. I wish it was 50. 15%, but on the other hand, it's terrible that it's taken until this budget for corrections like that to be made. The SEA was fortunate enough in the past years to work with Mr. Fulmer, Mr. Burnett, and Dr. Kisner, and propose changes to the scale. I see these changes starting to become a reality. Reducing the top of the scale, working towards 30 years. Correcting the scale by establishing consistent percentages from level to level. Amen. To attract and retain, I urge the board to collectively work with its employees. The budget is a great start. Together it can lead to much greater success. Finally, our community needs to get involved in supporting the budget. We have seen how passionate our community can be. I'd ask that our community direct that energy to getting our schools the county funding necessary to reach our goals. Thank you very much.
Good evening, Madam Chair, Dr. Taylor, board members. My name is Stephanie Johnson. I am the president of the Stafford Education Foundation. On behalf of the SEF board, I wish to express our support of the proposed 2023 budget submitted for approval by Dr. Taylor. The budget presented supports the retention and support of current educators and professionals, as well as recruiting educators to support the student growth of Stafford County. As our mission states, we are here to impact and advance education in Stafford County Public Schools through charitable activities that support sound educational programs and practices. This cannot be done without the support of our professionals, not only teachers, but paraprofessionals, specialists, bus drivers, cafeteria staff, office personnel, and every person working in Stafford County Public Schools with or on behalf of our children. Please support Dr. Taylor's proposed budget. Thank you all.
Good evening, David Fout. I'm in the Acquired District, and it's not every night that I get to talk to you multiple times. Again, great budget. I'm really excited about that. I'm actually more excited to see a multi-year budget, but I'll wait for another year on that. And again, I will still advocate for our bus attendants, our bus drivers, our fleet maintenance staff. So please, if you can, do that. We do hear a lot about parents wanting to be involved in their education. The best way now is to be involved in talking to your Board of Supervisors. There's February 22nd, 23rd, 24th are budget meetings on the Board of Supervisors calendar. None of you are raising funds. None of you are taxing us. It's all on the Board of Supervisors. So if we do want this budget to go forward, if we do want to pay, the people that are doing this, that we need to catch up on lost education, we need that. So parents, community, please reach out to your Board of Supervisors, have them support the budget, have them support the needs of the school, and be involved. Thank you.
Good evening, members of the board. Dr. Taylor, my name is Michelle Wickman. I am a resident of Hampton Oaks, a parent of 2 children in SCPS schools, and a teacher at North Stafford, world's greatest high school. I'm speaking tonight in support of Dr. Taylor's budget. During his presentation, Dr. Taylor highlighted a teacher with 14 years of experience. While that teacher isn't me, his words reminded me of the time nearly 6 years ago when I first realized what had been done to our licensed salary scale. If you placed the scales side by side over the years, a teacher with 15 years of experience in 2016 made less money than a teacher with 15 years of experience in 2006. The absurdity of this still boggles and frustrates me. Teachers spent years with frozen steps prior to the experience scale, and afterwards they spent years without cost of living increases, paying increased health care costs, not keeping up with inflation, all while we continued lowering the upper end of the scale, robbing Peter to pay Paul, ruining our retention and recruitment abilities. What's really sad is we had to beg across the street to get those budgets passed. Fortunately, Dr. Kisner started us on the right path with the changes he enacted, but we still have a ways to go. Dr. Taylor recently told SEA members, the only way to fix this pay scale is to rip the Band-Aid and just fix it. I wholeheartedly agree, and I think that what he's doing will go a long way towards keeping our educators here and attracting new ones to join them. I actually had a teacher friend tell me, wow, I'd stay in teaching for that kind of money when I shared the proposed scale with them. Is the budget perfect? No. North and Forge need those turf fields you keep hearing about. The licensed salary scale still goes up to 35 years of experience, while retirement is at 30 years. We need to look at compression in the future so that we're not requiring teachers to stay 5 years past retirement time to hit the top of that scale. But the proposed scale is about 10 steps in the right direction when we've been going backwards or taking baby steps for years. Finally, I think this budget has a good chance of getting passed through the Board of Supervisors. This could potentially be SEA's least stressful budget season in my 8 years here. We need to capitalize on that opportunity. Please approve Dr. Taylor's budget, though maybe figure out how to work in those turf fields. I'm excited to see the data on recruitment and retention after this goes through. Thank you for your consideration.
Good evening. My name is Cliff Heinzer, and I live in a quiet district, and I wanted to speak to you tonight in support of the budget. I think we cannot understate the consequences of under-resourcing our school system. Young families are the lifeblood of any community, and they're not going to come to Stafford if we don't have top-notch schools. I can speak from personal experience that the failure to properly fund schools can have long-term and profound negative consequences. Extended use of temporary classrooms, staff shortages, these are all warning signs that we may not be sufficiently resourced. If we do not fully fund our schools, the character of our community can change, and it won't be for the better. Let's not be penny wise and pound foolish. Let's make the investment today in our schools. We'll reap great rewards many times over in the future. Thank you for your time.
Hi, good evening, school board members and Dr. Taylor. My name is Brandy Rice, and I'm with the George Washington. Brandy Rice. Well, that was when I was here in the library at Stafford Middle. Okay, I digress. My name is Brandy Quirk from the George Washington District. My reason for being here is to, number one, make sure that good old Wolverines get that turf. When I was there, we were only one of 2 high schools, and we were the first to get the rubberized track. Let me tell you about that and that track team. Go look at the awards during those years. It was amazing how much it made a difference for us and to be able to also host other schools. Now let's consider grand old Ferry Farm. Let's take a moment and reflect. So June 11th of 2019, I was here speaking to some of you who were presently on the board. Some of you I know that are familiar with most of the story of Ferry Farm Elementary. Speaking of infrastructure and how do we support our schools in the long run. I'm so excited Ferry Farm is going to be celebrating our 65th anniversary of opening this fall. Are the renovations ready? Are we ready to cut that red ribbon? Who here on the dais has seen Ferry Farm prior, as it started, and as it continues? I hear we're getting our parking lot in 2023. I'm also told it's not only going to take the school board, the Board of Supervisors, VDOT, and the Army Corps of Engineers to take care of this. June 11th of 2019, I presented to the school board, and I brought up the facilities assessment document, which was out in 2017. It specifically talks about this area, the parking lot in the front, that was going to have to take the school board, the Board of Supervisors, Stafford Utilities, and VDOT. Well, now here we are. If you haven't been to Ferry Farm, well, you really missed out last week because it was a lot. I was wearing my muck boots to get into work. I really urge you, if anything, to look at how this renovations was handled in a phased effort. This is not how we do it. I'm concerned that there are items that still need to be fixed that are on the 3R list. Well, if other items come up, does that mean we're only going to get a little bit left of that money? Please, at the very least, use this story of almost 3 decades as an example of how maybe we don't do business and how we better do business with the agents of our school. Thank you very much.
Yeah. If there's anyone that wants to speak after Mr. Lowe, please line up on the side so you can come down. Yes, this is still, we haven't closed the budget hearing. Yes.
Good evening. Thank you for the time this evening. I come to talk to you about the turf fields. I sent an email to each of you, so to kind of summarize my thoughts. I think the The issue of competitiveness, equity, those are all fairly obvious. It's not just on the field at game night where a high school has to play a home game at another school's field. It's really more in the practice realm. And that has a cost in so many ways, not just in the outcome of a game. That's kind of interesting. It really has more of an outcome on the child's opportunity to improve their skills in their sport. And for a lot of children, that is the way they're going to get a college education. College educations have risen. One of the few public services that have increased in cost over the last several years is college education. And so it's getting more and more challenging to present a child in school and afford it for 4 years. That's not easy. And so giving the opportunity of a child a competitive edge by having those turf fields is helpful. I think the other things to consider are safety and then the litigation risk that we're putting ourselves in. So in terms of safety, when those rainy days happen and those schools need to practice, many of them are doing one of two things. They're going to a gym that is not suited for the sport in which they're practicing. It's not suited simply if the child falls. They generally don't have the proper footwear, so now we're facing other injuries. Those are all choices that could be prevented if they had turf fields. Secondly, a lot of these children, in the high schools at least, are moving to where the turf fields are. So in the worst of weather conditions, we're putting high school kids on the road to drive down to a field, usually at a pretty high rate of speed, because I don't know if you've noticed, kids aren't real efficient in getting a point A to point B in a timely manner. And they realize at the last minute, they need to be there in 30 seconds, and so the right foot hits that thin pedal on the right, and things on a slippery road probably won't go well. All of that opens up the school board, the school, to unnecessary litigation. And it puts the safety of the children at risk. They're already putting themselves at risk, quite frankly, by being on the sports field, but we don't need to add to that. So I would urge you to at your earliest convenience, either in this fiscal cycle or the next, but certainly no need to wait to 24. I manage budgets in my agency, and once you start kicking something down the road, you sometimes never get to it. And so you need to take action. It's common sense, and let's make the common sense decision and make it equitable so the kids in 2 schools have the same as the other 5 schools. And thank you. I appreciate y'all's service.
Thank you. Ms. Hall, where's the sign-in sheet for? No, that was the end of the speakers. We have a number of speakers who are going to talk about the budget.
It's right here.
Okay, so after you speak, if you can sign in, we'd appreciate it. So this is on the budget hearing. Anybody else wants to speak on the budget, you can line up on either side. Thank you.
My name is Gabriella Jones, and I teach at Colonial Forge High School. I cannot afford to live in Stafford County. I live outside of the county with family. I wanted to support the budget proposed by Dr. Taylor. As you prepare for the budget for the upcoming school year and consider wages, please consider the rise in inflation and cost of living. The rate of inflation increased by 7% in 2021. Stafford County struggles to recruit and retain educators. There are many solutions to this issue, but the main one should be better pay. It's hard for someone to work in or near an area they cannot afford to live in. The U.S. Department of Agriculture has a chart they use to determine if an individual is moderate income, low income, or very low income. The USDA considers Stafford County to be a part of the D.C. metropolitan area. In their analysis, single individuals that earn $102,000 a year have a moderate income. Individuals making less than $71,000 a year are considered low income, and individuals making less than $44,000 a year are considered very low income. This is my 3rd year teaching in Stafford County. I started as a sub 4 years ago. I am almost finished with my master's degree. This is my 1st year breaking $50,000 in my contract salary. That means I am considered low income by the USDA. After completing a 4-year undergraduate degree, 3-year graduate degree, and a series of professional development and certification courses, I cannot afford to make ends meet and often pick up 1 to 2 jobs in order to pay my bills. This past summer, I picked up 3 different jobs. I put the earnings in my savings. During the school year, my teaching salary does not pay all of my bills, so every month I dip into the savings from the summer jobs. Every month, my pay is a little over $4,000. After taxes, retirement, and insurance, my pay is normally $2,200. According to the U.S. Census in 2020, the average rent is over $1,500 a month in Stafford County. The median mortgage payment is $2,200 a month. Teaching and other public service careers in education should reflect the cost of living, especially if the license requirements and qualifications are as extensive as a bachelor's degree, master's degree, additional endorsements, specific certifications, and professional development. I've printed and highlighted resources that I've used. Thank you. Have a good evening.
Just come on down when the speaker finishes. Looks like we're all on one side.
Good evening, Dr. Taylor and board members. Hey, my name is Dexter Carr, and I live in the Garrisonville district, and I am a proud parent of a rising senior at Colonial Forge High School. We had one that graduated from Colonial Forge previously. So again, won't take up too much of your time, but appreciate the opportunity to come and speak. So my family and I, we've lived in Stafford for over a decade. And upon retiring from the military, we decided to call Stafford County and Colonial Forge home to our children because of the atmosphere in this community. As a parent and someone who is actively involved in the community, we expect and hope that all of our kids be equipped with the best resources to be successful. We have experienced firsthand the disappointment of watching our kids' home games get canceled or postponed due to not having a turf field to accommodate their respective sports. In 2019, our oldest son, a senior at Colonial Forge, his team was displaced for several games and practices, which certainly had a negative impact on the morale of the team and the student body. We are a football family. However, we support all sports and the development and well-being of every young person that participates in organized school sports. But let's take a look at some of the concerns associated with not having a turf field. Not having a turf field continues to create hardships for many of our kids and their families. Examples, the instability in daily routines and schedules, which adversely impact the academics due to later practices and the rescheduling of game dates and locations. And when you have multiple student athletes that play different sports, this becomes a major juggling act for many parents, which now forces parents to choose between which one of the kids do you go and support. This is not an ideal situation for any parent. It robs the kids from having their much needed support from their family at their games. And additionally, when the practices and games are held at a later than originally scheduled, this infringes on opportunities for the kids to work part-time jobs as well. And sadly, but true, many families account for extra income for their kids that may be able to bring into the household. I've coached for many years in multiple sports, and there's nothing like playing in front of your own home field in front of your family and friends. I believe the benefits of installing the turf field now outweigh the reasons for delaying the project. Some of the benefits are cost savings, which the athletic departments occurred, and at the end of the day, we want to make it equitable for all of our kids in Stafford County, and we got 2 schools that need it. Thank you for your time.
Good evening. My name's Joe Riley, and I live in Austin Ridge, and I have an 11th grader at Colonial Forge that plays lacrosse. I've done my research. I've gone to Dr. Taylor's budget town hall last week, and I had intentions of talking about turf fields when I went, but when I saw the budget breakdown and all the competing interests for the little bit of money and the salaries and the transportation and the SOL scores and whatnot, I thought, yeah, I can't bring this up now because Dr. Taylor's going to punch me in the face and I'm going to get kicked out of the budget meeting. Just kidding. But it just didn't seem like the time to bring it up. So I went home and I thought about it and thought about the population of kids at Forge, the student athletes, and how COVID has disrupted, their athletic experience and their high school experience, and the football team and the soccer team and the lacrosse team and the field hockey teams. So I thought, you know what, I am going to talk about it at the next school board meeting because I think it's important. My son doesn't practice at the stadium field. He practices on just a field. It's not marked, it's muddy, it's rutted, and that's when they can practice on it. So you lose a lot of things with that. You lose competitiveness against the other schools that have turf fields that aren't losing practice time. You lose the recruiting of students that become student athletes. They see these guys out there covered in mud and they're like, I don't want to do that. And you just lose your chances of success at maybe playing at the next level for student athletes that want to play at the next level at college. With a turf field, they wouldn't lose hours of valuable training time and practice time. They'd be going into more games with the opposing team having much more time to practice and increasing their competitiveness. The Forge athletic facilities, that's the public face of Forge on game day. Let's see, and an athletic facility that can fulfill its function really doesn't help the student. But conversely, when you have a nice turf field, good athletic experience, more competitive, it falls into other places too. Like, it's going to be a nice graduation. You can rent out the field for playoff games and high school tournaments and increase revenue. So in closing, I don't want to be a dead horse. I know a lot of people are talking about turf, but turf fields at Forge would greatly improve the quality, competitiveness, and safety for the Forge athletes. I would appreciate your support in bringing the Forge athletic facilities and teams on equal footing with other Stafford County high schools and treat the Forge student athletes like first-class athletes. Thank you very much.
Good evening. My name is Kenya Wallach. I'm in the Falmouth District. I have 3 children, 16, 13, and 11. 2 attend Stafford County Public Schools. My oldest attends Michigan State University as a sophomore. What I want to talk about is the fact that I'm not going to talk about turf fields. That's for other people to talk about, and I appreciate that. I want to say Happy Black History Month. And students, our children, are the most important citizens that we have, and we need to invest in them, which is why I agree with the budget that has been proposed. The things that we need to consider doing is a lot of the things that are in the budget. One is increasing salaries for teachers. That's extraordinarily important. The other is teachers are teachers, not just because of the salary. However, I do not want to dismiss the fact that salaries are important and they must have them at the rate that it is required for this area to live. Teachers should live in Stafford County if they teach in Stafford County. They should be able to afford to live here. That's number one. But they also are teachers because they love their students. They love their content area. They want to inspire the next generation. We need to figure out different ways that we can recognize and reward excellence in teaching. That comes in a multitude of facets. So part of the budget, if it can be, portioned out for a recognition program, not just a teacher of the year at the end of the year, but something that is done periodically, every quarter, every month, whatever, to recognize the outstanding teaching staff that we do have here. The next, in terms of students, students must be able to self-actualize themselves at the next level. What are we doing to do that? What are we doing to inspire elementary school kids to see themselves as middle school to see themselves as high schools to see themselves as graduates and pathways into different types of careers? What are we doing? How are we doing that? And in terms of teachers and recruitment, we want to have a diverse teaching staff. We want our teaching staff to resemble the hallways of our classrooms, hallways of our schools. Every student in this school, every student who walks through the thresholds of our buildings should be able to say that they have had a teacher that has inspired them, that has encouraged them to understand not just their own culture, but other people's cultures as well. We are a global society. We need to understand not just ourselves, but people around us. Thank you.
Sorry, I thought there was somebody else going. I'm Dana Brown. I'm from the Rock Hill District. And most of you know me, and you all know that I hate to ask for money, and I never do. I think maybe 5 years ago, I might have asked for some school buses. So I'm kind of tight on that. But I do want to ask you to do something this year. And I want you to think of this as a very strategic move and a cheap move. Fleet services techs, better known as our mechanics, they're hourly. I think you need to bring their wage up to what they make in Prince William. You saw how well that worked with the school bus drivers. It's not that much money. We're talking $12,000 to $15,000 extra a year. We only have 10 techs. Then I want you to double them. I want to have 20 techs. I think you should consider running 2 separate shifts for maintenance because we don't have a new barn yet. I don't know what the hours are, maybe 6 to 2, maybe 1, 2 to 9. But run 2 separate shifts because we've got all those new buses, and it would be a real shame if all our buses stack up in the parking lot because even though they're new, they still need oil changes. They still need tires for the old ones. So also think about maybe staying open during winter break for the buses, getting some, backlog caught up, maybe spring break, and I know those sacred summer Fridays. This way, when we get a new facility, we already have the staff. We can walk right into our new facility and we've got all the techs that we need. So anyway, that's it. It's a cheap fix, and I hope you'll consider that. And again, I never, ever ask you for more money. So this is a big thing for me. Thank you.
All right, is there anyone else who wants us to address the board on the FY23 budget? Seeing none, we'll close that public hearing and come to citizen comments. And this will sound repetitive, but I'm going to read this notice again. General citizen comments. 3 minutes are allotted to each speaker or group. Speakers are encouraged to provide a copy of the comments to the board clerk. Speakers shall identify themselves by name and organizational affiliation if the spokesperson represents an organization. Speakers shall also announce the purpose or topic of their comments. The chairperson reserves the right to restrict the total citizen comments to a predetermined maximum number of minutes with the approval of the board. Citizen comment which is profane, abusive, or which threatens imminent physical harm shall be ruled out of order by the chairperson. Although the board provides the opportunity for citizen comment, individuals desiring to register complaints against the division employees or division programs, services, or activities may also utilize the procedures outlined in Stafford County Public School Policy 1113, Public Complaints. We have 26 persons, 25, one's crossed out, who have signed up for public comment. So I'm going to read these names 5 at a time. If you can line up and follow each other. Mr. Fouth knows he's first because he signed up, but when we finish with the speakers who signed up, if there's anyone else who would like to address the board, they can come forward as well. So Mr. Fouth will start us out. Pam Paxton is next. Layla Paxton follows Pam Paxton, Jackie Oldenkamp, and Shannon Fingerholtz.
We ready?
Yes, and the light system still works.
Awesome.
Stoplights.
David Fowler, Quiet District. So I'm going to talk about 2 things. One, since I forgot on the budget piece, is, as you go forward next year, I really hope that you start to think about how can we just barely not meet the state minimum standards. You know, one person, one counselor for whatever the state minimum is, one psychologist for the state minimum. So as you go forward, please consider that. I know it costs more money, but again, I think the more that we can provide for our students, the better. And then the second one, just, you know, coming off the Transportation Committee, when things settle down, I think the board should really rethink how you're doing the advisory committees. You know, someone asked me, would you step up and do, you know, and join another committee? And I actually looked at two that I would be interested in, and I think they had the first meeting, and it's no quorum, no quorum, no quorum. So, you know, one possible solution would be at the start of the year, what problem do you want to solve? It was very helpful for the Transportation Committee to have a focused set of things to look at and to come back with. I really feel like if you just say, you know, what do you want to talk about, you're not going to get much impact. So again, going forward, if you could, you know, really think, how do you want to use advisory committees to solve a problem, come back with some actionable items, you're going to get more bang for your buck. So that's all I have. Thank you. Good night.
Good evening, members of the board, Dr. Taylor, and guests. My name is Pam Paxton. I'm a registered nurse, small business owner, and mom to two beautiful, bright girls. Layla is 11 and attends H.H. Poole Middle School, and Brooklyn is 7 and attends Hampton Oaks Elementary. Tonight, I am speaking as a mom that wants to be able to choose what I think is right as a parent. Mothers know best is still a thing. My 11-year-old has a medical condition called POTS. She has a 504 plan and still has to wear a mask. She deals with her heart rate going up to the 130s while at rest almost daily. This is scary for a child. It causes shortness of breath and dizziness. Now add to that a mask over your face, preventing you from getting large breaths of oxygen. This makes for a scary situation for her. She can't concentrate on learning because she's worried about breathing. Now she is virtual from home. Virtual learning is anything but fair and equal education. Daily, I have to email her principal because one of her teachers hasn't logged on so that she can see the class virtually. She has one class that, since going virtual on January 24th, has been able to participate in once because the instructor will not log on. My 7-year-old was going to school virtually and became so sad because she was isolated at home that she made the decision to go back to school in a mask. A 7-year-old should not have to be deciding if they want to stay at home, isolated away from their friends, or be able to go to school just to see their friends in a mask. Her biggest worry should be who she's going to play with on the playground. There's no mystery to why Stafford County test scores are so low. The kids can't hear the teachers in the mask. I can verify this by listening in on my daughter's virtual classes. Lastly, I want to bring to your attention some encouraging data. On January 24th, Spotsylvania County Schools started letting parents have the choice, and their child should wear a mask. Since that date, positive COVID cases have continued to trend down. The same goes for Culpeper schools as well. There is no reason why we wouldn't see the same trend in data in Stafford County. This data can be found at usafacts.org and at the Virginia Department of Health website. COVID is now an endemic, and we have to start living normal lives again and seeing the beautiful shining faces of the children in Stafford County. Please allow parents to choose. Thank you for your time.
Good evening, members of the board, Dr. Taylor, and guests. Hi, my name is Layla Paxton. I go to H.H. Poole Middle School. I may not know much, but I sure do know enough to know that my mom and dad know what is best for me as an 11-year-old with a heart condition. Due to wearing a mask, it makes it even harder for me to learn because I'm wearing it if I'm getting enough air from my heart. I also can't understand what my teachers are saying because they are wearing a mask. It is not good for young middle schoolers like me to be isolated at home because I will not wear a mask. It is also not good that we breathe the same air for 6 to 7 hours a day. And I don't know if anyone else feels the same way, but I don't get how we can sit right next to our friends at lunch without a mask, and that is okay, but walking down a mostly empty, if not empty hall, that requires a mask? To me, it makes no sense. I will also say that my mom and dad are not scared to stand up for me and my rights, neither am I. Plus, my teachers are spending more time saying, "Put your mask on," than actually teaching. I want to be able to be a normal child again. I forgot what normalcy feels like. I pray every night that I can go to school and be normal. I hope you'll change your minds on this. Thank you again for your time. Good evening, members of the board, Dr. Taylor, and guests. Hi, I'm JC Oldenkamp. I go to H.H. Poole Middle School, and here are some reasons why I think we should be able to choose to wear masks or not. First off, every morning when I go to my classroom, I sit down and read for about 5 minutes. Later, my face starts to overheat to the point where I have to get a drink of water so I can take my mask off for a couple of seconds. To me, masks don't do anything besides breathing in your own air for 6 hours a day. To some people, it does something. I say as long as you are hydrated and you eat healthy, you'll be fine. But if you feel you need to wear a mask, that's fine. But most people agree with me that masks don't do much. Thank you for your time.
Alan Watkins will follow the next speaker. Margaret Lowry, Carol Leischer, Jessica Marshall, and Clifford Heinzer.
My name is Shannon Fingerholtz. First, can we put time in the board meeting schedule to allow Stafford County students to speak first at meetings? Their voices are vital and their time is actually pretty limited. Second, I'm just as nervous as last time. Thank you to our bus drivers, nurses, cafeteria staff, custodians, librarians, paras, administrative staff, counselors, and more. Along with the teachers, these folks all touch our kids' lives in different ways. They care if our kids have coats, care if they have food, have a warm place to sleep at night, and clean clothes to wear the next day. They clean up after them, tell them it's going to be okay while wiping up their puke, help them fix their backpacks, provide them with a listening ear, and encourage them. They do a lot of the same tasks us parents do, and believe it or not, with a lot of the same emotion as well. While driving them to school, helping a student do research, putting food on a tray, running the car rider line, and keeping track of attendance should be enough. They do more. They hold our children in their hearts and worry about them when they aren't around. Sometimes adults need reminders that there really is a team in Stafford County, loving our kids and wanting them to be successful. These other adults work tirelessly to figure out how to make it all work for the benefits of our kids. No matter what the adults and the families believe or do, they do more for our children than most of us will ever know. As parents, it is time again to recognize them for their value and importance in our children's lives and futures. Speak words of gratitude to them and about them. Support them with kindness. Ask questions instead of accuse, and listen with grace. As a board and a community, continue to increase their pay, but also listen to their other needs and work towards accomplishing those. If kids are, you'd think it'd get easier. If kids or parents aren't following the rules or being jerks on the bus or school property, hold them accountable. Show the staff that you do support them and feel they should be treated respectfully. School staff is a dwindling, precious resource. Let's treat them with the appreciation and dignity they deserve. Today, I want to say a special thank you to Ms. Hill, a counselor from Rocky Run Elementary, for doing the hard work of being an adult my daughter admires and trusts, for taking the time to listen to her very minor concerns and seeing that they are huge in her young eyes, for teaching the school and our family the zones of emotion, for having an amazing laugh, and for being a part of the Rockstar team co-raising our child. Thank you.
Good evening, members of the board. Dr. Taylor, again, my name is Alan Watkins, and I live in the Hartwood section of our county. As a former teacher, I've always been an advocate for our educators, and thus also an advocate for all the students in Stafford. And that's why I'm here this evening. We are still in the midst of a time when the needs of our schools have risen to a level beyond whatever could have been imagined. Looking from the outside in, it disappoints me that instead of seeing our community come together to meet those needs, so much divisiveness has taken place, with groups pitted against one another regarding face masks and so many other concerns. My father, rest his soul, often asked me to determine what were wants and what were needs. To me, that is what this whole issue should boil down to. As for our educators' position, believe me, no one desires to be able to return to regular in-school instruction without the need to be masked more than the educators. The strain and the sacrifices that have occurred in our schools know no bounds. The overwhelming majority of our educators understand that the need to address the physical well-being of both the students and the staff must currently outweigh all other concerns. Additionally, to think that the educators do not additionally keep a close eye on the mental health concerns of all does a great disservice to them. The time they spend with students and the concern that they have is extraordinary. Currently, their familiarity with what occurs in the schools causes them to advocate for the continued use of masks and other mitigation practices. That unfortunately puts them at odds with the want of a number of very vocal dissenters who seemingly consider the teachers and the staff to be in opposition. That shouldn't be. The educators are willing to bear that unfortunate and unwarranted distinction until such time that our schools can safely return to what was or is normal. Our educators are deserving of the full and total support from our community for all that they do, rather than be attacked by individuals in our community whose actions have been wholly unsupportive. In a school setting, no one knows what's best for our students more than those who are engaged with them during the school day hours. Surely, everyone wants our school environment to return to normal as soon as possible. But right now, however, the need for safety still has to be a priority. I ask our community to come together and support our children, our educators. If so, we'll be able to look back and say that ultimately, everyone pushed in the same direction to improve the education of our most valued children. I would ask everyone to be patient just a while longer, rather than risk becoming patients. Thank you for your time.
Good evening, members of the school board and Superintendent Taylor. My name is Margaret Lowry, and I'm a resident of the Rock Hill District. I served as assistant principal for activities at North Stafford High School for 16 years. And I guess I should have been at the first part of the meeting tonight. I didn't realize we were having budget. But I am here again tonight to remind you that we have a parity issue among the 5 high school athletic facilities. Tonight, I'm asking you to finish the job that the school board began in 2013 when the school board members and board of supervisors chose to find funds to install artificial turf at Brook Point and Stafford High School. In November of 2013, the school board agreed to formally ask the Stafford County Board of Supervisors to advance funding and appropriate the funds in their supervisors meeting. School board members supported the first turf fields with the understanding that the Board of Supervisors had plans to bring turf fields to all 5 high schools. In August 2014, there was an article in the Freelance Star that stated, Stafford plans to put artificial turf on its 3 other high school fields, starting with North Stafford in the fiscal year that begins July 1, 2015. Mountain View was the recipient of that turf field in 2015, and I greatly appreciate the school board and board of supervisors for finding funds to put that 3rd turf field in. But it's February 2022, and North Stafford is still waiting. Dr. Taylor's presentation of his proposed budget enlightened all of us regarding the many needs for fiscal year 23. That is why I'm appealing to you, this school board, to find the funds now to install the turf fields at Colonial Forge and North Stafford and put an end to the financial inequity that has existed for the last 8 years. In May of 2014, a school board member supported turf fields, saying, "The fields are an extension of the classroom, and we always want to have best classrooms." The school board saw the need to give our athletes a chance to be competitive in the district, region, and state levels when they began the project of turf fields. Some ask, why should we spend money on turf fields? I'm asking, how long can we keep saying to the students at North and Forge, you're not worth the money? Thank you, and thank you for serving for Stafford County. I appreciate everything that all of you are doing.
Good evening, Madam Chair, members of the school board, and Dr. Taylor. My name is Carol Leisher, and I live in the George Washington District. I am here again to ask the board to find the money to fix the inequity of the stadium turf competition fields in our county high schools. North Stafford and Colonial Forge are being so shortchanged to the point that it is now time to right a wrong. I would like to draw your attention as to why it is so important to find a way to fund 2 turf fields for this summer. Stafford and Brook Point High Schools had their turf installed in the summer of 2014. Let's break down just one aspect of what that looked like in the last 8 years for those 2 schools. A freshman athlete in 2014 who played football, field hockey, girls or boys soccer, and girls or boys lacrosse got to play all 4 of their high school years on a quality turf stadium field. That was the fall of 2014 through the spring season of 2018. And then it continues to repeat. The same 2 schools have a new freshman class come in, and they have 4 years of athletes competing and practicing on their high-quality turf fields during the fall of 2018 through the spring of 2022. Mountain View, whose turf was installed in 2015, will have their 8 years of turf play for all their outdoor athletes that use the stadium turf next spring of 2023. Mountain View was just 1 year behind the start of turf installation. The benefits of having a turf field have been documented. It was the right decision by the past school board to begin the installation of turf for all their athletes, coaches, and high schools. It is very hard to understand, though, how all those rival athletes played and practiced on quality turf field their entire 4 years for the last 8 years, and yet North Stafford and Colonial Forge are being denied the same experience. There is no doubt that not having a turf field has impacted their sports programs. I know firsthand how it has been a hardship for North Stafford's field hockey team when I came back to volunteer this past fall. This school board needs to work with the Board of Supervisors to find money to have parity in the high school stadiums for this summer. We need this turf installation as soon as possible so North and Forge can eventually experience a senior class that has athletes who have played their 4 years on a home turf competition field and be the best competitors that they can be. Please help us get there and support this cause. Thank you very much for your time.
Hello, I'm Jessica Marshall with the Stafford Education Foundation. I'm the treasurer and also a parent. We would like to keep supporting and encouraging our educators, administrators, and support personnel. The Stafford Education Foundation would like to announce the COVID Conquerors Initiative. This initiative will highlight and showcase those individuals who are going above and beyond. We want the community to join in this effort. Starting Wednesday, February 9th, we will be sharing a submission link across our social media platforms and on our website. And this will be a link where you can give helpful, substantive, and legitimate tips on teachers. We will begin posting the submissions on Valentine's Day, and this will be an ongoing initiative to be carried through the rest of the school year. Thank you.
After the next speaker, Jason Kaiser, Kelly Loins, Michelle Wickman, Lesko Brandon, and Elizabeth Chinavon. What? They did? Yes.
Good evening. My name is Cliff Heinzer, and I'm a resident in Aquia Harbor.
Wow.
I want to speak to you tonight about continuing mask use in the Stafford schools. I'd like to thank the board for supporting reasonable measures to protect public health in our schools, even as you faced threats and intimidation from those who opposed your decision. I am dismayed that you will, for a second time within a matter of weeks, revisit a sound policy, meeting under circumstances unfavorable for all to participate who may want to keep our schools safe. I support a parent's right to make choices for their own child, but that does not extend to making choices for others. And in the shared space and air of a classroom, a decision for one is a decision for all. While the transmission of COVID in the classroom may pose a relatively small risk to the majority of students, that is not the case for the adult relatives, faculty, or the community as a whole. It is impossible to reduce the risk to zero, but we should take practical steps necessary to make our schools as safe as possible. I know that many of my fellow citizens feel that their concerns have been ignored by a political system which they believe has not given them a voice. But we should not use this issue as a proxy in a contest driven by partisan motivations. And I urge everyone not to let ideology trump the evolving science available to inform our decisions. We live in an era when the internet makes it easy to find information that confirms our biases, and I would ask you not to take counsel of those who seek to exploit our frustrations by promoting pseudoscience and anti-government conspiracy theories for purely political ends. We should heed the carefully researched advice of qualified medical experts who have dedicated their lives to promoting public health and fighting the spread of disease. Strong communities, sports teams, and military units all rely on self-discipline and teamwork to overcome the challenges they face. In the United States, an attitude of resignation and a failure to make the best use of the tools available has yielded the highest death toll from COVID of any nation in the world. Our strategic competitors view our failure to unite against the pandemic as evidence of our decline and increasing weakness. The longer we keep COVID numbers high, the more likely we'll have to deal with additional variant waves. The residents of Stafford do not all weigh the balance between individual rights and the common good the same way. However, that should not prevent us from building a consensus on a path forward that recognizes the legitimate interests and concerns of all our citizens. I wish you success in finding the wisdom to resolve this dilemma in a way that will help to unify our county and make everyone comfortable with the safety of our schools. Thank you.
Stafford County School Board, Dr. Taylor. My name is Jason Kaiser. I live in the Aquia District. Ms. Guy, it's nice to see that you made it here this evening. 2 weeks ago, I recommended that you come up with a plan to stop enslaving our children under the lock and key of mask mandates. As you know, the Virginia Supreme Court has upheld Governor Youngkin's EO2, reiterating that school boards have broad discretion in giving parents the choice to determine what is best for their child to attend public schools. I'm here again requesting that you take a vote and ensure that parents' choice is at the top of your priority. My children are not politics. On another note, Dr. Taylor, I've spoken to many students and teachers, many of whom feel that they cannot speak freely because of institutionalized marginalization and bullying tactics used to keep them silenced in schools. It's no secret that the radical left has taken over our schools and support bullying tactics amongst the teachers and amongst the students. Now, you may send out questionnaires and talk to the teachers, and they may submit stuff to you, but I'll tell you this, they don't trust the fact that when they're submitting things, that they're not going to be targeted by administrative staff. I recommend that you establish a venue for teachers so that they can report other teachers for bullying. I also recommend that you establish a system so where students can recommend to you also other students and teachers that have divisive tactics that they're utilizing inside their classrooms. Neither students nor teachers should have to fear bullying in their place of work or education. It's time that we make learning a priority and remove radical indoctrination from our schools. The first way to do this is to identify the radical teachers and the administrators and remove them. You know, you talk about quality of teachers, that's one way that you're going to get there. Next thing I want to talk about is the budget. I think it's a great opportunity that you expressed the budget, and I like the fact that you identified that each child that comes to Stafford County Public Schools costs a little over $10,000. Well, I want parents to know here, up there, that it costs less to send your child to a private school, get a better education. They don't have to wear a mask, and they're not going to be indoctrinated by the crazy radical left. So look into it. Contact your politicians. Talk to them. Get your word out there that you want to support school choice and stop the craziness. Last thing I wanted to say tonight is that I know that you all run as independents, but I also know that you also have been endorsed by either Democrats or Republicans. That's fine. Here's my rub. Republican Party creed says that the government must preserve individual liberty. As a Republican, I think you should stand for freedom and individual liberty. And unfortunately, you two, I think, you failed to do that. And I think that the Stafford GOP or any other organizations that have, endorsed you along the way, you should be censored for your actions.
Hi, my name is Elizabeth Chinyavon. At the first school board meeting this year, I spoke about how much trust Americans have lost over the past 2 years. We've watched our so-called experts and government officials lie, implement unlawful mandates, and bulldoze our constitutional rights under the guise of fighting a pandemic. This week, Potomac Local News published an article highlighting yet another instance of a public official breaking that trust. Therefore, tonight I am calling for the resignation of Dr. Warner for politicizing her position in an attempt to influence the outcome of an election.
Point of order. Point of order.
Point of order.
Do I keep talking?
Well, not about a member at this point.
Okay.
Do you have anything else you want to address the board on?
No. I think everybody should go read that article.
Good evening. My name is Kelly Loynes, and I'm from the Rock Hill District. I'm asking you to vote to implement Dr. Taylor's mask optional policy and support parent choice with an immediate start date. The recent legal decision and lawsuit dismissal have made it clear that you are able to do so. You can no longer hide behind Senate Bill 1303 as a mask mandate, because it is not. The masks are not practicable. They are not protecting anyone or preventing transmission. They are harming our kids. Other states and even countries are lifting mandates to include forced masking of children. Other counties in our state have implemented mask optional policies successfully. The least you can do in the light of the outcomes of the recent legal proceedings is to support the mask optional policy and parent choice. As I wrote in an email to you all last week, it is time for you to take responsibility for the role your decisions have played in the declining performance across this school district. Virtual learning was a mistake. Quarantining kids, especially healthy ones, is a mistake. Forced masking is a mistake. Each of these decisions has had a negative impact on our children and their education. The data Dr. Taylor presented makes that abundantly clear. These same decisions have undoubtedly played a role in the increase in speech and developmental delays, as well as behavioral issues seen throughout the district. The implementation of these questionable policies rests solely on your shoulders. You cannot undo the time spent virtual, but you can undo the other decisions. Vote to reduce or eliminate quarantining of healthy children. Vote to support parent choice and the mask optional policy. Start taking responsibility for the damage that has been done and vote to end it. Thank you.
Ms. Wickham, before you make your comments, I want to announce the next 5 speakers after Ms. Wickham. Nancy Higgins, Dr. Sukina Stevens, Sarah Taylor, Laura Baker, and Jody Fagan.
Hi again. Michelle Wickman, Hampton Oaks, 2 kids, North Stafford. Last time I spoke about the need to consult experts when doing research. When the governor issued Executive Order Number 2, I was pleased to see you consult legal counsel prior to making a decision, and even happier to see a 5-2 majority vote in favor of the universal mandate. When the issue was forced to a second vote less than a week later, I was proud to see you uphold your original conviction under pressure. Tonight, I'm asking that you continue to hold firm. Dr. Taylor said that you would reconvene on this issue should the Virginia Supreme Court uphold the governor's executive order. The Virginia Supreme Court has not upheld the governor's order. They essentially dismissed the case on technicalities because the parents involved were requesting action that the court was unable to effect. A footnote to the dismissal clearly states we offer no opinion on the legality of EO2. Fortunately, the Arlington Circuit Court did issue such an opinion, stating the governor's order could not override the powers given to school boards under SB 1303. The court cited the importance of consistency, stating upending a policy that has been in place since the beginning of the school year would create irreparable harm in these school communities. The decision further acknowledges that children and staff would have to reassess certain health conditions, having relied upon a universal mask mandate implemented by the school boards. Previously, I spoke about authority, and tonight I want to touch on accuracy, because too often we search only long enough, or perhaps spend too long searching for the answer we want. I teach my students that to trust accuracy of information, they need to be able to verify it in more than one authoritative source. Not being an expert in viral diseases myself, I appreciate the guidance of the CDC, the Virginia Department of Health, and the American Academy of Pediatrics, to name a few, all of which currently recommend universal masking indoors for ages 2 and up. Parents of children with true health issues or disabilities preventing them from masking already have an exemption process via the existing policy. They don't need the opt-out. By allowing parent choice, the rest of us won't have the ability to opt in to a safer environment. What about the parents of children who are at high risk of COVID-19 and have been relying on this universal mandate to keep their kids safe? What about staff with the same issue? It's these populations who will be hurt by changing the policy mid-year, and you will lose educators despite the proposed new pay scale. I'll remind you that an SEA survey completed by nearly 1,800 educators showed overwhelming support for keeping the mandate as it is. At a bare minimum, if you feel you must make this decision based on public opinion rather than expert legal and scientific recommendations, please conduct an official survey of SCPS staff and families prior to determining what change should be made. Thank you.
Nancy Higgins.
Good evening, board members and Dr. Taylor. My name is Nancy Higgins, and I'm an employee. I have been an employee of Stafford County Schools since July of 2018. I became a contracted bus attendant in 2019. Since that time, I have had less than $1.50 an hour, per hour increase in pay. Now there's been a proposed increase of 5%. If my math is correct, that is less than $30 a week for me before insurance comes out. My question is, what happened to our attendant increase in November when the drivers received a substantial increase in order to retain them and raise them to the surrounding counties' rates? It was supposed to follow behind. We as attendants are responsible for getting the students on and off the bus, making sure they're safe while being transported, and if they're in a wheelchair, we're the ones that stand outside in the rain and the cold to get them on and off the bus. Keep the keep the bus swept and clean and sanitized. Take care of student count paperwork on a weekly and monthly basis, and more. I feel that we deserve to have the same percentage of an increase as the drivers were given to make sure that they stayed. We are a team, and they can't roll without us. Thank you.
Good evening, Madam Chair, school board members, and Dr. Taylor. My name is Dr. Sakina Stevens. I am a parent, but I'm also the proud chairwoman of the CTE Advisory Committee. I'm here tonight in support of CTE. Thank you for your proclamation. And just to remind everyone, it's CTE month. But what exactly is CTE? CTE is programs designed to prepare our students to develop marketable skills that must meet Virginia's needs for a workforce that is targeted, trained, and certified. Some of the programs that we offer here in Stafford is carpentry, cosmetology, Teachers for Tomorrow, and the culinary arts, my favorite. But we need your help to do more. One of the things that I would like to see done this year is to increase our work-based learning. This way, our students can meet the college, career, and civic readiness index ratings for high school accreditation. The second thing we would like to do is add programs that's going to be aligned to the proposed new high school. And third, when we talk about budget, is the funding for CTE teachers and our career technical student organizations. Those are your DECA and your Skills USA. These teachers that they dedicate their expertise in the classroom, but also outside the classroom. They take our students to competitions all on their time, and we would like to see increased funding for these services. Thank you for your time this night, and have a good evening.
Sarah Taylor, Laura Baker, and Jody Fagan. And after those speakers, we're going to take a break before we finish up.
Good evening. I'm Sarah Taylor from the Falmouth District. At the last school board meeting on January 25th, a board member asked what happened to the teachers who would throw themselves in front of bullets for the kids. This calculated mockery referred to the results of a survey of SCPS staff in which 78% of the respondents indicated that they want to keep the mask rule in place. Here's one teacher's reply to that question. What happened to those teachers? We're in our classrooms with our students, where we accept the highly improbable but possible risk of getting shot to save our kids. I don't know of a teacher who is crouched next to a locked and blocked classroom door, whether during a drill or a real lockdown, who hasn't asked themselves the question, not just of whether they'd jump in front of a bullet to save a kid, of course we would, that's a ridiculous question, but of whether they'd make the agonizing choice to take a life, possibly even a student's life, to stop a shooter from hurting their kids. I made that decision years ago that I could, but chances are I will never be faced with that choice. The statistics on active shooters in schools are very low, thanks to strategies such as locked outside doors, gun-free school campuses, and more. These security measures mitigate but do not eliminate our risk, which is why you still have teachers in the classrooms. However, if we lost some of those security measures in the name of personal choice and freedom, and if licensed students and visiting parents were permitted to open carry loaded weapons in school buildings, then teachers would quit en masse. Those of us who asked for this mask rule to remain in place aren't looking at masks as a way to eliminate our risk. We know that they don't. Our masks are far from being hospital grade, and the students and staff aren't disciplined enough to always wear them correctly. Just like sometimes outside doors get propped, sometimes outsiders bypass security and get into the building, and sometimes weapons do get into campus. But mitigation of risk, not elimination, is the point. The teachers who came back after lockdown accepted the risks of COVID. Some of us did this as soon as we were permitted back into the buildings to help celebrate 2020 graduations. Many of us volunteered or were conscripted to teach in person in the fall of 2020, before vaccinations, before upgraded ventilation, before our cameras and new laptops, and before the end of the first surge in Virginia. We made do with what we had, protected ourselves as best we could, and did our jobs. When hybrid teaching went countywide, teachers adjusted. When the schedule changed again and again and again, teachers adjusted. When the bus driver shortage and mandatory quarantine periods basically forced us to keep our instruction concurrent for this year, we adjusted. When COVID and burnout depleted our ranks and we had to cover our coworkers' classes because we didn't have subs, we adjusted. And while we adjust, we do our best to keep the frustration and exhaustion from our students like adults should for the children in their care, taking the metaphorical bullets for our students however we can. Teachers deserve more than your disdain for the insinuation that no matter how the mask situation works out.
Thank you.
Hello, my name is Dr. Laura Baker. I live in Falmouth District. I'm a parent of one student in SCPS and one that will be attending next year, and I'm a former teacher of the district. I come today to address the comment made at the last meeting asking where are the teachers that would take a bullet for their students. As school board members, I know you are aware of the teacher shortage that is already plaguing our district. There are teacher openings at every level, many that have been there since the start of the school year, that are being filled by subs. When subs are not available, teachers are giving up their planning time to fill the void. I had hoped that you were also aware that those who are still here have gone through a horrible couple of years, and many are at their breaking point. Not because they do not love teaching, but because too much is asked for them and not enough support has been given. However, the comments that made during the last meeting made it clear that some of you have no clue what teachers have and continue to go through. So tonight I am sharing part of a letter I wrote while still working for SCPS after one of the mass school shootings in our country. Had I died in a similar school shooting, my husband was going to read this letter to the media. Though shootings and COVID are not the same, I think you will see why this letter is appropriate tonight. I did not want to die. I did not want to become a teacher so that I could lay my own life down for your children. I have two beautiful children of my own who I wanted to watch grow and thrive, but that has been taken away from me and them. It has become assumed that I, as a teacher, was responsible for taking a bullet for other people's children, and once I did, I would be hailed a hero. However, before that time, I would be viewed as a person who couldn't succeed in other careers, so I became a teacher. Until then, I would be the dumping ground for parents who could not control their children and expected me to cater to their every whim. Until then, I was expected to give up part of my low salary so that students had supplies and fun activities. Until then, I would be treated like I was not a professional and monitored constantly. If you cared for me or my students, you would have given me the respect and supplies needed to do my job effectively. I didn't want to die for them. I wanted to teach them about math in our country. I wanted to pass the love I have for learning and my subjects on to them so they would go into the world and do something with it. I wanted to see the light in their eyes when they finally got something they struggled with. I wanted to make our society a better place by putting more educated people into it, and instead, I am now dead while you praise me for the actions that led to my death and not for what I did on a daily basis. That letter is not just the feelings of one person, but of many who are tired of the lack of respect given to them in their profession. If members of this school board continue to communicate and show a low regard for the teachers of this county, I can guarantee that you will be the ones in the classrooms because there will be no one left who wants to teach here. And if that day comes, I hope that everyone questions your every action as a teacher, including your willingness to lay down your own life. Thank you.
Last one. Okay, good. Good evening, school board members and Dr. Taylor. My name is Jody Fagan, and I am in the George Washington District. I, again, like so many others that come before you, to ask you to allow us to make the decision of whether to wear a mask or not for our own children. We reluctantly abided by Governor Northam's mask mandate for the last 6 months. He is no longer our governor. The people of this state spoke. We voted our new governor, Governor Youngkin. We now ask you to abide by, reluctantly or not, his executive order and allow us, the parents, to decide what is right for our children. As our public servants, we are here to tell you what we want. We want a choice. Whether it is to have our children wear a mask or not, we just want everyone to make their own educated or uneducated choice. As for me, I have done my research. I have found more data on the harm these masks, social distancing, and fear are causing our children emotionally, physically, and mentally than I have found on the efficacy of these restrictions and mandates. I understand there are people who are concerned about their own children's health or personal health. Maybe they're immunocompromised. I am sympathetic, but they have always lived among us through flu season after flu season. Masks have never been required. They have every right to wear a mask. I'm not asking them not to, but out of the same respect, they should not ask me or my children to wear one.
My daughter is 11. She has never had an ear infection until this last December. She had a skin reaction to wearing her masks around her ears that we had been treating for several weeks. It backed up into her ear, causing her an ear infection. I got a doctor's note so that she would not have to wear one on a daily basis, and she and I had a long conversation about it, and she told me she will continue to wear the mask because she doesn't want to be the only one not wearing it. She doesn't want to be different. And as a parent, that's pretty heartbreaking to know that my child doesn't want to stand out and be her. We are stifling our children and stunting the growth of what they could be. I am more afraid of the toxic cleaners, the hand sanitizers, the Teflon-lined face masks you are all wearing, the divisiveness, the loneliness, the separation, the discrimination, the hatred that all of this is causing, than I am of the virus itself. I ask you implement Dr. Taylor's mask optional policy tonight. The time has come for you to let us unmask our children. And also, please let the high school have turf, and for the love of God, fix Colonial Forge's refrigerator so they're not drinking frozen milk. Thank you.
We have several additional speakers signed up, but before we hear from them, we're going to take a 10-minute break. She's coming back. We're going to restart this meeting. If you could please quiet. The next 5 speakers are Thomas Holliday, Alyssa Saab, James E. Frost, Dexter Carr, and James Minor. Is Mr. Holliday here?
Well, thank you for your time. My name is Thomas Holliday, and I am a resident of the United States of America, right? I'm a resident of the Commonwealth of Virginia and a resident of Stafford County. I think Falmouth District. I think I wrote on the sheet Aquia, but I think Falmouth, so Dr. Chase. So hello, board. Once again, here we are, okay? Dr. Taylor, good to see you. All right. He's always glaring at me. Why is he glaring at me? I'm a nice guy. I'm sure you're a nice guy too. All right, so as you had mentioned last time, that some levity helped. So I'm going to help you all, whether you're Republican, Democrat, liberal, conservative. The 18th Amendment has been repealed. Look, on Fox it says CNN medical analyst supports Democrat-led states dropping school mask mandates. The science has changed. The 18th Amendment has been repealed, okay, prohibition, right? So that's sort of a funny. Oh, look, we have Stacey Abrams, too, without a mask and a bunch of masked kids. Wow, that sends kind of an interesting message, doesn't it? And she said it was because of Black History Month, but I don't think it was. I support all races, all creeds, all colors. I support everybody, whether you want to wear a mask or not. Go ahead and do it. Just don't force my kids to do it. Don't force me to do it. We still live in a free society, whether you believe it or not. And actually, as part of my little notes I brought this time, under the Constitution of Virginia, the Constitution of Virginia defines and limits the powers of state government and the basic rights of the citizens of the Commonwealth of Virginia. Like all other state constitutions, it is supreme over Virginia's laws and acts of government, though it may be superseded by the United States Constitution and U.S. federal law. Interesting. So that means that the U.S. Constitution, the Constitution of Virginia, ranks supreme. Man, that's pretty cool, isn't it? I mean, that applies to all of us. And so what that means is that all the pettiness and the bickering and the bullcrap, right, all that can go by the wayside because it's already been decided. The Founding Fathers already talked about this. Life, liberty, pursuit of happiness. I want happiness. I want happiness for all the kids. I want to be free. And you want our kids to be free too, right? You want to see their smiling faces in classes and at board meetings, okay? I had a lot of nasty stuff in here, but I'm feeling the Spirit of God because, like I said last time, the spirit of mask mandates is from the devil. It's fear. Do not let fear win. God wins. We know that in the end anyway. So be on the right side of this before it's too late. God bless you all. Thank you.
Good evening, members of the board and Dr. Taylor. I'm Walisa Sab. I teach at North Stafford High School. I had to come today to address the board members' comments from the last meeting. Towards the end of that meeting, this board member said something shocking. Well, ask the question, where are the teachers who would take a bullet for our kids? I'm appalled that a board member would confidently say something so asinine. I'm disgusted that no other board member responded to it. I'm concerned that Dr. Taylor didn't admonish her. I'm heartbroken that some of the audience of parents and students actually clapped for it. This board member later showed her true colors on her Facebook page claiming, and I quote, "Sometimes you have to say something crazy to see how people react to it," unquote. To make light of school shootings and imply that teachers become martyrs.
Point of order, please. Excuse me, that comments are not appropriate for the discussion. Do you have anything else you'd like to address the board on?
Let me check.
Missy, could you stop the clock while she's checking, please?
Well, can I talk about advocating for parents? Okay.
Absolutely.
Well, in relation to the board member. How do you understand what I'm saying?
To talk to all of us and make sure.
Oh.
You're addressing the board and not a particular board member.
Okay.
Or about a particular board member.
how we engage with the public.
Okay. Well, I guess what I'll say at the end, I guess, is as members of the board, from a teacher's standpoint, it's our hope that you are advocating not just for parents, not just for parents. And I'm feeling that that is what is happening, that might happen at some point. I would hope that that you would realize that you're not just here for the parents, it's teachers too that are in these classrooms with the students, doing all we can. I see 88 to 90
Excuse me.
students.
Please, no comments from the audience. That's not appropriate. If we have more comments, you're going to be asked to leave.
I see 88 to 90 students a day. Never had an issue with a student not wearing a mask. I also see on a constant basis COVID letters coming in. I have students out right now in my class. I was out quarantined a couple of weeks ago. This is a real deal, that I hope that you continue to keep the mask mandates and not allow board members to go rogue and say things that are inappropriate, especially on behalf of teachers. Thank you.
Yeah, we have 3 more people who've signed in. So is Mr. James E. Frost here? No? Then we'll go to Dexter Carr. James Minor?
Good evening. My name is James Minor. I am a citizen of Stafford County, and I have been for over 20-some years. I currently serve as the first vice president of the Stafford branch of the National Association for the Advancement of Colored People, the NAACP. Tonight, I want you to know that many people in the various organizations and associations to which our members belong applaud the position that the majority of the board took twice. Applaud your leadership and that of the superintendent as well. It is unfortunate that this issue has become one of politics versus public health and education. Although faced with threats, negative phone calls, a most disturbing lack of civility displayed by some people of opposing viewpoints, most of you have stood firm on the side of law and order and the demonstrated belief in the science by keeping the mask mandate in place, and prioritizing the health and welfare of Stafford County students, staff, and others who use the school facility. We applaud you. We want you to know that we will be with you every time you have a vote on this issue, even Thursday. And we hope that your sound public health policies and the welfare of Stafford students will be foremost in your actions. Thank you.
Is there anyone else who would like to address the board? If so, please line up on the side. And there is a sign-in sheet after you finish speaking. Okay. Somebody come on down.
I want to go home, so I'm going to come.
Dana Brown, Rock Hill District. I just wanted to let you know, I've been here since, I don't know, going on 5 o'clock when you started your meeting, and there was some late breaking news tonight I'm not sure everybody knows about. Virginia made the national news tonight across the United States. The Virginia Senate did pass an amendment to Senate Bill 1303 on a 29-9 vote. It's expected to pass in the House. Governor Youngkin has already said he's going to sign it, and that is to give the parents the option to opt out of VAS. So they are changing the bill. So that's all. And I think it's kind of they're fixing their own bill. That's what it sounds like. So I want to go home and I'll watch the rest on TV. Thanks.
On after. Good evening, members of the board. Dr. Taylor. I recently heard a patient state that she is at risk for being tarred as a psychotic.
Excuse me, could you give us your name?
I'm sorry, thank you. My name is Jeff Rosa, Hartwood District.
Thank you.
Apologize for that, thank you. Like I said, I recently heard a parent state that she was at risk for being tarred as a psychotic anti-vax right-winger if she dared question whether children should be forced to wear a mask all day and in daycare and through K through 12 schools. That attitude is based on the premise that rejecting mask requirements is tantamount to rejecting science. The truth is closer to the opposite. Supporters of school mask mandates assume that they're effective at reducing COVID-19 transmission, then desperately search for evidence to validate that conviction. That process bears little resemblance to science. Mask proponents point to the many studies associating mask mandates with lower COVID-19 rates in schools, but those studies are mostly imaginary. The CDC began recommending universal masking mandates in schools a year ago. At that point, there was no solid empirical basis for the CDC's advice, and that is still true today. Most of the studies the CDC cited do not even compare schools with mask mandates with schools without them. While studies may show that schools with mask mandates can operate safely, they do not show that mask mandates are necessarily able to achieve that goal. There's data points from Florida, Tennessee, North Carolina, North Dakota, Texas, United Kingdom, and Spain that suggest they are just not effective. Uncertainty about the real-world impacts of masking is compounded when mandates apply to children as young as 2. It's a stance that is extreme by international standards. A group of 10, and by the way, and to caveat on what previous lady just said, a group of 10 state Senate Democrats voted with Republicans for an amendment that would allow parents to opt out their children out of masking in schools and a rule that does align with Governor Youngkin's order. Thank you very much.
Hello, I'm Isabel Schweider, and I am a 10th grader at Brook Point High School and an ex-Senate page for 2020. I am also an IB and an AP student. This mask mandate, it should very well be optional. I am a theater kid. This is very against what other theater kids think. However, it should be optional. Sometimes I feel the need to wear my mask. Sometimes I feel the need not to. It should be an option. There is really everyone is saying now that, oh, well, masks still protect. Well, only certain masks protect now. So why are we still having this mandate of unrealistic masks that don't even end up protecting us? And about what other people say, which is, oh, well, this is about the teachers. Teachers get paid. Students don't. Students go home with homework and are tired and are done with masks. They are tired and exhausted, and the masks make it even harder for us to socialize. I am an extrovert. I notice faces. I'm a visual learner. When I am unable to see faces, when I'm unable to process those types of things, it has made my life a lot harder, and it has for other students as well. It just simply isn't fair to be all in this political stance because, like I said, I'm an ex-Senate page. I know when things are political, and this is very much a political talk. It should not be. It should be about the students and about the parents, and what the parents think are best for the students. Some of the people who are up here talking about it don't even have kids. This should be about what the kids desire. What is going to help the kids. We are the future. You should be worrying about us and about how this will benefit us in the future. Thank you.
Are you signing her in? Okay, thank you.
Good evening. I'm Michael Park, and I live in Hampton Oaks, and I'm not here to talk about masks. You're welcome. I've resided in the Garrisonville district since 2003. My 5th, 6th, and 7th children attend high school, middle school, and elementary school here, as did their older siblings. I'll be putting kids through school for another decade or so-ish. I'm here to talk about duties, obligations, and responsibilities. We have ours, and you have yours. Every one of you swore an oath that means you should be laser focused on preparing our students for success in further education, work, and citizenship at all times, and nothing else. That oath means politicians, political candidates, and party officials have no business injecting their biases and corruption into the education of our children. Outsiders have no business being here. When you allow them in here to influence the county, your silence lends approval to corruption. When challenged, these people will respond, it's their right to be here. But you, as the stewards of a system that teaches our children about citizenship, know that any discussion of rights that doesn't also address responsibilities is not so much a discussion as it is a tantrum. Any policy enacted here that brings harm to any member of the community is unethical. And by harm, I mean real documented harm, not the kind of hyperbole that's become popular in some corners of this county. As you move forward, it won't be long. It won't be enough for you to comply with the lowest common denominator of legality. While remaining obedient to law at all times, you need to adapt to courses of action that reflect reason, ethics, that support the entire community, not merely the most vocal minority of the community. It'll be a difficult needle to thread, but that's your job. This is going on in your community right now. Please thread that needle. Thank you.
Catherine Schneider, George Washington District, and I have a bunch of random topics. One, I had sent an email, and while Dr. Taylor and Mr.
You got the timer? Okay. She had you on yellow already.
Oh, yeah. Dr. Taylor and Mr. Hicks actually both replied to my email. Neither one of them actually answered my email. What is the policy for sick kids that don't have COVID to do the concurrent learning? My child got stuck on quarantine, and our kids, now everybody knows my kid's not vaccinated. everybody in his class, all his teachers. The way the policy is written, the kids are going to know who's vaccinated, who's not vaccinated, who wants to wear a mask, who doesn't want to wear a mask. So I don't like that. But is it up to the teacher? Is it up to the principal? Is it up to the school board, which I really think it's your all's responsibility as a school board to make this policy? Like, other kids can do it because they want a mask break, because they're sick with anything, or it's only COVID. Nobody seems to understand what the policy is, or nobody can articulate the policy. It may be a better way to say that. I mean, and about just letting people know, nobody knows which kids have the HPV vaccine. A lot of the kids in our schools do not have that, but nobody needs to know that, and nobody does know that. But for this vaccine, for some reason, some of you think it is everybody's right to know. The second thing I wanted to say was something, the transportation, they were talking about sidewalks. Across from Stafford High School, they're building, I don't know, Wawa sheets, I don't know what's going in there. Something's going in there. We all know that those high school kids are going to be wanting to go there. And you need to have some safe way for those kids to get from there over to the high school. I know it's a walk. I don't know if it's kind of funneling them through the stadium area, but you need to think about this. You need to get on VDOT, because VDOT's theory of life is, well, if we just don't make it easy, they won't do it, because I don't know what's wrong with them. But and then something that you're going to be talking about is the bus tiers. I noticed that you had a couple elementary schools at the middle level, but then you needed the most buses in the middle level. So it makes no sense, and maybe it'll make sense when you do the presentation, to have extra schools in the middle level if that makes you have more buses. And then I will be the one odd man out and say I'm not for the turf fields. I have issues with turf fields anyhow, but look at the way they were funded. Not a single person has stood up here and said, put the turf field, and this is what you should cut to pay for the turf field. I think they need to find creative ways to pay for their turf fields like the other ones. And there seems to be a lot of odd things, like I never knew Mountain View was supposed to get it or was not supposed to get it before North, and how did they get it? And how come when I moved here, Ferry Farm was supposed to be done before Grafton, and that didn't happen? So there's a lot of, for lack of a better term, shady stuff that's going on that you just don't really know about. So I would encourage the newer people to look at the history of the turfs before you just say, oh yeah, it's an equity thing. Thanks.
Good evening, board. My name is Carla Alsop. I am in the Hartwood District. I have a second grader who is 8. You heard her speak recently to you, who attends Margaret Brent Elementary. She's been out of school for 2 weeks and 1 day. I would like to note because of masks, because masks were not something that she should have been in at this point in time. So 2 weeks and 1 day. I want to note that my student, because we're talking about a lot of students being out, my student was out. Thank goodness Mr. Fitzgerald is such a wonderful man, such a wonderful principal. He worked with us. This was not easy for him. It was not easy for us. Doing this to our students is so important. I had to go pay for online classes so my daughter wouldn't fall behind. I'm going to ask you tonight if you're going to be a leader or a follower. You can still decide to be leaders tonight. Masks should be parent choice. Your superintendent made it so easy. Maybe he should get the pay raise in the budget. Adopt his plan. As I said on Fox News, on WUSA 9, and on Good Morning America and other news outlets, these are about parents' rights and parents' choices. We get to decide what is best for our kids, the parents. And even if you decide the mask is best for your child, I support you fully. That is your right as given per the US Constitution, and turns out the Virginia Constitution as well. And to all the teachers and all the board members who have stood up here and said that we're not caring about them, I want to know if you guys care about this teacher that reached out. I loathe the principal. The fear-mongering has been happening for the past 2 years. He has made teachers fearful of kids in masks. I'm against these masks 100%. I know there are others as well, but there are not many because they are scared to speak up. My department head is so scared, he literally wears 2 masks and a face shield for fear of catching the virus. He chases kids down in a hallway now, yelling at them to pull them up over their noses. It has got to stop. These kids are being treated like inmates there, and that is wrong. I do not agree with anything that he is doing to discipline these kids. I have worked in this county for 12 years, and I've seen the changes that it has gone through. But I don't trust the school board. And all I can say is that I hope the right decision is made sooner or later. You can share my thoughts, but please do so anonymously. It sucks to be a teacher right now. I used to love my students. It's the admin, the other teachers, and the SEA that I don't want to be a part of anymore. Thank you.
Good evening, school board members, Dr. Taylor. So, Dr. Taylor, I haven't had a chance to review the budget. I'd like to make it to one of your budget sessions. May not make it, but from hearing from the teachers, the pay increase, obviously it's a great thing. Keep being a leader. You're doing great things so far. Next, moving on. Oh, I'm sorry, I did not introduce myself, did I? I'm Mark Bowie. I'm proudly from the Hartwood District. So as you know, the state legislators moving forward, they're likely going to take away your discretion. I don't think you want to be behind that power curve when they go ahead and do that. So I know there's a special meeting called for this Thursday. I'm not sure exactly how that's going to pan out, but hopefully you'll have a plan in place if that does occur at the legislative level. So science doesn't support. And that's clear, I think, from all the liberal states that have recently set the end dates. I know some folks have talked about it. They've set end dates to their mandates. They realize the narrative is expired, much like their political career. They keep up the shenanigans. They have realized it's time to move on, so hopefully you do as well. Underestimating the power of parents standing up for their children has shown to have steep consequences, as we saw this past November. As we talk about consequences, that also includes the mockery that comes when you're caught with your mask down while being surrounded by masked students. I'm sure that was talked about this evening too. So the hypocrisy runs deep. Kind of like my man here in some goggles and a double mask. He takes them off when he gets up here to speak. I don't know if he's wearing two masks and goggles, if that's his version of a protest. If so, it's a weird flex. But he paints the picture of the hypocrisy that we're talking about. Like all the recent folks that I just said keep getting caught with their masks down. If that's his version of a protest, he needs to go all the way. He needs to get up here to the podium, speak his piece. Don't take it off when you come up here if that's your protest there. And then the few teachers that have been referencing a board member's comments, but they also didn't have the courage to wear their shirts that they made and we're so proud of. I'm sure most of y'all know about those. Lastly, turf. We're going to talk about some turf real quick. All I got to say is I understand that's not going to come out of the school board's budget, but there's got to be solutions. Pull some of that budget from the school board, work with the board of supervisors, find the solutions to give these kids turf. They deserve it. I don't care about the whole equity or equitable, whatever those words are. They need turf. That's the new age. Please find a way to get that to them, all right? Thanks.
Good evening, members of the school board and Dr. Taylor. My name is Ezra Jackson, and I'm a junior at Colonial Forge High School. I'd first like to thank Dr. Taylor, Ms. Sigmund, and Ms. Halstead for the emails they've exchanged with me. 2 years. That's how long we've had to deal with this. First, it was 2 weeks. Then it was 2 months. And now we're coming up on 2 years. 2 years of our lives were taken from us. 2 years in which we have not gone a day without talking about COVID. Since the beginning of the pandemic, the CDC has been collecting data. For children under the age of 18, a total of 910 children have died. Each one of those is a tragedy. But we must also look at the statistics. There are 73 million children living in the United States. That's 0.00001%, 4 zeros. 1 in a million children have died of COVID. That's not some number I'm throwing out there. That's statistics straight from CDC. You've done this under the guise of kids will suffer. Let me tell you, the kids are suffering. We are suffering every day when we attend school and are told that we cannot see each other, that we cannot be too close to each other, told that we will be responsible for hurting someone if we take our masks off. Let me tell you now, you are the ones hurting us. We cannot focus. We cannot smile at our friends. We cannot understand each other when we talk. Our teachers are now focusing on whether or not we're wearing a mask rather than our education. Instead of our mental health, they're focusing on whether or not we're wearing a mask. 2 weeks ago, it was about upholding the law. Do not be fooled. SB 1303 and EO2 do not conflict. Rather, EO2 allows for an exception under SB 1303. While I'm talking about SB 1303, the people who wrote it did not intend for it to apply to masks. It does not even vaguely reference masks. It's pulled from 7 words referencing the CDC, which is not an authoritative force. There was reason the VA Supreme Court threw out the case, that being that the argument wasn't even worth their time. 2 weeks ago, on January 26th, I was asked to leave school, not because of something I did, but rather because of something I did not do. I was not violent, I did not harm any person or property, I showed no disrespect towards anyone. I was made to leave because I did not wear a mask. I've always been told that actions speak louder than words. I've been told it's important to stand up to those who bully you. I've realized that that does not mean only when I'm a child. It means any time my rights are infringed upon. I was sent home from school because I did not comply. Others would join me if it wasn't because they feared for their future. To everyone listening to this, please join me. It's not something that's going to come after you. It's worth it. Members of the board, on Thursday you will vote. I will be here. I hope that you stop voting on how you feel and vote with the law. Thank you.
Good evening, Madam Chair, school board members, and Dr. Taylor. It appears that Thursday is going to be very interesting for all of us. My name is Casey Durst, Ferry Farms Elementary School. My son goes there, and I'm here to discuss my previous comments at the January 25th board meeting. But before I start, last time we had a little tradition, so we're going to kind of keep that going. What is the difference between the people of Yemen and the people of Abu Dhabi? Yeah. The people of Yemen do not like the Flintstones, but the people of Abu Dhabi do. So the last meeting had a lot of comments. I made a specific one that I'd like to address. While I stand by my position and disappointment with the current mass situation, I accuse this board of being narcissist. That word retains significant meaning for many people and should not have been said. While we should be able to openly disagree on a multitude of things, what cannot happen is personal attacks for no reason, just to temporarily appease personal frustrations. When I said it, it completely overshadowed my happiness of expressing my frustration and asking my pointed questions to you, and that's not a way I desire to represent my kid. Some of you have historically and recently responded to my emails in a professional, articulate way, and you sure aren't paid $100,000 to sit on the board, so reading and responses you give are done in your own time, meaning it's time away from you and from your family and friends. And while you signed up for it, you're not full-time legislators, and we have to understand that you signed up to make Stafford County schools better. My any portion of comments exclaim the burning of bridges and trust, and this falls on me too. It's not just your responsibility to build and maintain those bridges, and jaded comments hurt our relationship. To you, to Dr. Taylor, and to your family and friends, I apologize. Now, when I apologize to my wife, she tells me it's okay, and she loves me because of my rock-hard abs that are hidden somewhere underneath my ever-expanding midsection and my balding head. So y'all don't have to do that. Dr. Taylor, if you wanted to, I'm good with that. I wish there was a way for all of us to get to know y'all on a personal level. Maybe a beer with the board or shots with the superintendent would be a thing to be on the agenda on Thursday. I'm sure we get a lot of comments on that. I don't know. I get to proclaim cool ideas and then go home and watch reruns of the Golden Girls while y'all are left holding the bag. Dr. Taylor, with your presentation, I appreciate that very much. And after the last meeting, the budget meeting at Ferry Farms, I cannot tell you how refreshing it is to have new ideas and positive influences for our schools. It takes a lot of time and effort to gather and present that information. We can talk requirements docs, execution year deficiencies, budgetary regulation, POM cycles, logistical restraints, whenever you need someone to vent to. It's incredible to have you. All right, so I'm anxious to stun y'all with another knee slapper on Thursday. Thank you for your time.
Hello, Stafford County School Board, Superintendent, SCPS staff, teachers, parents, and students, if any of you are still awake. Mine is. My name is Ross Jackson. I'm here once again to ask the school board to follow the law. In your rush to dismiss Executive Order 2, you have become outright violators of SB 1303. My son, who you just heard from, has not been allowed in his high school in 2 weeks. Why not? Because he had the audacity to follow a legal executive order instead of the persistent overreach of this school board. For that, he's no longer entitled to an in-person education. It seems like some of this board care much more about political agendas than the law. To those of you who might have wanted to do the right thing but were afraid, it's time. You heard 2 weeks ago from many parents. After that, I heard things like, I think SB 1303 and Executive Order 2 can work together, but I'm not comfortable with it. And we haven't heard from the other side. And we don't want to pull the rug from under parents who want masks, or even referencing an SEA survey as a reason to disregard the executive order. I just heard in the working group, what if we remove masks and there's an outbreak? Well, shoot. I guess the law should not apply and we should live in fear for the rest of our lives. Now that the Supreme Court of Virginia did exactly what AG Miyares asked for and dismissed the case from 13 parents in Chesapeake, what is the reason for the masks to continue? In the future, I would ask you to refrain from basing Stafford County policy on every lawsuit from a fringe group of parents in a district on the other side of the state. Thank you to those board members who've actually been consistent in their position to abide by the law. I've already decided that when it comes to your overreach and my choices as a parent, that I will not comply. I would say that it is time to get this right, but we're far beyond that. It's time to fix it, so fix it now. And oh, by the way, when you realize that you have been stepping on somebody else's rights, the answer is not to give yourselves a week to get ready to stop trampling on us. It's to move now. So do it tonight. Until then, if you're a parent, stand up. It's way past time.
Hello, my name is Milton Bratton. I'm from the Widewater Griffiths District. I've been living in Stafford for approximately 25 years or more. In Virginia, probably another 15 years. Came here as a retired military person to enjoy some of the things that Stafford in Northern Virginia has. What I do appreciate and what I do like is keeping the mask mandate until there is a better way to move forward. It's not a fact that anybody wants to keep this nasty thing on, because I don't like it no more than anybody else. But what's even worse than this is the virus, which goes out, and it may not affect the young kids because they're strong, but it may affect the older population when they come home, being advised, because how is this virus being put? Well, it's these guys that's strong, asymptomatic, the virus doesn't affect them, they go home and give it to somebody who is not as effectively strong to happen. So how do you get that? How do you prevent that portion from being on? Is it your parents' choice? You wouldn't take your kids to your parents knowing that they had the virus, but how do you figure that out? What is this system that we have in place to prevent that spread? If I remember the last time when the virus came down and people took the Band-Aid and took the mask off, shortly afterward, it spiked back up. So did we learn our lesson? The lesson is we haven't figured out how to stop the spread through anything. The vaccine doesn't do it. It just prevents you from having the terrible symptoms. The mask, well, it does a little bit if you all keep it. It may short it down a little bit, but it's not an exact science. What the science of this needs to be done is figure out that what our government's going to do to make sure that we can detect it for the people that's here so they can say, hey, my kid's got the virus, I'm going to keep them home. Or I'm going to put the mask on. Do something that you want to demand from the government, from our one right now, or the president, or whoever you want to, is how do we keep early detection going on, and how do we be able to detect the virus so it doesn't spread? Because that's the only way that we're going to be able to defeat this virus in the future. Thank you. Thank you very much. I appreciate it.
Sir, could you please sign in? Mr. Brad.
Thank you.
Good evening. I have 3 amazing children in Margaret Brent Elementary School. My name is Melody Moore, by the way. It is really quite simple. If you like your mask, you can keep it. No one is asking you to take off your mask. We are simply fighting for our constitutional and God-given right to choose what is best for ourselves and our children. Everyone was so quick to follow the previous governor's orders, even to the point of placing the blame or responsibility on the governor for your implementation of a mask requirement. Well, there's a new governor and a new order, and yet all of a sudden governor's orders are irrelevant. And I should probably note that children are only wearing masks in school. We've gone to birthday parties with the same kids that we go to school with. No one's wearing masks, but then we show up on the school grounds, they have to wear a mask. It doesn't make any sense. All the students that you're requiring to wear masks right now are not wearing them anywhere else. Again, no one is saying you must remove your mask, although I do feel that the muffled instruction in the classroom is a huge disservice to our children. But if your mask makes you feel safe and you're convinced that masks work, then you are welcome to wear 2 or 3 masks and science goggles, face shields, whatever. But if all that works, then it should not matter for you if my children are wearing masks. We do not need the school or the government to co-parent our children. In fact, that's not even the purpose of a school. If Stafford County continues to deny parents choice, they will lose my 3 incredible, well-behaved, kind, and motivated children. We have been blaming an awful lot of stuff on COVID, but it is high time we start holding individuals accountable for their decisions and actions and stop using a virus as a security blanket for individual cowardice.
Hello, my name is Brandon Warner, and I am a COVID survivor, so thank you. Just to a couple of the points I've heard since I was standing up there. We're not going to stop an airborne virus. Masks won't, vaccines won't. It's a mutating virus. That's why there's never been a vaccine for this. That's why we don't bother with it. I mean, there's money to be made, don't get me wrong. I think $55 billion for Pfizer in this quarter. Anyways, I'm sure it's nothing. Overall, we're going to be okay. Everyone, take a deep breath. We're going to be okay. Luckily, I guess the decision's been taken out of your hands. So no one has to, be brave anymore or stand up for what's right. Apparently, when the governor signs this, it won't matter what you say. So that's just something to keep in mind. If you vote on Thursday, it can be 7-0 and it won't matter. So overall, I think we just need to get back to the way things are. If your kids are sick, by all means, keep them home. That is a problem that goes on all the time, every cold and flu season. Kids will be sent to school by their parents sick. That's a problem. That should stop. I would say that. I noticed that a lot of the people out there in the audience have masks and they're sitting less than 6 feet from people. Not so many anymore as most of them went home, but they didn't seem to be afraid. I wasn't sprayed with Lysol or anything like that. It was okay. We're going to be okay. Overall, we're going to be okay. So, have a good one.
Good evening, board members, Dr. Taylor. My name is Lucinda Grajkowski. I'm part of the Garrisonville District. A lot of my peers have covered, the same stuff that we've heard about over the last few weeks. So I'm here to talk about another virus that we have on our hands right now, and that's the internet. Because for some reason, our board lacks policy and sent all of our children home with Chromebooks that have 0 security measures on them. 0. Adults, federal employees have more restrictive measures on their computers than our children do. You literally gave our children a weapon and sent them home with them to sit behind for countless hours. My children right now are at home. They're elementary school. They decided they did not want to wear a mask and they were going to comply with the governor's order. They've been at home for the last 2 weeks, sitting behind their computer, not doing congruent learning because there's 3 of them, all under the age of 10. So we've been doing worksheets, and they've been logging on to Dreambox and Lexi and whatever the heck else that you guys have dreamt up to put out there for them. And they're not learning anything, okay? But yet, what my 5-year-old came home and told me the other day was that our neighbor kid, who's 6, 1 grade higher, was watching Hello Neighbor on his school computer at home. Let me read to you what Hello Neighbor is, just in case you're not familiar with it. Hello Neighbor is a survival horror stealth game developed by Russian video game studio, and it's published by Tiny Build. This game allows people to log in and break into their neighbors' houses and kill or stab or light their house on fire. And this is what our children have access to because you guys have failed them to put in security measures on their laptops for when they're at home. Thankfully, I manage my children's internet time, and I'm not one of those psycho 2 screen hours a day. No, we're not like that. We watch TV and do all the things. But I'm sure as heck not going to let my children play those kinds of games. I'm going to let my 10-year-old play Fortnite and all of those other crazy video games, let alone what he has access to when he's at home from a device that you guys gave him. So I'd like to have you guys take into consideration the policies that you need to write and put forward before you implement them out onto our students. And another little segue that I just want to throw out there is for everyone that's saying all these teachers want to quit, that don't want the mask mandate to go away, there's just as many teachers that will come back to work and do just as good of a job without wearing a mask. So it's a double-edged sword. Stop trying to play that as a political pawn of, oh, these teachers don't want to do this or that. It goes both ways. We're adults. We get to make that decision.
Good evening, Mike Johnson, Rock Hill District. Yet again, I don't prepare a speech because I hear so much stuff, I just take notes. Thank you, Dr. Taylor and Ms. Healy at that budget town hall or whatever it was called. Great opportunity, a small group of folks, see information, ask questions, unlike this venue. So appreciate that. Wanted to talk quick, and my wife will talk more about my daughter's exemption. We're gonna get personal here. She gets herpes on her chin, because that's a thing. Cold sores. Doctor says keep it dry, blah, blah, blah. It's even got a staph infection in it once. So we said, hey, you guys approved these medical exemptions. Let's go through that process. Quickly on, it's a reasonable accommodation process, okay? So that's kind of failing. So good attempt, I think, there, but that doesn't work. I'll let my wife talk more. Teachers and administrators, specifically at Garrisonville Elementary School, fantastic. I have to apologize to them over and over because I know I'm being a pain in their ass. And I'm like, hey, I know you're not making these rules, but I have to ask these questions. I'll ask some of those questions later, so I just have to throw some kudos to them. Stop contact tracing, you're killing our administration. They got better things to do with their time. All right, I wrote a bunch of questions. Don't expect answers from you. I probably don't have the answers, but I'll just start reading them.
Why is it this past summer, when the CDC said masks were not required for vaccinated people, did magically 80 to 90% of people stop wearing them? Why is 15 minutes of not masking in school safe, but 16 minutes isn't? Why is not masking while people play sports is okay? Why is it a point of order when a board member's called out for something, or why is it not a point of order when a board member's called out like I just did to compliment them? Why can't you address a board member directly? Why can't a board member be held accountable for their comments and actions? Why can't North and Forge have the same fields as other schools? Why can't we just make our school zones COVID-free zones? Lastly, a question from my third grader as we were going through this reasonable accommodation procedure, and she was told a face shield was a reasonable accommodation. I crap you not, this was the conversation. Dad, isn't your breath a gas? Yes, dear. Doesn't a gas fill its container? Yes, dear. Won't my breath just go around this face shield and fill the room? Yes, dear. So, congrats to Stafford County. So, no, that's it. Have a good evening, folks.
Hi, my name's Rachel Johnson. I'm his better half. So to talk about my daughter's exemption, okay, so she's had since she was about 4, who knew you could get cold sores on your skin, not your mouth, just on her chin. It's happened, we had her diagnosed. They told us, the doctor told us, keep it dry. Do not let her touch it, it spreads. If it gets in her eyes, it's the leading cause of blindness in the world. Cool, right? Mask thing happens, COVID happens. I send her to school to mask. Not worried about it because the science is iffy. I want to keep people safe. Science is changing. She recently has an outbreak and it's creeping up her face. I call pediatric partners. Before I tell them my name and my daughter's name, they say we will not give exemptions for any reason to any child. So these exemptions don't exist unless you have the right doctor or the financial resources to go from doctor to doctor to doctor to doctor to get your letter, okay? Number 2, this was given to me by my daughter. She got it from school. I apologize if her teacher made it. I hope not. It's, are you real, or are you for real? How kids can determine if stuff is credible, right? Is it real? Is it reliable? These are the 3 things it tells you are reliable. .edu, .k12, .gov. No. Why would we tell our children to trust government authority? After all the stuff I'm hearing tonight, it's because we want them to listen to the CDC. We want them to listen to Fauci. We want them to listen to Youngkin if the wind is that way, to Northam if the wind is that way. We should be teaching our kids to trust everybody, no matter which side of the government aisle they are on, but especially if they're not elected officials. If they are just appointed bureaucrats, no way. We can do better than this. This scares me, okay? The Chromebook thing, if you want to ruin your teacher's day, tell them no. I did. They've had to figure it out. Not playing that game. Go on your kid's Chromebook, type boobies. See what happens. Kid might lose the Chromebook, though. It's not happening. The science is changing. We need to drop this cognitive dissonance of not accepting the science is changing. We were all on board. Most of the people in this room were not wanting to kill grandma. We weren't wanting to do all the awful things. The science is showing these cloth masks are not doing much, and our kids' mental health is failing. It is. I can see it in my children. I can see it in the pitting of groups against each other. I can see it in the lack of family and team building activities the schools are able to offer. There's no fun. There's no volunteers. There's no lunch. There's nothing for these kids. And I have an 8-year-old whose school has been her favorite thing, and she doesn't want to go anymore. And I'm willing to keep her home because I'll be honest, after 1.5 years of homeschool, her scores were much better. But I like her being there because I like her having the peer interaction. And I love her teacher, and I do love her principal. So if they're watching, I apologize to them again. Thank you.
Evening School Board, Dr. Taylor, thank you. Jackson, Hartwood District. I'm here, I want you to remain steadfast in your principled position to keep the mask mandate in place. Don't blink in the face of mounting pressure, even as other states remove their mask mandates. They seem to be motivated by politics and not principles. Seems that optics are changing, and the calculus is that they can take credit for ending the pandemic and returning to normalcy. Set the example for other school boards that may give in to the temptation to return parental rights, allow individual choice for students, staff, and visitors, and recognize individual liberty. If and when every other school district in the state allows personal choice concerning masks, remain committed and keep our children in masks. You've ignored the law once. What's one more time? You should be the shining beacon on the hill for those who wish to subjugate others to follow rules. As a matter of fact, masks in school, not enough. Perhaps you can convince the County Board of Supervisors to implement a mask mandate across the county. You have wholly succeeded in instilling fear in your school administrations across the county. Fear of being ostracized, reprimanded, or even fired keeps them silent and compliant. They are afraid to speak. Outstanding. No way that fear influences how they answer your surveys or skews the results touted by this board to support your stance. Any damage you have done to the relationships between parents and school administrations, it's not your problem. You just make the policy. You don't have to enforce it. I congratulate you on your contribution to the Stockholm Syndrome that many students have regarding masks and COVID-related fears. They identify with their captors after being influenced, terrified, and subjugated for 2 years. Children are afraid to say the truth out loud, that they want a mask choice. Please ignore the perception that you're hiding behind SB 1303, your legal advisor, or the guise of protecting students and staff. Stand proud in your previous 2 votes, refusing to recognize parental rights and basic liberty. Don't wait until Thursday. You should have a 3rd vote on the issue this very evening to affirm where you stand so that every constituent that you represent knows exactly where you stand. Let them do with that what they will, whether it's increased support or a recall effort. The previous speaker mentioned partisan politics. I request that the self-proclaimed activist on the board please continue posting hyper-partisan tripe, rumor, innuendo, slander, and insults on social media. It's of no consequence that some of your posts include language that would see the very students you care so much about punished. It's not like you have children in the Stafford County public school system that could receive detention, suspension, or expulsion for using the same language in school. If students and parents follow you on social media, and some do, the example is clear. Tear down, abuse, and denigrate anyone who disagrees with you. Thank you.
Is there anyone else who wishes to address the board? Seeing none, we'll close the public citizen comment period and come to item 10 on our agenda. Board standing committee reports.
Does Dr. Warner?
Thank you, Madam Chair. I just want to state that there will be a governance meeting on the 16th of February, and I'd like to remind the board members to please return your comments on the governance documents that were provided to you at the retreat. So if those could be returned to Ms. Hall this week, that would be appreciated. Thank you.
Thank you, Dr. Warner. Are there any other standing committee reports?
Just
Yes, Ms.
the
Halstead.
Student Health Advisory Committee met.
Oh, that's,
Oh, that's advisory, that's different?
Right.
Oh, gotcha. And then I got nothing.
okay. All right, board member comments. Ms. Halstead, would you like to begin?
Do you want me to begin?
Why not?
All right. So they tell me to be brief because it's late and brevity is just not my strong suit. So I'm gonna try. So, I'm just gonna tell a little story here, and I hope it's makes the mark it's supposed to make of, under the guise of all of the things that we've been talking about and the heaviness of the mask mandates and COVID. A short little story about my childhood. For those of you who don't know, board members, and citizens now that they're all watching and listening, I was raised from the time I was 3 in a funeral home. My father was a funeral director, and we moved in when I was 3. I lived upstairs, and the viewings went on downstairs. So I have a certain level of, some might call it over empathy for the process of grief and what grief actually does to an individual. And that grieving happens at all levels and all capabilities and for all situations. So my comments tonight are related to the grieving that we are doing for many reasons. One, we have to let go of the past 2 years in order to move forward. And that's a process in and of itself. But also, we have to start learning how to forgive each other and walk through some of these, although, well, I won't get into that, but, you know, my point is that there's so much that we've talked about up here, and there's so much that we've done. Recently, I saw someone posted a picture of a baby casket related to COVID and the number of COVID deaths that are occurring with children. So for me, that takes on a completely different, I don't know what the word is, but when I see something like that and I see that sort of insensitivity to it, I just want to remind us that we've got folks out there that have lost children to something other than COVID. We've lost loved ones and family members. We have so many things going on in our schools with our poor kids. You know, situations that kids are grieving over now as well that we're not addressing. So I want to caution us all just to begin to move forward and remember that empathy, like grief, has many different colors, for lack of a better word. It looks different to a lot of people in a lot of different ways. But when you are 3 years old and have to put your toys away at 5 o'clock because the family will be coming in downstairs to mourn their loved one, you grow up pretty fast and you learn things pretty differently. And you learn to see the world for the moment that you're in and to appreciate every second that you have on this earth. And so I just encourage us all to remember that our time here is limited, and that while we're all sorts of arguing and mad and caught up in this panic, we're forgetting to live a little. Just wanted to remind us to do that.
Thank you, Ms. Halstead. Dr. Chase.
Yeah, I've had a couple of busy weeks since our last board meeting. I tagged along with Dr. Taylor on a visit to Grafton Elementary, Stafford High, and Falmouth Elementary. And part of the reason I did that is I've heard from a lot of folks about the toll of masking in our schools, and I really was interested to see what it actually looks like. I was pleasantly surprised. I saw lots of happy children. I also saw amazing teachers and administrators providing students with great learning opportunities. It was especially fun to join in on Miss Grevin's cardio drumming class. Dr. Taylor and Mr. Sidebotham have some impressive skills. But I did notice something rather concerning. At one of the schools we visited, the principal pointed out all the brand new teachers that had been recruited. They had no prior teaching experience, and they were responsible for helping students recover after a year of hybrid instruction. I then reviewed the personnel reports provided to the board before each meeting. We have had 15 teachers resign between January 5th and February 9th. During that same time, we hired 5 teachers. They all had 0 years of experience. Today, we received a list of all our licensed staff by years of experience. Out of 1,419 licensed staff, 778 had less than 5 years of experience. That means 54% of our teaching staff can be considered inexperienced. And I would know, I'm a teacher. So I spoke with the supervisor this weekend. They told me they didn't think they could afford to fund the school system's upcoming budget request. I would submit that Stafford County cannot afford to not fund our request. We are at a crisis point with respect to education. If I had children in Stafford County Public Schools right now, I would be fighting like crazy to make sure teachers feel valued and appropriately compensated so that they stay. Thank you.
Dr. Warner.
In the interest of time, I will keep this brief. Thank you, Madam Chair. I would like to say that I've heard from a lot of teachers, there's a lot of concern. They feel like they're drowning and they feel like they don't have the support they need. I think it's really important that we work to fund this budget and to fund this correction to the license scale. And I think it's important that we choose our words wisely when we're discussing teachers, because they have been bearing the brunt of much of the trauma over the last 2 years. The concurrent learning, the disruptions, the schedule changes, and it is taking a toll. And for many of them to say they're ready to quit and they're ready to move into different fields, they're ready to just stop teaching, they are no longer, it's no longer empty words, they're real words. I think that when I go into the schools, it's rejuvenating to see the kids, to see them learning, to see how dedicated our teachers and staff are, and to see how happy they are everybody's happy to be there. And each school has its own unique personality, and I'm proud of all of them. Thank you.
Ms. Sigmund.
I just wanted to thank the citizens of Garrisonville and Dr. Taylor for coming to Park Ridge for our budget town hall. We had a really great discussion. I also wanted to thank the administration and faculty at Park Ridge that welcomed me for a visit to discuss what it's like to be a patriot. I did enjoy that as well. I also wanted to raise awareness. I had a great visit at H.H. Poole. Some of their history teachers invited me to attend their trunk program with the National Marine Corps Museum. We have a Stafford County teacher in residence at the Marine Corps Museum who will come to your school, about an hour lesson, hands-on, bringing artifacts from the museum to teach the kids in their K-5 colonial teaching trunk, or their middle and high school, it's a World War II was the teaching trunk I got to visit, and it was fantastic. And it is a resource I did not know was available. And in the interest of expediency, it was so much fun to bring the museum to the kids rather than having to load them up and take them out to the museum. So if you are out there, if you're a PTO, if you're an interested parent, if you're a teacher, I strongly recommend you look into bringing this program to your schools. I too have just loved going and seeing all the kids enjoying being together, having activities like that, the return of sports, the return of activities, the return of just, regular school. I am also seeing the students that are struggling to learn, to meet their metrics, to reach their goals. And for that reason, I am also going to encourage you to reach out to the appropriate parties to encourage support for the proposed budget as it stands now, and recommend to us what you think that we're missing or where we need to revisit those topics, because it is so important that we get this right so that we can build back for our kids. Thanks.
Thank you. Ms. Guy?
Thank you. Thank you for mentioning that trunk thing, because I never knew about that, and I would love to be able to see that if one of my schools do them. I just want to thank just everyone who came out and spoke. I took notes again, as I always do, and I just really appreciate people advocating for themselves, for their community, for the kids. I love the parents who came and mentioned that we need to be advocating across the street. And that just needs to be the mantra that we keep giving, because there's an issue in every facet of Stafford County schools. And money doesn't fix all problems, but these problems are because of lack of funding. So if we don't have our budget fully funded, I'm very fearful of what the landscape will look like next school year and the school years after that. I also appreciated Dr. Baker and one of the a few of the teachers just speaking about how we engage with one another, either on social media or in person. I don't understand the reason why people use words that our educators are feeling attacked sometimes. And it doesn't matter what the subject is on, but the scrutiny, it just seems like it's extra, right? And I just worry. I know there's tons of issues in the schools. There's issues all over, like that's life. But I do worry that we're breaking the spirit of the educators. And I don't know, I just hope that we can tone down some of, like, state your opinion and not attack a person's character or say how they feel when honestly all we know is what they've stated. So I just hope we can just try to still remember that we're neighbors. And that's it.
Thank you, Ms. Guy. Ms. Randall?
I would also like to thank the Ferry Farm community that came to Ferry Farm Elementary School. And we had a lot of support there that night from central office staff. We had some really amazing teachers that came and community members. And I enjoyed talking to them and seeing them. It's always just fantastic when, as board members, you get to go into the schools. I'm super excited because tonight, as I was walking back in, I got to see one of my former students. Hi, Flavius. And so that always just makes my heart warm as well. I'm just keeping it brief tonight because I'm waiting for Thursday. Thank you.
Okay, I'm going to keep it brief because we still have a long night, a lot to cover. But I want to echo what my colleagues are saying here. I think we're all saying we all have the same goal, and that's what's best for education of our children. We have different approaches, different views, and I would just ask that we treat each other with respect and courtesy. Whoever signed this tonight, I say shame on you. I don't know who did it, but to put that name in there, that's shameful. That shows a disrespect for your fellow speakers. It shows a disrespect for this board and our community. And I think we're a lot better than that. So I just don't know what to say. I've never seen something like that. I know there's a lot of frustration around. And as much as you're frustrated, the people at home are frustrated, our staff is frustrated. Speaking for myself, I can say I'm frustrated as well because I don't feel like we're moving forward. And this is our opportunity. We have an amazing superintendent who is going out of his way to reach out to the community, who has put together a great budget. I've never seen so many people come to speak about the budget and express support. In these public budget hearings, we're lucky if we have a handful of people, but we had more because I think Dr. Taylor has made an impact. He has offered to go to each one of our districts on evenings to meet with our community. I very much enjoyed the Rock Hill meeting. We even had some interlopers from some other districts who were welcome to come. I had to tease them about coming to more than one, but you know, people are welcome, and we have an opportunity here, and we need to grasp that as a community. So I'm hoping that we can work together, including this board. You know, we need to do better as a board, and I would ask our community to try to work with each other and with us. And I do have a compliment. There were people that came to speak on both sides of the masking issue, and I did not see, except for one instance, disrespect. So I commend you for respecting your fellow citizens. And we will be addressing this issue later this week. On a positive note, we had the dedication ceremony for the Dr. Scott Kisner Safety and Security Operations Center today. Ms. Randall and Ms. Guy were able to attend, and the center is pretty darn amazing. And I would encourage all of my colleagues to go. And Dr. Taylor, if someone from the public wanted to do that, maybe you could, let us know or put in one of your letters how they could arrange a visit. Wow, you've got screens from every one of our schools there. Mr. Martin seemed like almost a proud parent with this wonderful operations center. Very impressive, and it allows us to enhance our security for the schools, and also allows us to communicate and work even more closely with the sheriff's office for the security of our students and our staff. So that's mine for this evening. We'll have you, Dr. Taylor, and then we will get started on the business for the evening.
Thank you, Madam Chair. I will also be brief, and I would like to express that I actually have a heart filled with gratitude and hope. As challenging, as tough as times are right now for everybody, and as frustrated as folks are, there's a lot of good work that's happening. And the work of public schools is pretty simple. We're here to create fantastic learning environments for our kids and to create memories that inspire them to become their future self. And we've got a fantastic group of folks that are working very hard every single day to make that happen. This week is Counselor Appreciation Week, and I'd be remiss if I missed the opportunity to thank our school counselors for the hard work that they do. Unlike a lot of our positions in the school system, our counselors are not staffed very well. They're staffed pretty much to the state standards, which is not very impressive. And our counselors work very hard to guide our kids, to deal with crises on a daily basis, to provide even direct instruction about future planning. And they lend a lot to the school environment. And I'm, for one, am grateful for the counselors that I've had the opportunity to meet in Stafford County and the ones that I've had to work with in the past that just truly have been great educators. So I thank our counselors. And I would like to also thank my team that's here late tonight. They were serving lunch to our counselors earlier today to thank them for their service, and they share in the same gratitude that I have. This is very much a team effort, and all of the things that we've been trying this winter, and some that we've been getting right and some that we're still working on, has been an effort that's been supplied by just a really outstanding group of folks that's working very hard for other people's children. And there's a saying that I like to use, and I'm hoping to put it on a banner here, is that we are here to make good things happen for other people's children, and to never lose sight of that fact. I am so grateful for the opportunity to visit each election district and each magisterial district to talk about the budget and some of the wonderful things that are happening in our school system. And I got to tell you, each has been unique, and each has been really fun, and the conversations have just absolutely been awesome. I have to point out a couple that are really just fantastic. Ms. Healy, we got to talk to Mr. and Ms. Johnson, Mike and Rachel, who were here tonight at the Rock Hill Town Hall, and we got to have just an intimate conversation about the things that were working well in the school system and the things that were not working well in the system. It was a great opportunity to connect with people who really care about their kids in the school system. Ms. Sigmund and I got to go to a budget town hall on Friday night, and if you were to lay a bet on how the attendance would look on a Friday night at an elementary school in Stafford County, you'd probably be wrong, because the place was packed. And there were a lot of really excited and engaged people, and we even got to talk to one family that wanted to help us start a countywide PTO, PTA, PTSO organization to get all of our PTAs on the same page to support schools and to have like a formal organization. Some really great ideas came out of that. Last night, Mrs. Halstead and I hosted a town hall at our Fleet Services building, where folks got to see firsthand how our buses are maintained and what happens in our Fleet Services building. And Mrs. Randall, we got to go to Ferry Farm Elementary School, the one school that is geographically located in the George Washington district, although many students are served outside of the GW. And we had great conversations that lasted deep into the parking lot night hours And Mr. Durst was here, and he was a speaker. He brought a little humor tonight, and also brought a lot of good suggestions to us that night, along with many other parents. And so with that, we thank our parents for coming out and challenging us to be better. There's a lot of room for improvement. There's a lot of things that we have to focus on, but the way forward is together. And in just a few moments, I get to talk about our bell schedule for next year, and I'd be remiss if I didn't point out the role that our students have had in those decisions and how important that voice is. And to see that student voice echoed here tonight, and to see that student voice echoed in the other work that we do, we are looking to make that more of a commonplace occurrence in our district, where the students are not only considered in the decisions that are made, but they're an active participant. And so with that, it is with tremendous gratitude and a lot of appreciation and hope that we look forward to the coming months as we get a lot accomplished, because there's a lot on the board's agenda, and a lot is going to happen, but also a lot is going to get done that's going to help move us forward. So thank you.
Thank you, Dr. Taylor. I just want to clarify, I was not speaking about anyone who addressed the board tonight. There was what I will call a fake sign-in here, and I read the name because I thought it was a person. So I apologize to anyone who was offended by that name. That will not happen from me again. That brings us to the consent agenda. Do we have a motion for approval?
Motion to approve.
Motion by Ms. Randall. Do we have a second?
Second.
Second by Ms. Sigmund. Any discussion? All in favor, please say aye.
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 All opposed? Motion carries unanimously. Action items, 1401, approval of proposed premium rates for substitute assignments at an estimated total cost of $110,000 to be paid from salary savings in the operating budget. Do we have a motion?
Motion to approve item 1401 for the substitute salary.
Second.
Motion by Dr. Warner, second by Ms. Randall. Any discussion? I have a question, Dr. Taylor. When will this be effective, if it's approved?
This will be effective on February 11th if the board approves it.
Is that a Friday?
As a matter of fact, it is. It will be our first premium day.
All right, well, just for the people who may not have reviewed this, could you just tell us what that change is for Fridays? For substitute
Absolutely.
assignments?
We'll be increasing the substitute compensation for days that are high traffic days, or days where we have a high or lack of participation in substitutes collecting jobs. We'll be increasing the as-needed license sub to $200 a day, and the building sub rate to $146 per day.
And Friday.
Yeah. Mr. Burnett, do you have anything that you want to add? You seem anxious to talk.
Well, I've been up and down all night. Good evening, members of the board. I just wanted to clarify that the Fridays were not chosen arbitrarily. We did a deep dive on data going back to pre-pandemic, and the trend is very consistent, that if you're looking for the days where you had the highest number of requests for substitutes, it was Fridays, and it was the days on either side of a holiday in the winter in particular. So the days that are identified for as the high volume days going forward are using those criteria in particular. Friday the 11th is an extremely convenient date. In addition to being a Friday, it is also the start of a payroll period, which makes it a very good date to implement the change.
Thank you.
Can I ask a question?
Yes, Ms.
You
Randall
say
has a
for
question.
winter, but is this also the day that's a struggle in the springtime, or is that a Monday, or is it just,
The Tuesday
is
that-
it really Friday like all throughout the year?
It is Friday
Okay.
throughout the
Okay.
year, and then it
Okay.
is days on the other side of on either side of holidays, particularly in the winter when people get sick.
Right, and I'd like to thank Dr. Taylor for bringing this to our
Suggestion. Great
attention
suggestion.
with his suggestion. Ms. Sigmund?
I can't remember if we've covered this already, so forgive me, but is there a reason we're not seeing an increase for para subs?
So as a matter of fact, we are going to be increasing for parasubs, but we are doing that within administrative purview.
I think
or subs for paras. What are you talking about?
I'm talking about this first line on the sheet here, instructional and LD special ed paraprofessionals. The current and the proposed are the same.
That's true, and most of the rationale for that, we as a general rule do not provide substitutes for instructional paraprofessional positions because on our staffing standards, we are overstaffed
we have more paraprofessionals that are required by state standards. So we're providing a substitute in those situations is generally not mandatory. So we prioritize the substitute provision for teachers. For our LD special ed positions as well, it tends to be easier positions to fill. The reason that we moved our our low incidence special education paraprofessional positions to the as needed line was because we found those assignments were particularly hard to fill. So we raised the rate for those positions this year. Does that answer your question?
Yes, thank you.
Any other questions? No? All in favor of the motion to approve, please say aye.
Aye.
Aye. All opposed? Motion carries unanimously. 1402, approval of proposed hiring and attendance incentive for nutrition service field employees at an estimated cost of $338,074.83 to be paid from the school nutrition fund balance. Do we have a motion?
Motion to approve 14.02.
I second.
Motion by Ms. Randall, second by Ms. Halsted. Any discussion? Hearing none. All in favor, please say aye.
Aye.
All opposed? Motion carries unanimously. 1403, award of a contract to Modern Door and Equipment Sales in the amount of $121,877 for the replacement of cafeteria partition at A.G. Wright Middle School using budgeted FY22 operating funds. Do we have a motion?
Motion to pass 1403.
Second.
Motion by Ms. Sigmund, second by Dr. Warner. Any discussion? Hearing none. All in favor, please say aye.
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 All opposed? Motion carries unanimously. 1404, award of a construction contract to Centennial, Inc. in the approximate amount of $431,000 for replacement of 2 existing heat boilers at Brook Point High School using COVID-19 state and local fiscal recovery grant funds. Do we have a motion?
Motion to approve the 1404, the purchase of the boilers for Brook Point.
Second.
All right, we motion by Dr. Warner, second by Ms. Randall. Any discussion?
Yeah, I would just like to note, commend Mr. Anderson's department for getting this grant submitted so that we got these grant funds.
I do have one quick question. I just want to, and I don't know if Mr. Anderson's there or if somebody else can answer this. I know Brook Point has had a number of problems with their heating and cooling systems, and I want to know if this repairs all of the existing heating cooling issues that have been ongoing at Brook Point.
No, ma'am. This is just for the boilers that were a problem, and they were both giving us problems right before the cool weather season, and so this just replaces the boilers. But we are doing an RFP for the design of the rest of the system, and we'll be working on that as a part of the grant-funded project.
Thank you, Mr. Anderson. Any other questions? All in favor of the motion to approve 1404, please say aye.
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 All opposed? Motion carries unanimously. 1405, adoption of a resolution award of 2 delivery orders, one to Bluebird Bus Sales of Virginia for the procurement of 12 mainstream school buses, and one to Sunny Merriman, Inc. for the procurement of 11 mainstream school buses at a total cost of $2,793,370 from the school's capital reserve fund maintained by the Stafford County Board of Supervisors, pending appropriation. Do we have a motion?
Motion to approve 1405.
Second.
Motion by Ms. Randall, second by Ms. Guy. Any discussion?
Do we have any word yet on the buses that we have already ordered, or that were supposed to be in January, coming in February? Like, any more updates? I'm asking every week. I'm sorry. I just got to know when they're coming.
I know. So we did receive a few this week.
This week?
Yes. So that's great news. And now, so we're going through the process of getting the radios and everything else installed to have those rolling. I believe there's a few special ed buses that we received.
Okay.
And got word that I believe a few more are coming next week.
Okay.
So they're slowly coming in, still.
Now, this, remind me what
Yes, ma'am.
month these were ordered?
These would have gone all the way back to, I believe, last May.
That's what I thought.
Yeah.
These are our May orders.
April,
And we
yeah.
still have 2 other orders, and this will be our 3rd order in
Yes,
for
ma'am.
buses. Okay.
Yep.
Which is exactly why we're ordering these, when we normally wouldn't order them
Correct.
until
Summer.
the summer. We're ordering them to hope to get them before we start school.
Okay, thank you.
Okay, any other questions? All in favor of motion to approve 1405, please say aye.
Aye.
Aye. All opposed, motion carries unanimously. 1406, reduction of quarantine/isolation requirements. This is what we had the presentation in the work session.
Motion to approve 14.06.
Second.
Motion by Ms. Halsted, second by Ms. Randall. Just for the record, because it's been so long since we had that discussion, could we just have that repeated so that the people that are participating electronically or
Dr. Hummer.
here could either be refreshed or hear it
Thank you,
first?
Dr. Hummer.
Yeah, just
Absolutely.
very briefly, Dr.
Just
Hummer.
your-
Sure, sure.
Thank you.
So,
Yeah, just the recommendations.
Yes.
And that's what the motion to approve is, these recommendations.
absolutely, absolutely. So there are a few recommendations that we have for you to consider. The first one is the reduction in the requirement for isolation. That is, if you test positive from 10 days to 5, that's for staff and for students. A reduction in the quarantine days from 14, 10, and 7 from that to 5, and it goes to a recommendation, not a requirement, as well as we will reduce our contact tracing practices to only high-risk situations, which is any situation that involves an essential worker, a teacher, a high transmission area such as sports, PE, chorus, band, as well as any situations that involve a staff or student that is immunocompromised or has comorbid type conditions, or if there is an outbreak. We will also continue to track cases locally. We're no longer required to share the information with the VDH unless it's an outbreak, so we don't have to track that daily, only if it's 3 cases or more that are linked. So those are the recommendations for the board to consider.
Thank you, Dr. Hunter. And
Absolutely.
another difference between what came to us at the last meeting, which was not approved, was there is no distinction made in the application of these recommendations to whether you are vaccinated or not vaccinated. Is that correct?
Can you say that one more time, please?
We're not going to distinguish whether someone's vaccinated or not vaccinated when these recommendations are.
If I could just clarify, I thought we discussed that we would ask the question, but we would no longer
No,
document it.
but we're not going to apply.
Correct,
Because
okay.
they're going to apply to everyone, whether they're vaccinated or
gotcha,
not.
okay.
That, to me, that is a significant distinction from what came to us.
Got it.
At the last meeting, and I know,
It's huge.
we had
Gotcha.
board members that expressed concern. So thank you, Dr. Taylor, Dr. Hummer, for addressing that.
Absolutely, thank you.
All right, any other questions? All in favor of the motion to approve the reduction of quarantine/isolation requirements, please say aye.
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 All opposed? Motion passes unanimously. Moving right along to information items. 1501, and this will be on the agenda for the next school board meeting, approval for the purchase of 5,000 Chromebooks for secondary students in an amount not to exceed $1,960,000, contingent upon award of the Federal Emergency Connectivity Grant Fund for this purpose. This will be coming back to the board. Dr. Taylor, when this comes back, could we just have a brief address of the security that we do put on Chromebooks? I think there's some
Absolutely.
general misunderstanding, and that would be a good time to bring that back. This is not using Stafford County Public School funds, it's grant funds, and it's contingent on getting the grant.
And Madam Chair, may I ask Mr. Cook a couple of questions here? So one of the things that came to us from the advisory committee last year, and I just absolutely liked, was the rotation of the computers and the kinds that each of the different levels would get based on their needs. But when I was looking, I think I was looking at something earlier, and it showed that we would be getting computers for 8th and 9th, and then I think I saw one for 11th. And I thought we were going K-5 and 9. So then
yes,
I was
ma'am.
curious why 8 and curious why 11.
Yeah, back in December, you guys approved
the purchase for the kindergarten and
Yes.
the original 9th grade Chromebooks. And those are on order and coming. This is a grant that will sort of augment the whole cycle, and we're going to issue those to rising 9th graders, and then the ones that we're going to give to the 9th graders this year, we're going to go ahead and give those to the 10th graders that are currently in 10th grade.
Okay.
That way, and we're also going to give half of these to the rising 8th graders. So we'll actually be able to sort of skip a year in one of the out years for the rising 9th graders that year after that. So this is actually going to save us money in the long run.
Okay.
And it's quite a bit of like
Okay.
$2 million. So,
I hope.
yeah.
We appreciate the help. Thank you.
All right, so this will be back on the next agenda for approval. And that brings us to 1502, right at 11 o'clock, Dr. Taylor. Review of the bell schedule. Is it time to ring the bell yet? Data and recommendations for the 2022-2023 school year bell schedule.
I will try to make this quick because time is pressing. When the board first asked me to look at the bell schedule and to assess our transportation situation, it was back in November when I was interviewing for a position for superintendent, and since then a lot has happened. And I would like to give special recognition to Dave Fouth and the entire transportation ad hoc committee that the board appointed, because these recommendations dovetail with that committee's recommendations. So you're not going to see anything in this presentation that runs counter to what that committee's recommendations are. It's also noteworthy to say that when we surveyed perceptions of our faculty, of our parents, and of our students, that they definitely presented information that agreed with one another in some respects, but also diverged in other respects. And that there is no perfect schedule or perfect approach for every single person in Stafford County. That does not exist. But there are elements of the schedule that we are presenting for your consideration over the next several weeks that do align with what our goals and some of our priorities were. And it's noteworthy to point out where we started in terms of what we were prioritizing and what folks had said to us was really important. And the number one thing that folks had communicated to us as being really important was having sufficient instructional time in the school day. And that is a big switch because this year we made a change to have a reduced instructional day. So adding back that instructional time to take care of learning loss, to meet state standards, was particularly important. The second, and not by a large distance either, was making sure that the kids got to school on time and that they departed school on time. This was echoed time and time again in our survey findings, and this was a consistent theme throughout, and something that this board and this community has been talking about really for the last 6 months, is how do we provide an on-time transportation schedule that is reliable and that will give the highest probability of our kids being in school. Now, this is particularly important because when our kids are late, they are missing instruction. So even in a reduced schedule time frame, if they are missing even more instruction, it's catastrophic. And there really isn't a great way to make up that time that's going to be meaningful. We also have dealt with over the past several years, even before the pandemic, dealing with our staff having to stay late to supervise students who were waiting transportation, so that on-time departure was also something that was particularly important. We do want to be good stewards of the community's resources and make sure that we efficiently use our transportation resources. And in some areas, I'm going to be completely transparent with you, we are very efficient. And in other areas, we are very purposefully not efficient. And the reason that we're purposefully not efficient in some areas is because we are counterbalancing that with a high level of service. And I'll point out what those areas are. We want to make sure that we have consistent travel times, that we don't have one route that is an extended period of time, like an hour and a half, and then another route that's only a few minutes. We want to balance those routes out into something that's a little bit more predictable and easier to manage for our parents and families. We also want to be able to accommodate more of the special programs that we've come accustomed to over the years, but over the last few years haven't been able to provide. Things like field trips, things like activity buses, and consistent special programs, travel programs, and interscholastic sports. And we feel pretty confident that we're able to do that with the following recommendation. We would like to return to a 6.5-hour instructional day. Instead of having a 4-tiered bus system, we'd like to have a 3-tiered bus system. And the big switch for us is, of course, to have 60 minutes in between each bus tier for students. Now, it's an important distinction to have that 60 minutes in between tiers for students, because that is not the distance in terms of time between tiers for our bus drivers. And I'll show you what I mean by that in a moment. But we believe that this system will provide us the optimal opportunity to provide on-time service, more instructional time, and give us some extra flexibility. So I want to take a look at instructional time and how things looked over the past few years. And I'm going to start with the 2019-2020 school year. It's the start of the pandemic. We had 177 days scheduled in that calendar. And we had 2 different schedules that operated. One was a 6-hour and 35-minute, and the other was a 6-hour and 40-minute. And that netted some significant bank time. We went to the hybrid schedule, which had 6.5 hours plus, also netted some significant bank time, and had 179 instructional days. Then we got to this year. And even though we had 180 days in the calendar, the reduced time in minutes did not leave us a whole lot of bank time, and this is why I brought forward that calendar amendment for the board's approval, and it shows. I've got a little asterisk down there in terms of the proposed schedule for next year in terms of 181 days because of the surplus amount of bank time. I hope the board will entertain a proposal from me to change our schedule a little bit and maybe increase a couple of professional development days in lieu of 181 student contact days. That will be forthcoming pending your consideration of this proposal. We'll then go back and take a look at the calendar if this is something that you like, and potentially look at some other days that might line up a little bit better, because we will have sufficient bank time in terms of instruction. And it would be nice to get our teachers back in the mode of doing some meaningful professional development and having some time set aside in the calendar for that to occur. An important thing that I would really like to spend some time talking about in greater detail is the time between tiers and the outcomes that have come as a result of that time between tiers. In 2019 to 2020, as some folks might refer to as the good old days, things still didn't work. And transportation wasn't great. It was good, but it wasn't great. There were still some delays in the morning and still some delays in the afternoon. And the reason for this is you had routes that were longer than 50 minutes, but the time in between tiers was 40 to 50 minutes. So we were setting ourselves up for failure because the time of the routes was longer than the time that the drivers had to complete those routes. Of course, that wasn't a problem during the hybrid schedule when we had 50% ridership, very few kids on the bus at any one given time, and between 50 to 70 minutes in between tiers, and there were 4 tiers, lots of on-time opportunities to get there, no problems. I see here we've got, for this school year, at the start of the school year, there was only 30 minutes in between tiers, significant delays. After the change to our current schedule, where there's 40 to 45 minutes in between tiers, we still have some delays. We are not planning for any delays in the future. We are planning to have routes that can fit within our tiered window. It's not without some challenges, but we will do it. So I want to draw attention to the fact that we've included a handful of things onto this item in the agenda. The first one is our survey data in the raw. This is every survey response that was submitted from our parents, from our students, and from our staff. It is in a massive spreadsheet. They are also condensed using the survey software to a few summaries, a student summary, a parent summary, and a staff summary. And I'm just going to talk a little bit about some of that data in summary form after we've had a chance to go through it. And I give a lot of credit to our team. Sandra Osborne behind me did all of the redacting over the weekend. And when you've done over several thousand lines of redacting, she did a great job in looking over our data. So we had just over 6,000 students respond. And keep in mind, this was middle school and high school students, so they were ultra engaged. And they provided a lot of great feedback to us, in particular about after-school responsibilities and commitments. Very interested in trying to find the right mix for them in terms of academic performance and the optimal learning time, as well as what was going to work well for them social and emotionally. Those were big factors for them. But their number one factor was what happens to them after school as being the number one. An interesting feature, they, for the most part, said that they would like a 6-hour school day, which is less than what we're proposing. But ironically, when they picked their optimal times, they actually picked between 9:15 and 2:15, which is actually a 5-hour window, not a 6-hour window. You know, there's a lot of different ways you could look at that. You could look at that as our kids are very clever and trying to sneak one past us. Another way that you could look at that is maybe we need to spend a little bit more time in math class. But at any rate, we hear you students that you think a little less time is probably better for you, but we appreciate your thoughts, and their comments were really thoughtful, and they were clearly very engaged in giving feedback under the survey. The parent survey was a little bit different because we asked folks to use the perspective that they have as a parent to place folks into different tiers, first, second, and third, and when they thought that this would be optimal for not just their schedule, but also for learning. And we had just shy of 10,000 survey respondents from parents. Now, when we had 2 email addresses from a household, we sent it to both email addresses from a household, and for whatever it's worth, sometimes families don't agree on everything, and that was obvious in this survey too. So it was good to get lots of perspectives here. For parents, the optimal time frame was between 8 o'clock in the morning and 3:30 p.m. And that was pretty common across the board. Something that parents reflected to us is that a majority of parents thought a 6.5-hour plus school day was a good idea, and that they wanted high school to go first. Not by a huge margin, but by a margin. I will say this, that whether you were a parent or a staff member, everyone can agree that middle school should go in the middle. That was a pretty consistent theme, almost to an 80% margin. Parents were focused on a lot of the same things that their kids were focused on, which was finding that optimal learning time, social and emotional well-being, and of course after-school activities and commitments of their kids were definitely some of the driving factors, and it's important to note that. And although our students, our parents, and our staff all reflected that finding an optimal learning time was most important to them, many of them selected different optimal learning times. So what they perceived as an optimal learning time was different from group to group to group. Staff survey, we had over 3,000 staff respondents, which was absolutely fantastic for us. When you have nearly 3/4 of your staff respond to something, that's just fantastic. We had nearly a third of our parents and about half of our students. Those are great survey responses. Our staff did not want to start the school day any earlier than 7:30. and they didn't want to go any later to 3:30. And I will say this, we're pretty close in our recommendation to all of those recommended times. The majority of our staff also agreed that a 6.5-hour plus school day was a good idea. The staff did have a slight preference for elementary to go first. And they cited a lot of the same reasons that our parents and our students had recommended as well. Okay. So we had to distill all this information down to a handful of recommendations. And although no one gets the absolute optimal except for maybe a handful of folks in a weird algorithm, this is where we landed in terms of some recommendations that we could support both instructionally as well as that aligns with our parent, student, and staff perceptions of things that they would like to see moving forward. So number one was increasing our instructional day and getting back to at least a 6.5-hour school day. Making sure that our buses run on time. In order for us to do that, it is going to require an increase in the time between our tiers because of the geography of our county. No students starting before 7:30 a.m. That was something that was very important, and to end as close to 3:30 p.m. as possible. There was the request to end, for our high school to be the earlier schedule. And even though this was past practice and there was a change, this is not reflective of going against any change that had happened or anything along those lines. It's not what this is about. This is about trying to find an optimal schedule that would give us the best opportunity to get to kids' school on time and to provide learning in a most continuous way as we possibly can. And of course, we wanted to be able to continue travel programs. Now, this travel program piece I'm going to spend a little bit of time talking about because it is important. Before we go kind of any further, it's really important to note what's required and what's not required. And it is a privilege, for the most part, for most of our ridership to ride the bus. We do transport our students with disabilities, our early childhood students, and students who qualify under the McKinney-Vento Act. Those are required and mandated travel opportunities that we provide at least the option of travel. But it is not a requirement that we provide general ed transportation, that we provide athletic transportation for the children of staff members or for travel programs. But this is an expectation in this community, and it's one that we will continue to honor in this recommendation. So there's a lot that we're doing that we are not getting a whole lot of financial support to do, but we do it because it is the right thing to do and because it provides us with an outstanding opportunity to get kids to school on time. So here's what we are proposing. We are proposing that there be a tier that starts at 7:30 in the morning, which means that buses would arrive between 7:10 and 7:20, that the school day would end at 2 o'clock, and that buses would be departing by 2:10. Now, the reason that bus arrival and bus departure time is important is because that is what cues the distance between the next tier. Because if the buses depart at 2:10, they need to arrive at the next tier schools by 3 o'clock. And so they don't really have an hour in between tiers, they actually have 50 minutes. So what this translates to in operational time, if you can follow me here for a second, is that our bus routes need to be 40 to 45 minutes, not 50 minutes, not an hour. And so no bus route really should be more than that for just this reason. Now, this gets very complicated when you get to high school or when you get to our early childhood centers because the geography that they're traveling is significant. And so what you'll see in our system, and you might get a cue into a little bit of the method behind our madness here, is that we are starting from the most geographically challenging tier and progressively getting smaller over time to the tightest tier where we're ending. Now, the most significant challenge for us is actually not in the morning in this schedule. It's actually in the afternoon. So For us, the turnaround time becomes very tight in the afternoon. And so having that extra time between the tiers is what allows us the freedom to say that we will have on-time delivery and return of students. So a lot of folks who I know will be watching this will wonder, what does this mean for my staff schedule? Well, we have some sample staff times of what this would look like in terms of our 7.5 hour day for staff members. But it's important to note that this will vary depending on the school, and this also may vary depending on a school's need on a specific day. For example, a school may want to call a faculty meeting in the morning, or they may want to call a faculty meeting in the afternoon, or they may want to do some professional learning communities work at some point on a schedule on, say, a random Thursday afternoon, and they may have to adjust these times. That's normal. But this is a general rule of thumb that you might look at a school, and it might make sense. So taking a look at the breakdown of where we've preliminarily placed our schools, you'll see some things that maybe make you a little uncomfortable, and that's okay. Because what we are designing our schedule around is making sure that we can provide that on-time delivery and that on-time departure. And that's not going to be easy. So we do have to make sacrifices to make some of this work. It would be great if only high schools could be in one tier, only middle schools could be in another tier, and only elementary schools could be in another tier. To be very, very candid with you, we just don't have enough buses or bus drivers to make that work. But we can selectively, by geography, pick a handful of elementary schools and put them in the middle tier. Now, I want to be very, very clear and say that this is not the final, how this is going to roll for next year, because we still have to assess the routes specifically, but this would be our best guess as of today. You may also be looking at North Star and Rising Star, and oh my gosh, their schedules are nearly 2 hours apart, and yes, that's true. But each of those schools encompasses half of the county's geography and transportation. And they would also be using the same buses and would have their own dedicated bus service for just early childhood education. So the advantages for them is that they would be able to have guaranteed bus service that works just between the two early childhood centers. But the problem, of course, is that their routes are longer because they have this significant geography, similar to Phoenix. So as we work through this and as we polish this up, it's important to note that this is kind of the schedule that we're working with and the direction that we're going in terms of tiers. Some additional recommendations and some benefits that are going to come from this in making this change is obviously we are able to handle an on-time delivery a whole lot easier when we are going from the big geography to a smaller and smaller and smaller geography as we go through the tiers. Some other things is that we would have dedicated buses at each secondary school for interscholastic athletics. That would be great. That we would have specific buses that would be dedicated at each school for providing that extracurricular athletic competition each day. Dedicated transportation for travel students. This is probably the biggest switch. Right now, our high school students are waiting for travel students to arrive from other schools before buses leave during the day. No longer. We are going to pick our students up at their home, and we're going to take them back to their home. And based on their travel status, we're going to provide them a little bit more concierge service. This is not a super efficient way to do this program, except for one thing. It means that the other buses at the high school don't have to wait for travel students. And in turn, it means it is efficient for 90% of those students being served. And we're not waiting on travel students at the end of the day. That's going to hold up all the other buses and create a domino effect. We want to provide, during the middle of the day at the high school level, adequate time for midday travel. And what we mean by this is there's been something that's been discussed for a while at the high school level, providing a period of time accompanying the lunch period where students can connect with teachers, have some social and emotional development in an advisory class period that works like a family unit throughout their 4 years in school. Having this time set aside during the middle of the day would also provide our travel students with adequate time to get to their travel destination if they are a midday travel student without missing lunch and without missing any academic subject areas, which has been a huge issue for our midday travel students. They either had to miss class or they had to miss lunch to make it to their travel program. We would not need to do that any longer. Another big survey finding that I didn't really touch on, and I probably should have, and I apologize for that, is that parents definitely wanted us to continue travel programs, but a majority of parents did not want to have their student transfer to the out-of-district school. I can tell you right now that if our students transferred to the out-of-district school, it would make transportation a lot easier in terms of our travel programs. That was not something that they wanted. That being said, we are still able to pull it off. We are still able to pull it off within our means and live within our budgeted bus allotment and still get the kids to school on time. Having dedicated buses for the early childhood program really simplifies that. It really kind of sets them aside as their own universe. First run, last run, take care of business, same buses, working with the same group of kids, the same age group of kids. There's some tremendous benefits from that. Under this schedule, we would be able to provide a 3.5-hour window in the middle of the day for close by field trips. And we would welcome back field trip opportunities for kids into the school system once again. We would be reinstating activity buses at the high school level, and I think the last section is grayed out, and we would be looking for opportunities to expand that over time, which is a great opportunity for us. So lots of peripheral benefits to what we're hoping to do. The last little bit here is there's a lot of discussion about an opt-in and an opt-out. This is neither, and it's also both. We do want our students in May to indicate a preliminary preference for us so that when we are building routes, we're not building routes for 30,000 students, we're building routes closer to our ridership. We'll ask their initial preference, we'll probably follow up, and we'll ask new enrolling students their preferences so that we can get started with routes. The good news is that families can change anytime. They don't want bus service, let us know. They do want bus service, let us know, and we should have a pretty quick turnaround time to make sure that they get bus service. But it's important for efficiency's sake that we start with something that we can at least work with. And so we will be asking folks in a very direct way, what are you thinking about for transportation next year? With the caveat, of course, that they can change if they want to. So how does this all work? On our first tier, we are planning a need, and this is a conservative estimate, of 208 buses. For our second tier, 213 buses, and for our third tier, 185 buses. And we even heard in public comment tonight, gosh, that doesn't make sense. Well, actually it does, and we'll tell you why. Because our bus request is actually for 240 buses because we're accommodating for a couple of things. We are likely going to have a handful of high school routes that will be longer. We need to accommodate for that. We are likely going to have to deal with an absentee rate that we would want to make sure we have coverage for. We need to accommodate for that. So we are building in with certain assumptions to make sure that we've got a driver for every single route, and so that everyone has a role, so that we are making sure that those are fulfilled. And in the afternoon, and in the last tier, we need to make sure that we have drivers that can then start to switch gears to things like field trips or be able to switch gears to after-school activities and athletics as well. So having a light third tier actually makes a big difference and actually helps us out tremendously in being able to provide those ancillary services that we're excited to bring back to the county. So with that, I am making the following recommendation to the board, and it is tied to my budget recommendation. A line in my budget counts for 15 new drivers, and a separate line in the fiscal 22 budget request that you all just approved tonight also accounts for 15 of the buses in this fiscal year. But essentially what we're asking for is the fiscal resources to bring us up to 240 drivers and 240 buses, and you did 1/2 of that already. And to expand our instructional day to 6.5 hours. And with that, also allowing us the opportunity to do a transportation selection process, the following schedule that's listed up there, and expanded services for travel students, activities, and field trips. I also attached some red line versions that the board may want to look at over the next couple weeks about policy 2103, which deals with transfer students, student transfers, and non-resident students, and how we transport those students. Minor tweaks to make this consistent with the proposal that we're bringing for the board for consideration. So that was a lot, and it's super late at night, but it's a really important topic. And this was one of the big boulders that the board had asked me to tackle upon coming in as superintendent. And I'm delighted to report that we are presenting something that not everyone's going to be happy with, that not everybody's going to be thrilled with, but will meet everyone's needs. And that dovetails nicely with the Transportation Ad Hoc Committee's recommendations. Everything that we're presenting tonight is in conjunction with those recommendations. And I'll take any questions that the board may have at this time.
Ms. Sigmund?
Yes. I want to preface this by saying that Sigmund children will be at all tiers no matter what, so I have no personal opinion on any of this. But one, I'm really, really impressed with the response we got. It looks like 20% of the students, 1/3 of the parents, but 75% of the staff. And 75% of the staff recommended elementary first. I've got 4 elementary schools in my district. I've talked to a lot of those parents and teachers, and kind of the silver lining of this schedule flip was that elementary kids responded really strongly to getting up, going to school, and being done. And given the learning loss we're going to be facing, the literacy delays we are facing in elementary kids, I felt like maybe that should have given more consideration. I mean, I know not everybody can be first, I recognize that, but putting elementary kids last, they're gonna be, for the most part, the ones that don't have a parent at home, they are going to be at some sort of before school care. They're gonna come to school after that, and they're gonna be expected to be learning until 4 o'clock. So while our instructional time might be your 6.5 hours, for a 5-year-old, that's a really long day of being in a school setting. And I think that is not the place we need to be to get all of those kids back into learning mode, especially because by the time next school year starts, half of the kids in elementary school won't have had a normal school year. And that, I know that middle school in the middle, maybe, I don't know, if transportation is an issue, but I really feel like we need to look at the learning environment for these youngest kids, consider putting them at least second with such a large teacher feedback, maybe re-looking at that somehow. At least the middle kids can, be home early on their own or late on their own, whereas little kids can't. I just feel really, really strongly about giving these elementary kids a better attempt at getting to their more optimal learning the way the teachers have provided feedback for based on this year. And if they're saying that after this year, when we have just more to give them, a more normal environment as far as time and resources next year, then I just think it will be so much better for them.
And I just would point out how actually evenly split parents and staff were on that, and how close it was to 50-50 just about across the board on that. It's important to know that the methodology that went into the thinking of the recommendation. And although there's a lot of compelling instructional arguments that you're making that do make a lot of sense, and there's even some literature that would support adolescents going later, and I don't discount any of that. I will say that if our target is on-time student arrival, this is the schedule that would promote the highest likelihood of getting on-time student arrival.
So, just to kind of be clear, and I mean, my understanding, and I've gotten a few emails from the high school kids on this too, is that one of the reasons why they wanted to go first really was their burden after school is really big. A lot of them don't have time to volunteer. Those are big on college resumes and whatnot. Volunteering, working, sports, you know, a lot of them are having, I understand a lot of them are having to get up and be training before school instead of after to accommodate for the hour change. And so was that what some of the feedback was from them for wanting to be out early, not just to go home?
Yeah, they reflected, and I'll pop this up really quick. They reflected that as actually their number one, which was before and after school jobs and responsibilities as like their top, but honestly, their 1, 2, 3, it's effectively a dead heat. But it was important to them, and it's important to parents and staff as well. So it's interesting because the top 3 kind of was the same for all of them, just in different orders. So,
Dr. Warner, did you have any questions?
Yes, thank you, Madam Chair. Sorry, my microphone went out. I'm just a little concerned about Rising Star, mostly because our youngest learners especially just do better in the morning. 4 p.m. is a late day for them, and I'm not sure how well Head Start's going to be able to coordinate. They often share resources and staffing, and having that 2-hour time swing between those two. But I understand the logistics of moving half the county on either side of that. I'm just wondering, you know, if we can look at that again and make sure we coordinate with Head Start that this is going to be feasible.
I've actually got an answer for you right now. It will cost you 12 buses to do it at a similar time.
That's a lot of buses.
But it also explains a lot of our woes. You know, this is not a super friendly schedule for everybody. It's a schedule of sacrifice, and it's a schedule of solutions, and that's not comfortable because it's not what we're used to, and it's not what we would want. You know, if we had 600 plus buses, we could do everybody at 8:30 and get out at 3 o'clock. It would be amazing. But it is that balance of resources against logistics against instruction. And so, you know, we will make recommendations in alignment with the things that the board wants to see. So if the board wants to see a different configuration, we can come back and share that different configuration as the board contemplates its decision. But our task, and it's important to note, this is not a democratic decision. It's not best survey response wins. It was, what were the perceptions of our parents, what were the perceptions of our students, and what were the perceptions of our staff, and how does that help inform a recommendation that we would give us a longer instructional day and a better opportunity for on-time travel.
This guy?
Not to sound insensitive to the little ones going to school a little bit later, but they do have nap time, though, correct? No? I could have sworn they had nap time at, because my kid was in it, and
Back in the
she had a
day.
blanket. Okay, well, I don't know what she took her blanket to school for.
No, they did have it before.
Oh, they did have it.
Yeah, they used to have nap time.
Yeah.
Oh, yeah, that's been way for
Okay, I'm sorry.
It's 7.5.
I apologize.
Back to a 6.5 hour day, you never know.
But It was. Ms. Randall?
Yes.
Okay.
Are we still, traveling provided for IB students was something that wasn't there, now is there? Is that still going to remain as well?
Absolutely, and it's actually going to change just slightly. Instead of transporting you to your school to then catch a bus to go to another place, we're just going to pick you up and take you to that place. And then we're going to take you to your home school, and you can ride the bus home. And for our afternoon folks, we're going to take you from school to your travel school, and then from that travel school back home or back to your home school.
Okay, thank you.
Ms. Halsted, did you have another question?
My question is simply, I mean, as we're taking a look at this and we're reviewing this, this comes up for information again?
No.
No, next time it's action?
Yes.
Is that
Well,
the case?
It's really up to the board how you want to proceed. It is also, you're taking in an information item at 11 o'clock at night. You know, you may want to have it as another information item or part of a work session or something along those lines. But, you know, we're prepared to respond to questions that the board may have as you think about them over the next week or so.
Yep, that was my next question. How long do we have to give you, like, just some written feedback? Do we have, like, at least a week to get you some of our well-slept thoughts?
That's up to us, and I would suggest partially the late night, but because this is a significant change. The last time a change like this was made, there was no notice, not an opportunity for community input. So I would suggest to the board that we return this to the agenda for information once again, and then put it on for action in the
March.
first meeting in March. Is that would allow you adequate
Absolutely.
time to make any necessary changes in the scheduling?
Absolutely.
I think with so much going on right now that we really want to give the community a chance to respond.
And we're
Be-
bringing up redistricting next
Yep.
Right.
And,
Lots of things going on right now.
Yep.
All right, so we'll put that on the agenda, Ms. Hall, for information at the next meeting. All right, well, no other questions. We'll make the announcement about the next meeting. Yes, we have a special called school board meeting at 6:30 PM on February 10th, the school board work session and regular school board meeting on February 22nd, and a joint budget session with the Board of Supervisors at 5 o'clock on February 23rd, and we're now done, and it's still today.
I was just